You are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce board top-notchers and thousands of board passers across professions.
Today, let's discuss
In dynamic, innovative, and interactive review delivery. Ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review and celebrating victories together as one family. What you choose today determines your success, so make that powerful decision.
Welcome to the top.
Choose to be the top with Top Rank.
So one thing na na-help sa akin ng top rank talaga is that confidence. Nung pumasok ko, yun talaga yung nahanap ko sa top rank eh. Kasi I always question myself. And yun yung nagiging breaking point ko lagi. Imagine all those exams na every time na sobrang hirap, you try even harder. Tapos next exam, mas mahirap ulit. So you try harder again. So by the time na mag-PNLE na, parang, okay, give it to me, I can do it.
Very holistic po sila approach. Hindi lang po mentally, ano rin po sila sa physically, spiritually, and emotionally po. Tulad po sa stress management niya po.
Sa top rank kasi, na-realize ko, there's so much more to learn. Every single day na nakaupo ko sa harap ng lecturers sa top rank, they've given me knowledge na nakuha nila from their experiences as nurse. Iba kasi yung top rank, parang pag naririnig ko siya, very welcoming. Tapos yung lecturers, very engaging sa students. And then, ayun, parang everybody really cared na kailangan makapasa tayo. Nagmo-motivate kami sa isa't isa. And then, ayun, basta pag top rank, iba talaga siya. As in, ibang level. So, never ako nag-regret na nag-top rank.
Naniniwala po ako na lahat ng student may potential. Top rank was there to harness me to the fullest extent of my abilities. From giving me top-notch lecturers, top-notch materials, environment, it never came short of providing me what is the best there is for me to improve myself and to help me achieve this goal.
Top rank po kasi mag-e-enjoy ka talaga. Ang naging review ko po sa top rank is fun, enjoyable, habang natututo ka ng maraming learnings. So, minsan gigising ako in the morning, parang tinatamad ako, bad trip ako, ganyan. Then, ma-realize ko, ay teka, funny yung prof ko Parang gusto ko ma-enjoy tong araw na to. So, ang gagawin ko, papasok po ako ng top rank, then uuwi ako, good vibes na ako. Ang dami ko pang natutunan.
Out of everyone na nag-take ng board exam, ako po yung top 1. Hindi pa rin po nagsisink in totally. Bali yung mom ko po yung pinaka-inspiration ko po. Kasi siya po yung reason kung bakit gusto ko po maging successful.
Sobrang proud ako na hindi ko ma-express yung feelings ko kung ano yun. Na hindi nga, that night hindi ako nakatulog. Pero ngayon, the same pa rin, para pa rin akong naka-float. Kala ko sa TV ko lang mapapanood. Na naranasan ko pala ngayon na kahit sa kabila ng mga experience mo ng mga hardships, meron din pala talagang hope na pwede kang mag-top of all.
Thank you po.
Ha?
Thank you. Hindi ko po din akalain na magta-top 1 ako, pero sa tulong po ng top rank, nakamit ko po.
Dear Lord, we thank you for the gift of life today. You allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, trained us to be the best we can be. All that we learned at Top Rank Review Academy, we shout with pride and hands up high as victors our dreams shall soar to the sky. Trained us to be the best we can be. Soar to the sky. We learn that if you want the Top Rank Review Academy. Soar to the sky. say before I go that I just want you to know I found a reason for me to change who I used to be, a reason to start over new, and the reason is you. I'm sorry that I hurt you. It's something I must live with every day. And all the pain I put you through, I wish that I could take it all away and be the one who catches all your tears. That's why I need you to hear I found a reason for me to change who I used to be, a reason to start over new, and the reason is you. 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 I'm not a perfect person. I never meant to do those things to you, and so I have to say before I go that I just want you to know I found a reason for me to change who I used to be, a reason to start over new, and the reason is you. I found a reason to show a side of me you didn't know, a reason for all that I do, and the reason is you. A 100 days have made me older since the last time that I saw your pretty face. 1,000 lives have made me colder, and I don't think I can look at this the same. But all the miles that separate disappear now when I'm dreaming of your face. I'm here without you, baby, but you're still on my lonely mind. I think about you, baby, and I dream about you all the time. I'm here without you, baby, but you're still with me in my dreams. And tonight it's only you and me. Best thing about tonight's that we're not fighting. Could it be that we have been this way before? I know you don't think that I am trying. I know you're wearing thin down to the core. But hold your breath, because tonight will be the night that I will fall for you over again. Don't make me change my mind. I won't live to see another day. I swear it's true, because a girl like you is impossible to find. You're impossible to find. This is not what I intended. I always swore to you I'd never fall apart. You always thought that I was stronger. I may have failed, but I have loved you from the start. Oh, but hold your breath, because tonight will be the night that I will fall for you over again. Don't make me change my mind. I won't live to see another day. I swear it's true, because a girl like you is impossible to find. It's impossible, so breathe in so deep. Breathe me in, I'm yours to keep. And hold on to your words, 'cause talk is cheap. And remember me tonight when you're asleep, because tonight will be the night that I will fall for you over again. Don't make me change my mind, or I won't live to see another day. I swear it's true, because a girl like you is impossible to find. Tonight will be the night that I will fall for you over again. Don't make me change my mind, or I won't live to see another day. I swear it's true, because a girl like you is impossible to find. You're impossible to find. And I'd give up forever to touch you, 'cause I know that you feel me somehow. You're the closest to heaven that I'll ever be, and I don't wanna go home right now. And all I could taste is this moment, and all I can breathe is your light. And sooner or later it's over. I just don't wanna miss you tonight. And I don't want the world to see me, 'cause I don't think that they'd understand. When everything's made to be broken, I just want you to know who I am. And you can't fight the tears that ain't coming, all the moment of truth in your lies. When everything feels like the movies, yeah, you bleed just to know you're alive. And I don't want the world to see me, 'cause I don't think they'd understand. When everything's made to be broken, I just want you to know who I am. don't want the world to see me, 'cause I don't think that they'd understand. When everything's made to be broken, I just want you to know who I am. I just want you to know who I am. I just want you to know who I am. Today's a winding road that's taken me to places that I didn't want to go. Whoa. Today, in the blink of an eye, I'm holding on to something and I do not know why. I tried to read between the lines. I want a simple explanation. Gotta find a way out. Maybe there's a way out. Your voice was the soundtrack of my summer. Didn't know you're unlike any other. You'll always be my thunder. And I said, your eyes are the brightest of all the colors. I don't wanna ever love another. You'll always be my thunder. So bring on the rain, bring on the thunder. There's a winding road. Tell me where to start and tell me something I don't know. Whoa. Today I'm on my own. I can't move a muscle and I can't pick up the phone. I don't know. And now I'm reaching for the tall grass, longing for the breeze. I need to step outside to see if I can breathe. Find a way out. Maybe there's a way out. Your voice was the soundtrack of my summer. Didn't know you're unlike any other. You'll always be my thunder. And I said, your eyes are the brightest of all the colors. I don't wanna ever love another. You'll always be my thunder. So bring on the rain. Yeah, I'm walking on a tightrope. I'm wrapped up in vine. I think I'll make it out. You just gotta give me time. Light me up, let me feel you in my veins. I wanna let you know how much I feel your name. Today's a winding road that's taken me to places that I didn't want to go. Your voice was the soundtrack of my summer. Didn't know you're unlike any other. You'll always be my thunder. And I said, your eyes are the brightest of all the colors. I don't wanna ever love another. You'll always be my thunder. And I said, you're just getting crazy. The soundtrack of my summer. Unlike any other, you'll always be my thunder. So bring on the rain. So winding rain. Today I'm on the plane. And listen to the thunder. Honey, why you calling me so late? It's kinda hard to talk right now. okay. I gotta whisper cause I can't be too loud. Oh well, my girl's in the next room. Sometimes I wish she was you. I guess we never really moved on. It's really good to hear your voice saying my name. It sounds so sweet, coming from the lips of an angel. Hearing those words, it makes me weak. Never want to say goodbye, but girl, you make it hard to be faithful with the lips of an angel. It's funny that you're calling me tonight, and yes, I've dreamt of you too. Does he know you're talking to me? Will it start a fight? No, I don't think she has a clue. Well, my girl's in the next room. Sometimes I wish she was you. I guess we never really moved on. It's really good to hear your voice saying my name. It sounds so sweet,
Hi everyone! Good morning! Hello sa inyong lahat. Ayan. So for today, we will be discussing pre-boards 1, yung lower half. So NP 325. Okay, wait lang. Let me open my slides. Ayan. So, short introduction lang ulit. Ayan, I'm sure you know me already, pero short introduction lang. So again, I'm Shannon Felipe, graduate of UP College of Nursing and board top-notcher from November 2021 board exam. Okay, so some reminders lang. If ever you have any questions, and if ever na mabilis ako or mabagal, pakisabihan ako sa chat. Okay, I will be checking the chat from time to time. Ayan, and for these, for our session for today, there are some clarifications or corrections. Okay, so please take note of them. All right, so kapag may ibang answer sa G-Drive, paki-inform din ako. Ayan. Hi, good morning. Ang dami na palang nag-chat. Ayan. Ayun. So, okay. Ayan. Sige, mag-start na tayo. Alright. So, 51. Nurse Bart is handling a patient with Reiter syndrome. He knows that this is. Okay, so yung Reiter syndrome, it is also known as reactive arthritis. Okay, so it is formally referred to as Reiter's syndrome, a form of arthritis, yan, that affects the joints, eyes, urethra, the tube that carries urine from the bladder to the outside of the body, and the skin. So, tinatawag siya dating Reiter syndrome. Bakit? Kasi, ayan, it is named after Hans Reiter, who was believed to be a member of the National Socialist German Workers' Party, or the Nazis, and the director of the Kaiser Wilhelm Institute of Experimental Therapy na sinasubject yung prisoners dati, yung mga war prisoners, to inhumane experiment. Kaya, formerly called as siya as Reiter syndrome. Okay, so the answer here again is reactive arthritis. So the answer is boy. Okay, 5, 4, 3, 2, and 1. Okay, next. 52. Nurse Bart has just finished his assessment for a patient with Reiter syndrome. Okay, yung reactive arthritis. Which of the following should be documented? So something positive yung hahanapin natin dito. Kalang. Ayan, something positive kasi documented. Okay, so what we have to know with Reiter syndrome, it affects, it commonly involves yung asymmetrical. So one joint lang yung usually affected, and mostly affects the weight-bearing joints. Okay, so asymmetrical ang hinahanap natin dito. So X na tong 1 and 3. Ayan, tapos weight-bearing joints, so X na rin tong 4. Okay, positive tong 2. Okay, so negative, negative, negative. Okay, tendinitis naman, it is the inflammation of the tendons. Ayan, indicated rin yan sa Reiter syndrome. So this is positive. Uveitis, ito naman, inflammation siya ng uvea. Okay, so uvea is the middle portion of the eye, and it is also a symptom of Reiter syndrome. Okay, so positive yan. Sleepiness, ayan, hindi naman yan known symptom of Reiter syndrome. So it is negative. And so since positive ang hinahanap natin dito, the answer is 2, 5, and 6. Okay, and so the answer is cat. All right, 5, 4, 3, 2, and 1. Situation. As an aspiring OR nurse, it should be known that in order to have better surgical outcome, it is important that our patients are well prepared psychologically and physically before a procedure. Okay? Head nurse Minerva is teaching a novice nurse, Hermione, about interventions that should be included in the plan of care of patient Neville, 19, male with stage 2 stomach cancer, who is scheduled for Roux-en-Y the following day. Select all the interventions that should be included. So, something positive ang hahanapin natin dito. Okay, Roux-en-Y is a gastric bypass surgery indicated for weight loss. Okay? So, included dyan yung health teaching about post-op pain assessment, kahit before operation pa lang, para informed ang patient pagdating ng post-op. Okay, so positive yan. Explain to the patient how RU and Y is done. So yung explanation, di ba, it is usually done during the obtaining of the consent form, di ba? And is usually done by the surgeon and not the nurse. Okay, so this is negative. Preparing the ham that should be used for the procedure. So kailangan muna lutuin yung ham, ayan, bago gawin yung procedure. So, syempre joke yun, yung ham is the high alert medication. Okay, and it's usually prepared by anesthesiologist. Okay, or the nurse anesthetist. So this is negative. Yeah, ham is high alert medication. Hindi siya yung pagkain. So for discussion of coughing and deep breathing exercise, this is also positive. Ayan, to prevent yung stasis of secretions, if ever. So this helps in breathing, clearing the lungs, and lowering the risk for pneumonia. Okay, teaching the patient on how to turn every 2 hours. So this is also positive to prevent pressure ulcers. Informing the patient that they can eat in the recovery room. So usually in the recovery room, saglit lang sila dyan. And kapag may consciousness na sila, nililipat na sila. Consciousness or stable na sila, nililipat na sila sa ward para dun sila makakain. No? So this is negative. Discussion of events that occur in the recovery room. Ayan. So this is also taught to the patient para ma-expect ng client kung ano yung gagawin sa kanya in the recovery room, if ever. Okay? So ang answer dito ay 1, 4, 1, 4, 5, and 7. So again, the answer is cat. 5, 4, 3, 2, and 1. 54. Head nurse Albus Percival Wulfric Brian Dumbledore. Mga Potterheads dyan, ayan, magkakaroon na daw ng series ang Harry Potter. And is quizzing novice OR nurse Harry Potter about pre-op nursing duties. Okay, he asked, it is important to discuss our function as nurses in the pre-op phase. Yan. Mr. Potter, when should pre-op teaching begin? Okay, so according to Brunner and Sudart, pre-op teaching should be initiated as soon as possible. Okay, so hindi lang a day before the surgery yun gagawin. Okay, so X to. Hindi rin, napaka-short notice naman to, while the patient is wheeled on the unrestricted area of the OR. So, X yan. Kasi nga, as soon as possible dapat. Before administration of pre-op meds or during the pre-admission testing when diagnostic tests are being performed. So, saan dito yung as soon as possible? Siyempre yung C. Okay, so according kay Brunner and Sudart, ayan, pre-op teaching is initiated as soon as possible, beginning in the physician's office, in the clinic, or at the time of the pre-admission testing. So, sulat ko na dito. Okay, ayan, when diagnostic tests are performed. So, the answer is cat. 5, 4, 3, 2, and 1. 55, Nurse Draco, a novice OR nurse of the Philippine Hogwarts Medical Center, knows that an OR nurse's function regarding informed consent is to witness the patient consenting to the surgical procedure. Which of the following patients, if asked to sign the surgical consent, the consent is valid? So, tingnan natin ha. Yung A, ayan, 17 years old pa lang siya. Pero, kanina daw siya ng 2 children. Excuse me. Ayan. So, underage pa yung client. Dito sa Pilipinas, yung mga underage and mga below 18, wala pa silang kakayahan to sign a form consent. Okay, kasi nga underage pa sila. Right? Wala tayong emancipation law dito sa Pilipinas. Emancipation, yan, it is a legal way for children to become adults before they are 18. So wala tayo dito nun sa Pilipinas. So this is negative. 79-year-old with schizophrenia with delusions from time to time. So dito, since may delusions siya, hindi intact yung mental function niya. Okay, yung cognitive ability niya. So this is negative. Kasi dapat kung magsasign ng informed consent, dapat intact yan. Okay, yung cognitive function. Dito naman, 36-year-old with high-functioning autism. Sa autism, ano ba yung problema? Usually, it is the social functioning. Okay, not really about the cognitive functioning. So intact pa rin yung cognitive functioning niya. Ayan. So this is positive. Pwede naman sila mag-sign ng informed consent. Okay? 21-year-old, highly intoxicated with alcohol. Ito naman, hindi na rin intact yung cognitive function niya kasi nga highly intoxicated. So this is negative. The answer here is cat. Ayan. 5, 4, 3, 2, and 1. Okay? 56. After visiting the patient and talking for them for an hour, Dr. Ambridge, the surgeon for the operative hysteroscopy on the minimally invasive operating room scheduled for 1400, told novice nurse Harry to ask Mr. Trelawney to sign the consent form. So emphasis on the ask. Ayan. Which of the responses, if stated by the nurse Harry, will require further teaching? So we're looking for negative. Okay? Kasi further teaching. Ayan. So sa A, all right, Doc, right away. So dito pumayag siya. Sabi, all right. Ito naman sa boy, I'm sorry, Doc, I cannot ask the patient for consent because my job as a nurse is to witness them signing it. Ay, tama naman na yung job niya ay to witness yung pag-sign ng informed consent. Pero the wording here is ask. So, pwede sabihin mo, sino yung client dito? Mr. Lonnie, pwede po pa sign itong consent form. Ayan. Diba? You're just asking. Magkaiba yun sa obtaining. Okay? Yung pagkuha mismo ng consent. Possibly na yung doctor, ayan, si Dr. Ambridge, ay nakuha niya na yung consent. Pinapasign niya na lang kay Nurse Harry. Okay? Kasi nag-oo na yung pasyente. Okay? Ayan. So, ang tamang sagot dito ay all right. Okay? Or okay. Okay. Tingnan natin tong cat. Okay, Doc. Yes, tama yan. Have you explained to the patient what the surgery entails? Ayan. So, yung doctor naman talaga yung mag-explain, di ba, ng surgery. So, positive to. Okay, positive din to kasi pumayag siya. And asking lang naman and not complaining. Okay, Doc, I'll clarify any questions they ask. But if they request any additional information about the procedure, I'll call you. Ayan, so tama rin to. Right? So, ang negative lang dito ay boy. Okay, kasi the nurse can ask the patient for consent. Okay, pero obtaining talaga, getting the consent, okay, ay sa doctor yun. Ito naman ask, we can do that, okay? Yan. So, 56 is boy. 5, 4, 3, 2, and 1. 57. Head nurse Helena Ravenclaw asked the new OR nurse in training. Okay? Cho Chang, why the patient is asked to stop smoking 1 to 2 months pre-op. Choose the best option. So dito, to reduce the risk of developing hospital-acquired pneumonia. Ayan. So, to reduce daw the risk for infection, to prevent atelectasis, ayan, an impairment of the lungs defenses. Ayan, so may kinalaman ulit sa defenses, right? To prevent stimulation of the production of the pro-inflammatory cytokines which promotes inflammation, ayan, infection, defenses, inflammation, ayan. Ito naman, to reduce pulmonary and wound healing complications significantly. Okay, so base dito, similar yung A to C. Okay, and that is a test-taking strategy. Okay, ito pa. So according to Brunner and Sudart, patients who smoke are urged to stop 4 to 8 weeks before surgery, ayan, to reduce pulmonary and wound healing complications. So the answer here is dog. Okay, 5, 4, 3, 2, and 1. Okay. Nurse Jeannie must assess and document patient first use of prescription medications, over-the-counter medications, and herbal medications pre-op. Which of the following options, if taken and consumed by the patient a day before the scheduled surgery, may cause surgery to be postponed? Okay, so something negative ang hahanapin natin dito. So let's see, yung mi goreng noodles. Ayan, so yung mi goreng noodles, ayan. So since this is an instant noodle, di ba? So, meron tong preservatives. Okay, and one of the ingredients is yung garlic. Ayan. And, ayan, one component is ajuin, yung tinatawag. So, this is negative kasi meron siyang tinatawag na garlic component na ajuin, which inhibits, ayan, platelet aggregation, leading to that may lead to bleeding. Okay, so negative yung 1. How about aspirin? Ayan, we know that this can also lead to bleeding. Okay, so negative din to. Leads to bleeding. Okay. Ayan. Roasted red pepper and tomato soup. Ito naman, this is also negative. Bakit? Kasi yung red pepper, ayan, this red pepper has thinning effects, blood thinning effects that can lead to bleeding, as well as yung tomato. Yung tomato naman, this is rich in vitamin E, which is a natural blood thinner then that can lead to bleeding. Okay, so negative yan. Yung tinola naman, syempre, gumagamit din tayo dyan ng ginger, onion, garlic, ayan, which has a blood thinning effect. So this is also negative. And ingredients has blood thinning effect. Next naman, Sleepacil. Itong Sleepacil, ayan, melatonin supplement to. It's negative. Melatonin supplement that has or that may slow down blood clotting. Okay? So, ayan. This can exacerbate bleeding. Okay, Hypericum perforatum supplements, ayan. This is yung tinatawag na St. John's wort. Supplements, ayan. That may also lead to, they're known to lead to bleeding. Okay, so may risk siya for bleeding. So this is also negative. Ginkgo biloba supplements naman, ayan, this is known to slow down clotting. So this is also negative. Alright, so the answer here is all of the above. That. 5, 4, 3, 2, and 1. Okay, 59, Nurse Hermione received patient levels pre-op lab test or lab results. The patient is scheduled to have Roux-en-Y next week. Which of the following lab results would indicate the need to contact the surgeon? So, hahanapin natin ang negative kasi need to contact the surgeon. Okay, ito namang PC, which is the platelet count. Ayan. So, normally, it is 0.15 to 45. So, this is positive kasi within the normal range siya ng 0.15 to 0.45 and per liter. So this is positive. Yan. Yung hematocrit naman, ang normal na hematocrit ay 42 in males kasi Neville is a male, 42 to 52%. Okay? And this is negative kasi mababa siya. Okay, creatinine. How about creatinine? Normally, it is 0.7 to 1.4. So, this is normal. So, this is positive. 0.7, excuse me, to 1.4 milligram per DL. Ayan. Hemoglobin naman, it is normally 2.02 to 2.79 in males. So, this is negative kasi mababa siya. 2.02 to 2.79 in males. Okay? Ayan. Erythrocyte count, normally it is 4.6 to 6.2. And so mababa siya. So this is negative as well. Ayan. Yung total cholesterol. In total cholesterol naman, it is high. Okay, so it is high. Normally, it is 150 to 200 mg per DL. Okay. So it is also abnormal. Yan. So negative siya, pero tignan natin mamaya. Yung BUN naman, yung BUN, normally it is 10 to 20. So it is normal. 10 to 20 mg per DL. Yung mean corpuscular volume, ayan, it is low. Kasi normally, 84 to 96 FL siya. Ayan. So, saan dito ang mga negative natin? Yung 2, 4, ayan, 5, 6, and 8. Okay? Pero hindi natin isasama dito yung total cholesterol kasi ayan, so indicated na as compared to the other options, hindi siya important to the client's surgery. Okay, yung total cholesterol. So, yung important is hematocrit, hemoglobin, erythrocyte count, ayan, and MCV na pwedeng naka-apekto sa bleeding, okay, sa coagulation ng client. Okay, so the answer here is ulit. Okay, 5, 4, 3, 2, and 1. 16. Nurse Helena is preparing a patient for appendectomy. Vital signs are monitored every 4 hours to check for signs of ruptured appendix. It is important to remember that when appendix is ruptured, usually the blood pressure is low. Which of these options will result in accurate blood pressure reading? So, hinanap natin yung accurate blood pressure. Yung di cover the upper 1/3 of the patient's upper arm, yung indicated ay dapat 2/3 of the upper arm. So, ayan, so this is negative. The BP cuff is positioned 3 inches above the antecubital space. Ang indicated ay, ayan, 2 inches above and not 3. So negative to, dapat 2 inches siya. Okay. Using wide enough BP cuff to cover 2/3 of the patient's upper arm. Ayan, tama to. Ayan, so this is positive. This is to prevent false readings, okay? Listen carefully to the carotid cuff sounds. Take a systolic reading after the first sound while deflating the cuff at 5 mmHg per second. Okay, so ito naman, dapat i-take yung systolic reading during the first sound, okay? Not after. Tapos, yan, kailangan i-deflate yung cuff for 2 to 3 millimeter mercury per second, okay? Not 5. Okay, so this is 2 to 3 millimeter mercury per second dapat i-deflate. Okay, so the answer here is boy. 60 is boy. 5, 4, 3, 2, and 1. 61, Luna Lovegood is a recent board passer of the PNLE. Sana all, diba? Sana, ayan, I know na next month na yung board exam nyo. Okay, so, i-claim nyo na yan, gaya ni Luna Lovegood. She was recently hired on a JCI accredited hospital and was deployed on the ORDR complex of the hospital. Okay, after 3 days of training and 2 days observation, okay, she was given a chance to become the second scrub for the TABSO case, scheduled at 800. This is if the novice nurse is able to recite the entire international patient safety goals correctly. Select all the choices included in the international patient safety goals. So, positive ang hahanapin natin dito. So, we have a list of the 6 international patient safety goals. Ayan. So, ito sila. Okay. So, we have to identify the patient correctly. So, tama tong 6. Ayan, positive yan. We have to improve effective communication. Positive yang 4. Improve the safety of high alert medications. Ayan, positive tong 8. And to ensure safety. Safe surgery. So, this is positive as well, yung 1. Reduce the risk of healthcare-associated infection. And this is positive as well. And reduce the risk of patient harm resulting from fall. So, this is positive. Negative ang 2. And ang 5, kasi hindi naman indicated yan. So the answer is 1, 3, 4, 6, 7, and 8. The answer is apple. Yan. 5, 4, 3, 2, and 1. 62. Patient Neville is very anxious about his upcoming surgery to the point where he's having a severe anxiety symptoms. Dr. Ambridge ordered Xanax 0.5 milligrams every 8 hours to alleviate the patient's anxiety. Nurse Hermione gave the medication, and after an hour, the patient requested to void. Which of the following actions should the nurse take? Okay, so something we have to No, yung Xanax, it is a benzodiazepine. Yan. So, since may anxiety nga si client, ayan. So, it is an anxiolytic, which has a side effect of lightheadedness and drowsiness. Okay, yung Xanax. So, kapag magre-request siya to void, ayan. Siyempre, kung tumayo yan, there's risk for falls or injury. Kaya, ano gagawin ng nurse dapat? Hindi naman kailangan mag-insert ng indwelling Foley catheter, ano? So, hindi kailangan yan. Yan, kasi nakakaihi naman ang client, nakaka-void naman siya. Assist the patient to the comfort room. Offer the bedpan or urinal to the patient or allow the patient to go to the bathroom. Kung mapapansin natin dito, test-taking strategy. Similar ang PNP. Yan. So, these are wrong. Mali din to kasi kahit na i-assist mo pa yan, ayan, meron siyang risk for falls or injury dahil nga meron siyang drowsiness or lightheadedness. Kaya hindi natin siya i-allow or i-assist sa comfort room or bathroom. You can offer a bedpan or a urinal to the patient, ayan, to ensure safety. So, the best answer here is cat. Okay? 5, 4, 3, 2, and 1. 63. Nurse Harry received new pre-op medication orders from the anesthesiologist assigned to his patient's case. Which of the following medication, if administered, will be able to minimize pulmonary secretions? Okay, so yung meperidine, ayan, this is indicated for moderate to severe pain. Yung diazepam naman, this is to treat anxiety, alcohol withdrawal, and seizures. Okay, not really about reducing the secretions. Okay, promethazine, this is to prevent nausea and vomiting. Ayan. And yung last, wait lang, to prevent nausea. Atropine sulfate naman, this is to block nerve stimulation of muscles and glands and relax smooth muscles and increase heart rate, reducing secretions. Okay. So the answer here, since atropine sulfate reduces secretions, this is the answer, okay? Ayan. 5, 4, 3, 2, and 1. Situation, keeping our patients safe is one of the highest priority of a healthcare professional. As a future OR nurse, we need to remember that standards are to be followed in order to make a procedure safer. It is also important to be knowledgeable about intra-op functions in order to have a safe and effective surgery. As a novice OR nurse, Nurse Adrian needs to remember that collaboration and teamwork is essential for the surgical team to function well. Naturally, when you are a novice nurse, you are often asked or quizzed by senior nurses to assess your knowledge regarding the unit. The charge nurse of the unit asked Nurse Adrian who are the members of the surgical team. So, sino-sino daw ang members ng surgical team? Select all that apply. So, according to Brunner and Sudart, ayan, the surgical team consists of the patient, ayan, the patient, sa positive to, anesthesiologist and anesthetist, ayan, anesthesiologist and, mali yung, anesthesiologist, ayan, and anesthetist, the surgeon, yung mga nurses, we have the scrub nurse and the circulating nurse and the surgical technologist or the assistants. Okay, so the answer here is all of the above, Kat. 5, 4, 3, 2, and 1. 65, Novice Nurse Mando is already 2 weeks on the OR mean. Nurse Mando is about to try being the second scrub nurse for the first time. Before he is allowed to scrub, he needs to know the nursing responsibilities that should be performed by the scrub nurse. Select all that apply. Okay, so monitors aseptic practices of the whole sterile team. Ayan, so habang ina-assess ni scrub nurse yung doktor, nag-hand out siya ng mga instruments, ganyan. Kaya niya pa bang i-monitor yung aseptic practices of the whole sterile team? Hindi na. This is usually a function of the circulating nurse. Okay, so this is negative. Setting up the sterile table, preparing sutures, ligatures, and other special equipment. Of course, this is done by the scrub nurse. Ayan, anticipating the instruments and supplies that will be required during the procedure. This is also done by the scrub nurse. So positive yan. Counting all sponges, needles, and instruments used during the procedure. Ayan, positive din to. To know if may naiwan ba sa pasyente. Continuously tracking the irrigation solutions used during the procedure. Okay, so sila lang naman yung nakakita direct kung gaano karami na yung irrigation na nagamit. So this is positive as well. Passing instruments to the surgeon and surgical assistant. So positive to. Next, second verification of the surgical procedure inside. Ayan. So, according to Bruno and Sudart, yung gumagawa ng second verification ay ang circulating nurse. So, this is negative. Okay. Ay, wait lang. Ayan, tama. Coordinating the flow and activities of the whole surgical team. This is for the circulating nurse. Okay, so negative yan. Labeling tissue specimens obtained during the procedure. This can be done by the scrub nurse. Okay, so positive yan. So the answer here is dog. Okay, 2, 3, 4, 5, 6, and 9. Yeah, tama naman. Okay, 65 dog. 5, 4, 3, 2, and 1. Here we go. 66. Dr. Skywalker proceeded with marking the surgical site in the OR. Circulating nurse Astoka asked the patient to confirm the surgical location just as the anesthesia was being inducted by Dr. Boba. The scrub nurse, Grogu, proceeded with rolling the instruments to the side of the OR table before timeout. How many mistakes were done? Okay? So, tingnan natin kung ano-ano ba yung mga mistakes. Unang-unang mistake dyan ay ginawa niya yung pag-mark ng surgical site sa OR. Okay, ideally, the surgical site is marked while in the ward pa lang. Okay, so this is the first mistake. Okay, second mistake naman, ayan, yung pag-confirm niya dapat before the induction of the anesthesia kasi possibly maging lightheaded na yung client, okay, maging groggy na siya during the induction of the anesthesia. Hindi niya na ma-confirm yung surgical location. Okay, so this is the second one. The scrub nurse proceeded with rolling the instruments to the side of the OR table before timeout. Dapat, yung pag-roll ng instruments, ideally, it is done when the timeout is finished already. Okay, so not before timeout. Alright? Okay, so, tatlo yan. The answer is boy. Okay, yung timeout, it is the time before skin incision. Okay? So, ayan, dapat ideally yung pag-roll out ng mga instruments, ginagawa yan kapag tapos na yung time before the skin incision. Okay? Ayan. So ideally yun yung indicated. So 66 is boy. 5, 4, 3, 2, and 1. The case that Nurse Grogu scrubbed in is about to end. Final counting should be done, ayan, before closing the skin. In what order does Nurse Grogu do the counting? So according to the International Federation of Peri-Op Nurses, the counts should be performed in the same sequence. So ano yung sequence na yon? Ayan. Sponges muna. So X na to kaagad yung A and B. Sponges, sharps, ayan. Miscellaneous items and instruments. Ayan. So the answer here is CAG. Okay, 5, 4, 3, 2, and 1. 68. A novice nurse Jawa is observing the OR case that Nurse Grogu is scrubbed in. The circulating nurse asks Nurse Jawa the proper way of counting. Choose the correct answer. So yung pagka-count, ayan, ginagawa yan. Ano yung sequence ng pag-count natin? Usually, yung mga instruments muna na nagamit na. Okay? Para ma-make sure na present sila. Okay? So, yung pag-count natin ay from the dirtiest to the cleanest. Okay? Dirtiest meaning nagamit na. Okay? We should ensure na nandyan pa rin sila and wala sa patient. Okay? So, yung pag-count natin dapat nagsistart from the dirtiest. Ano yung dirtiest dito? Yung operating field. Okay? Yan. So, X na tong boy and dog. Okay? From here, kasama kasi usually ang back table. The back table is the cleanest, okay? So the answer here is apple. Okay, 68 is apple. 5, 4, 3, 2, and 1. 69. When observing the OR case, novice nurse Jawa is asked by the circulating nurse, when does the first counting start? Okay? So yung first counting, nagsa-start lang yan once the operation started already. Okay? Not before the procedure or operation yan. Itong before the procedure or operation or upon setup, this is called the initial counting. Initial counting pa lang yan. Pero yung officially yung pag-count mismo, ayan, yung first counting, ayan, it is done before the closure of the cavity. So this is the first counting. Second counting naman before the closure of the fascia. Okay? And at skin closure, ayan, this is the final counting. Okay? Ayan. So the answer here is boy. 5, 4, 3, 2, and 1. 70. Scrub nurse Grogu noticed during the second counting. Ayan, ano yung second counting natin? It is the closure of the fascia. That there is one missing sponge. Okay? Before, repeating counting was done multiple times, but there is really one sponge missing. Okay, nag-repeat counting na sila multiple times. Despite the circulating nurse's efforts to look for any sponges that are down, the circulating nurse finds none. Okay, so hinanap na rin daw sa environment ng OR. What is the most appropriate action to be done? So, X na tong C kasi ginawa na nga yan multiple times. Okay, yung pag-recount. Don't do anything and keep quiet the whole time. So, syempre, di ba, X to? Kasi dapat may gawin tayo as nurses. So, between A and B, ano yung appropriate action natin? Most appropriate action natin. Syempre, kailangan muna nating tanungin sa surgeon, ayan, if they know where the sponge is. Okay? So, kapag wala rin makita ang surgeon, then that's the time we call the rad tech. Okay? To use the x-ray to look for the missing sponge. Okay? So, the answer here is boy. 5, 4, 3, 2, and 1. Yes, very good. Okay, 71. Nurse Quill was asked to scrub on CS scheduled at 400. The patient was wheeled in the OR room at 4:05 and induction of spinal anesthesia was finished at 4:20. As an OR nurse, Nurse Quill has to be aware regarding complications that the patient might experience during induction of the anesthesia. Which of the following is the most dangerous complication during induction of anesthesia? Ayan. So yung most common complications ay yung postural, puncture, headache, and hypotension. Okay? Ayan. So yung hypotension, it is the most dangerous complication of induction of anesthesia, of spinal anesthesia. This is due to the paralysis of the vasomotor nerves. Okay? So the answer here is dog, hypotension. Ayan. 5, 4, 3, 2, and 1. Another patient is about to undergo hysterectomy on OR3. The attending surgeon asks you to prepare chromic 2 suture. During the procedure, how are you going to serve the suture? Okay, so yung chromic 2 suture, it is an absorbable and non-synthetic suture. Ayan. And what we have to know with this is that it has to be served wet. Kasi kapag dry siya, it is very stiff and may cause handling problems for the surgeon. Okay, so yun natin yung options. Do not wet. Dapat nga i-wet, diba? Kasi magkakaroon ng handling problems. Wet but do not soak yet if not in use. So tama to. Kasi kung ini-soak na siya while not in use, ayan, pwedeng ma-decrease yung tensile strength ng suture. Okay, and mag-cause pa yun ng breakage sa suture kapag nilagay na. Alright? Ito naman, iwa-wet mo tapos ito-try mo ulit. Ano yun? So, X yan. The answer is apple. 5, 4, 3, 2, and 1. 73. It is important for a scrub nurse to be able to anticipate the instruments and materials to be passed onto the surgeons during the procedure. After the second counting of the hysterectomy case, the scrub nurse should anchor the next suture to be used on the needle holder. Which of the sutures should she use? Okay? So after, yung second counting kasi, it is done at the closure of the fascia. So after second counting is after closure of the fascia. After the closure of the fascia, ano ba yung next na kino-close? It is the closure of the subcutaneous layers. Subcutaneous layers. Ayan. And then after i-close yung subcutaneous layers, ang skin na yung next na i-close. Okay, which is, or the final counting happens. Yan. Okay. So, ano daw yung suture na gagamitin natin dito? Okay? So, yung Vicryl, ayan, this is best used for tying blood vessels. Okay? Ayan. Yung Monocryl naman, this is best used for skin closure or closure of the skin. So, sa final counting na to. Novosin, yan, this is the best for closure of the fascia and the subcutaneous layers. Okay, wait lang. Okay, how about yung D, Vicryl? Vicryl na may blunt needle. Ayan, this is used for, best is for closure of the peritoneum. Okay, so, ang hinanap kasi natin dito, closure of the subcutaneous layer. So, the answer here is cat. Okay, 5, 4, 3, 2, and 1. Usually na pang what I normal saline. Okay, ayan. Kasi may nagtatanong dito. Ano pong pang what dyan, ma'am? Ayan. So, 73 is cut. 5, 4, 3, 2, and 1. It is important for a scrub nurse to be able to anticipate the instruments and materials to be passed onto the surgeons during the procedure. So, ganun ulit. After the closure of the subcutaneous layers of the hysterectomy case, the scrub nurse should anchor the last suture to be used on the needle holder. Which of the sutures should she use? So, after the closure of the subcutaneous layer, ayan, i-close na yung skin, di ba? So, saan dito yung best for closing the skin? It is the Monocryl for cutting needle. Okay? Again, this is yung option 8 is for tying the blood vessels. Yung Novosin naman, 2-0, ayan, tapered needle. It is best for closure of the fascia and the subcutaneous layers. Vicryl 0, blunt needle for closure of peritoneum. Okay, so 74 is okay. 5, 4, 3, 2, and 1. 75. There are many different types of anesthetic agents used during surgery. Local anesthesia is mostly used for minor surgeries, and usually the patients are awake during this type of procedures. Local anesthesia is often administered with what drug? Okay? So, yung anesthesia kasi, ayan, generally, kailangan niyang ng slow absorption. Okay? Kasi kapag nagkaroon ng fast absorption, it may cause seizures. Okay? So, ano ba dito ang drug na nagkakos ng slow absorption? That is epinephrine, which causes vasoconstriction, okay, of the blood vessels, leading to slow absorption. Alright, so 75 is dog. 5, 4, 3, 2, and 1. Pwede niyong kabisaduhin. Ma'am, advisable po ba na kabisaduhin po yung mga types of needle? So as much as possible, di ba? Mas marami kang alam, mas maganda. So I suggest yung mga nandito, ayan, dito sa exam na to, mas maganda kung alam natin yung what is it best used for. Okay? Ayan. So 75 is dog. 5, 4, 3, 2, and 1. 76. Malignant hyperthermia is a rare inherited muscle disease wherein the patient has a severe reaction that is chemically induced by anesthetic agents. Okay? Which of the following anesthetic agents, if used, will lower the patient's risk of having this kind of action? Okay? So itong enflurane, ayan, and succinylcholine, both of them triggers malignant hyperthermia. Okay, so it will not help in lowering the risk of having malignant hyperthermia. Triggers malignant hyperthermia. Okay, yung succinylcholine, ganun din. So, copy natin. Yung epinephrine naman, this induces or intensifies malignant hyperthermia. So this is not the correct answer as well. Yan. Yung fentanyl, this doesn't trigger. So this is the best answer. Okay? Ayan. So the answer is dog. 5, 4, 3, 2, and 1. Malignant hyperthermia causes a fast rise in the body temperature and severe muscle contractions. Which of the following manifestations will alert the intra-op nurse that the patient is experiencing early sign of this reaction? Okay, so, ayan, something we have to know, yung earliest sign of malignant hyperthermia is not about the temperature, but of the heart, okay? Tachycardia. Tachycardia is often the earliest sign. So the answer here is heart rate of 200 beats per minute. Okay, ayan. 77 is apple. 5, 4, 3, 2, and 1. Need mag-slow ng absorption ng anesthesia kasi a fast absorption can lead to seizures. Okay? Yan, 77 again is apple. 5, 4, 3, 2, and 1. Situation during the post-op phase, the OR nurse focuses on harmonizing the patient's physiologic equilibrium, alleviating pain, preventing complications, and educating the patient regarding self-care. After CS, the patient was immediately transferred to the recovery room. Upon arrival, the patient notified Nurse Joelle, the RR nurse, that they felt slightly nauseous. Which of the following choices is the best action? So si client, ayan, slightly nauseous daw siya. So kapag ganyan, may risk na yan for vomiting that can lead to aspiration. So ano yung best action natin dito? Explain to the patient that this is due to the effect of the anesthesia. Ayan, pwede natin gawin yan, pero hinahanap kasi is best action, okay? Best action is preventive dapat tayo. Assess the patient and offer emesis basin. Ayan, pwede naman din na mag-offer ng emesis basin. Turn the patient to the left side. Yan, positioning to prevent aspiration. Or offer patient small ice chips as order. Ayan, this helps with the nausea, yung small ice chips. Okay, so all of these are possible actions that the nurse could take. Okay, so ano yung best dito? Siyempre yung prevention ng aspiration. Okay, so ang answer dito ay turn the patient to the left side. And to promote mouth drainage and prevent aspiration of vomitus. Okay, so 78 is cat. 5, 4, 3, 2, and 1. Okay, 79. Post-op nausea and vomiting is a common occurrence in the back. PONV happens due to many factors. Most commonly, it happens due to the anesthesia used during the surgery, especially when general anesthesia is used. Okay, which of the following options is the best medication for PONV? Ayan. Okay. So yung metoclopramide, this is used for nausea and vomiting in patients with GERD or diabetic gastroparesis. Okay, gastroparesis meaning paralysis of stomach. Okay, so it is a treatment of nausea and vomiting, pero not really about the post-op nausea and vomiting, okay? Usually for GERD or diabetic gastroparesis siya. Yung metoclopramide. Propofol naman, yan, this is for procedural sedation or as an induction agent for general anesthesia. Okay, so wala siyang effect sa nausea and vomiting. Okay. Yung promethazine, this is used to treat allergies, insomnia, and nausea. Okay, pero ang indicated talaga, ayan, yung most effective antiemetic with a few side effects and is frequently the drug of choice for PONV is ondansetron. So the answer here is apple. Okay, 5, 4, 3, 2, and 1. 80, Nurse Ellie is an emergency department nurse. A previous OR patient returned to the ED asking for help regarding their deep laceration wound, which was fixed a few days ago on the OR of your hospital. Upon assessment of the wound, you notice that it is red, warm, and a slight pus leaking from it. After notifying the doctor, the stitches were removed and the wound was cleaned and packed with gauze. The doctor plans to have the patient return the next day for the removal of packing and suturing of the wound. The wound will now heal by what? Okay, so kapag sinabing first intention, yan, the wound is sutured, stapled, glued, or otherwise closed so the wound heals beneath the closure. Okay, yan yung first intention. How about second intention? Second intention naman, wala ginagawa sa wound. The wound is left to heal naturally. Okay? Kasi yung first intention, kinukuha siya. Yung third intention naman, the wound has to remain open and is reopened due to an infection. Ayan. Wound is sutured again after the infection is resolved. So this is in the third intention. Okay? So wala namang late intention. So X yan. So dito nagkaroon siya ng slight pus leaking from it. So this indicates infection. The answer here is boy, third intention. Okay, 80 is boy. 5, 4, 3, 2, and 1. 81. A 1-month post-thrombectomy stroke patient is about to be discharged from the hospital. However, the doctor postponed their discharge orders because they want the patient's pressure ulcers to heal first before going out of the hospital. This type of wound healing is what? Okay, so wala namang sinabi dito na may ginawa sila. Hindi naman nila kinlose, hindi naman nila ni-resuture. Ayan, so hindi yan first intention. Hindi rin yan third intention. Wala namang late intention. So this is second intention where the wound is left to heal naturally. Okay? Ayan. So 81 is 5, 4, 3, 2, and 1. 82. Post-op assessments are important before discharging the patient from the PACU to the unit. This is done to prevent potential surgical complications from occurring. Which of these assessment tools are used to determine the patient's readiness to be transferred out of the PACU to their designated unit? Ayan. So yung GCS or Glasgow Coma Scale, this is used for the evaluation of consciousness and overall status of the central nervous system. Okay, so hindi yan yung sagot natin. Okay. Yung Apfel score naman, this is used for the risk stratification of the post-op nausea and vomiting. Okay, and yung Apfel score. Yung Bromwich score naman, this is used to assess the intensity of the patient's ability to move the lower extremities. Okay. The intensity of the motor block by the patient's ability to move the lower extremities. Yung Aldred score, this is the answer. This is also known as the post-anesthesia recovery score or PAR score. Ayan. That is used to determine the patient's readiness to be transferred out of the PACU. Okay, so the answer is DOG. 5, 4, 3, 2, and 1. 83. After 4 hours, a post-op heart surgery patient's readiness for transfer scoring is 7. What is the most appropriate action? Okay, so according to the PAR score, ayan. And so paano ba natin malalaman kung possible na ma-discharge na yung patient from the PACU? Kapag may score na siya ng 7 to 10. Okay? Yan. So the required Aldred score for patient to be discharged from PACU is 7 to 10. Less than 7, they must remain in the PACU and until their condition improves or they are transferred to the ICU. Okay, so since the client score is 7 already, ayan, so hindi naman tayo zone-zoo anything. Ayan. Hindi naman siya kailangan na i-transfer sa CICU or sa central ICU. Yan, kasi nga 7 siya. Hindi mo naman siya kailangan i-monitor closely. Okay? Kasi, pwede na nga siyang ma-discharge eh. So, possibly stable na yung client natin. So, notify the physician and prepare the patient for transfer to the med-surg unit or the ward. Okay, so 83 is cut. 5, 4, 3, 2, and 1. Saan to? And so, paki-take note na lang yung question. Okay? Yan. 5, 4, 3, 2, and 1. You are an ICU nurse. You receive a call from the PACU about a post-nephrectomy patient to be transferred to room 18. What is the most important nursing action? So you just received the call, ayan, and to be transferred pa lang ang pasyente. So wala pa ang pasyente sa room 18. Okay? Ayan, so ano daw ang gagawin mo? Papunta siya sa ICU. Okay? So since hindi mo pa itong magawa, yung B, C, and D, kasi wala pa yung patient, hindi mo pa ma-assess yung airway niya, yung tubes, yung dressing, ayan. So, ang best answer dito ay clean and prepare the room. So, 84 apple. 5, 4, 3, 2, and 1. 85, you are a PACU nurse assessing a 34-year-old patient that underwent exploratory laparotomy 4 hours ago. Which assessment tool is the best tool to use to assess the patient's pain? Okay? So dito, ayan, yung nominal scale and Likert scale, these are used in research, okay? Not really an assessment tool. So between A and B, ano yung best answer dito? So, kung makikita natin dito, 4 hours ago pa lang nangyari yung exploratory laparotomy ng client natin. Possibly, ayan, nag-wear off pa lang yung anesthesia. Okay, so groggy or drowsy yung pasyente natin and hindi pa siya makapag-isip ng masyado. Okay, so ang best tool na gagamitin muna natin ay yung Wong-Baker's Faces Pain Scale, Pain Rating Scale. Okay, pwede ituro lang ng pasyente kung ano yung face na, hindi. Pwede natin makita sa face ng pasyente kung ano yung pain na nararamdaman niya. Okay, that is the Wong-Baker's Faces Pain Rating Scale. Itong numeric pain rating scale, ayan, 0 is the lowest pain and 10 is the highest pain. Ayan. So 85 is 5, 4, 3, 2, and 1. Sabi ito, kapag basta adult, ay may nagtatanong yung classmate dito, so hindi ba ma'am, basta adult numeric kasi pambata raw po yung Wong-Baker's. So ito naman, ayan, usually used ang Wong-Baker's Faces Pain Rating Scale sa bata, pero hindi naman sinasabi na hindi siya pwede sa matanda. Okay? Ayan. Hindi naman siya limited to pediatric use. Ayan. So 85 po eh. 5, 4, 3, 2, and 1. 86. Use the Aldred score to determine if the patient is ready for discharge from the PACU. Okay, patient can move both arms and on room air with 97% O2 sat, able to do coughing and deep breathing exercise. Current BP 160/90 and pre-anesthesia BP is 120/80. Is watching FPJ's Ang Provinciano on the TV intently while eating his dinner. Okay, so ito yung pointing system for the Aldred score. Okay, so dito, makikita natin yung patient can move both arms. So saan yun dito? Sa activity yon. The client is able to move 2 extremities. So 1 yung score niya. Room air with 97% O2 sat. Ayan. So ang scoring niya dyan ay 2. And then do coughing and deep breathing exercise. The answer is, the point is 2. Current BP, 160/90. And ito naman yung computation ng sa circulation, yun yung percentage. Ayan. How do we compute for that? First step is to find the difference ng systolic. So 160, yung current minus yung pre-anesthesia. So 160 minus 120 is 40. And then divide this by the pre-anesthesia systolic BP, which is 120. So 0.33 yan times 100, magiging 0.33%. Ayan. More than the pre-anesthesia BP, yung current BP niya. Okay, so the answer here is, or the score is 1. Alright? Tapos watching FPJ's Ang Provinciano on TV intently, ayan, fully awake ang pasyente. So i-add natin yan lahat. 1 plus 2, is 3, plus 1, 4, plus 2 is 6, plus 2 is 8. So the answer here is cat. Okay, 5, 4, 3, 2, and 1. Okay. Lang, ano yung sabi niya dito? Ma'am, ask ko lang po bakit hindi A ang sagot sa 85? Okay, kasi ito, possibly, ayan, 4 hours ago pa lang yung exploratory laparotomy, possibly, nag-wear off pa lang dyan yung anesthesia. So, groggy pa yung pasyente. Okay, that may affect the memory and concentration. Okay, for a day or 2. Right, yung anesthesia effect. Okay, kaya, hindi mo muna pag-iisipin yung kliyente kung ano yung score ng pain niya. Okay? Kung, ano ba, 5 ba, 6 ba, 7, ganon. Alright, 0 is lowest and 10 is highest. So, mas maganda kung from observation, your observation as a nurse, titingnan mo yung face nila and doon natin i-determine yung pain nila. Okay? Ayan. 4 hours ago pa lang yung surgery. Okay, so 86 is cat. And then ito next, ayan, use the Aldrich score. Ganun ulit. So tingnan natin. If the patient is ready for discharge from the PACU. So the patient can move both arms. So ulit, that is a score of 1. Okay. On nasal cannula with 97% O2 sat. Okay, kapag may nasal cannula na, ayan, meron na siyang needs O2 inhalation to maintain O2 that is greater than 90. Okay, so ang score niya dyan ay 1. And able to do coughing and deep breathing, this is 2. Current BP is 90 and pre-anesthesia BP is 120. So, current minus pre-anesthesia is negative 30. Ayan. And then divide mo yan by the pre-anesthesia, which is negative 0.25. So, negative 25% ang sagot. So, current BP is 25% less than the pre-anesthesia BP. So, the answer here is, or the score is 1. Alright? Awaken to pain. Ayan. So, this is arousable. Okay? On-calling nakasulat dito, pero kasi yung 0 is not responding. Hindi naman din siya fully awake. So, the score is 1. So, i-add natin yan. 1 plus 2 is 3. 3 plus 1 is 4. 4 plus 1 is 5. 5 plus 1 is 6. So, the answer here is dog. Okay? 5, 4, 3, 2, and 1. Yung effect ng anesthesia, usually nag-last pa yan ng, ng 1 to 2 days. Okay? 1 to 2 days. 5, 4, 3, 2, and 1. Situation, you are a student nurse that will rotate in the neuro ward as part of your preparation. As part of the preparation, you review the parts and functions of the nervous system. The motor system is complex and motor function depends on the integrity of the cortico-spinal tracts. Okay? Ayan, the extrapyramidal system and cerebellar function. The voluntary motor system consists of 2 groups of neurons, the upper motor neuron and the lower motor neurons. You know that the upper motor neuron lesions manifest. Ayan. So ito, yung table dito, this compares the manifestations or the symptoms of the upper motor neuron and lower motor neuron lesions. Okay, yung loss of voluntary control, ang hinanap kasi natin dito, upper. Okay, so positive yung upper, negative yung lower motor neurons. Okay, so positive to, loss of voluntary control. Ayan, dito siya sa upper. Increased muscle tone, sa upper rin yan. Absent or decreased reflexes. Yan, this is in the lower. So, negative to. Decreased muscle tone naman. Yan, this is in the lower. So, negative to. Muscle spasticity is in the upper. So, positive. No muscle atrophy is in the upper. Excuse me. Flaccid muscle paralysis is in the lower. Muscle atrophy is in the lower, and hyperactive and abnormal reflexes is in the upper. Okay, so ang sagot dito ay apple, 1, 2, 5, 6, and 9. 5, 4, 3, 2, and 1. The spinal nerves are composed of a total of how many pairs of spinal nerves? Ayan, so actually, dapat spinal cord yan. Spinal cord. Sige, ipahinan natin. Ay, mali. Dapat spinal cord to. Yan. So, total of ilang pairs ng spinal nerves yung spinal cord? It is the 31 pairs. Okay? So, sinasabi na the spinal cord is composed of 31 pairs of spinal nerves. May 8 na cervical pairs, 12 thoracic, 5 lumbar, and 5 sacral, and 1 coccygeal. Okay? So, 89 is 31 dog. Right? 5, 4, 3, 2, and 1. 90. The cerebral circulation receives how much of the cardiac output? Okay? So, sinasabi na yung cerebral circulation, it receives approximately 15% of the cardiac output or 750 ml per minute. The brain does not store nutrients and has high metabolic demand that requires high blood flow. Okay, kaya 750 ml ang kailangan. The answer here is boy. 5, 4, 3, 2, and 1. 91. CSF, a clear and colorless fluid, is with a specific gravity of, okay, so it is indicated na yung CSF ay may specific gravity na 1.007. Okay, it is produced in the ventricles and is circulated around the brain and the spinal cord through the ventricular system. Okay, so the answer here is apple. 5, 4, 3, 2, and 1. Situation. You are a nurse at the ER. You have noted that over the past few months, there is an increased number of patients brought to the ER due to stroke. A patient arrives at the emergency department with slurred speech, right facial drop or droop, and right arm weakness. Which of these actions by the healthcare provider is the priority? So priority here is, tingnan natin yung options, immediately refer and transfer to the patient to the neuro ICU, neurological care unit. So, ito ba yung priority natin ay mag-refer? Hindi muna, di ba? So, X yan. Dapat may gawin muna tayo sa pasyente. Prepare to administer thrombolytic medications or prepare the patient for CT scan of the head or call for the speech pathologist to assess the patient. So, yung best answer dito ay yan. So, hindi muna tayo tatawag ng speech pathologist. Ayan, para mag-reassess daw. So, hindi naman. Hindi yan yung pinaka-priority natin. But to prepare the patient for a CT scan. Kasi dito, dinidetermine niya kung ang stroke ba ng pasyente ay hemorrhagic or thrombolytic. Okay? If thrombolytic, then we have to prepare to administer thrombolytic medications. So the answer is CAT. 5, 4, 3, 2, and 1. Yes, very good. A patient who is recovering from a cerebrovascular accident is experiencing bladder distension, urinary frequency, oliguria, and leakage of urine. The healthcare provider suspects these findings are related to which of these urinary problems? Okay. Wait lang. Okay. So yung BPH or benign prostatic hypertrophy, ayan, this is a condition in men in which the prostate gland is enlarged and not cancerous. Okay, ayan. Sa prostate gland siya. Stress incontinence naman, this happens when physical movement such as coughing, laughing, ayan, sneezing, running, or heavy lifting puts pressure or stress in the bladder, causing the patient to leak urine. Okay, so that is stress incontinence. Lagyan na lang natin dito pressure. Pressure on bladder leading to leakage of urine. Yeah. Okay. And then overflow incontinence naman. Yan. This happens due to weak bladder muscle or blockage, kaya nagkakaroon ng overflow. So, merong urge pero hindi niya mailabas. Okay? Only a small amount of urine is released. Okay. Ayan. Wait lang. So, this commonly happens as a result of stroke kapag nagkakaroon ng bladder atony. So, may weak bladder muscle. Ayan. So, this is overflow continence. Wait lang. Sulat ko lang din dito. Ayan. Urgent incontinence naman, if the patient feels a sudden and very intense need to pass the urine and unable to delay going to the toilet. Okay, so yun lang yung urge incontinence. Sudden and very intense need to pass the urine. So ang answer dito ay, kasi from A, CVA, ayan, that can cause bladder atony. Okay, so the answer here is overflow incontinence. Okay, due to a weak bladder muscle or blockage. Ayan. So merong overflow, hindi niya kasi malabas. Okay, meron siyang urge pero small amount lang yun na ilalabas. So 93 is cat. 5, 4, 3, 2, and 1. Okay, next. A patient who has been diagnosed with cerebral vascular accident is experiencing right homonymous hemianopia. Which of the following images reflect how this defect affects the patient's visual field? Okay, so yung white dito, ayan. Yan yung blind part. Okay? Right meaning, yung right side yung blind. Okay, right side yung blind. X na tong apple kasi wala naman siyang blindness, di ba? So, X na tong apple. Okay? Homonymous meaning the same side. So, same right side ang affected. And hemianopia, partial blindness of the eye. Okay? So, same na right side dapat yung blind niya. And saan yun dito? Ito kasi left and right yung blind dito sa PS. So, X to. Ito naman, left side lang. Ito, right side. So, this is the answer, dog. Okay? Ayan. So, right homonymous hemianopia. 5, 4, 3, 2, and 1. 95. A patient with a history of transient ischemic attack is prescribed low-dose aspirin daily. Which of the following statements made by the patient indicates teaching about this medication has been successful? So, we're looking for something positive. Okay? Wait lang. And so one adverse effect that we know regarding aspirin is ototoxicity. Okay, so tingnan natin yung options. I should use the enteric-coated aspirin to reduce the risk of bleeding. Ayan. So hindi naman siya. Yung aspirin kasi, enteric-coated tablet siya that can decrease stomach irritation. Ay, wait lang. Wait lang. So dito naman, wait lang ha. Kapag sinabing enteric-coated, ayan, it can decrease stomach irritation, pero wala siyang effect sa platelet activity. So, hindi niya rin ma-reduce ang risk of bleeding. Okay? Ayan. Pang-reduce lang to ng stomach irritation, pero hindi niya ma-reduce yung risk for bleeding. So, this is negative. Okay, I will call the clinic if I experience a ringing sound of the ear. So, this is positive kasi aspirin can cause ototoxicity. I can stop taking my rosuvastatin now that I'm taking aspirin. So ito naman, mas maganda kung yung lipid lowering medication niya, such as yung rosuvastatin, ay ginagamit niya along with aspirin. Okay, so hindi niya naman kailangan i-stop yan. So this is negative. I experience stomach upset. I can take aspirin with an antacid. Okay, so kapag may nangyayaring stomach upset, okay, pwedeng i-take yung aspirin with food but not with an antacid. Kasi this will decrease the absorption of the antacid. Okay, it will decrease the absorption of the aspirin. Okay, yung antacid. Okay, so negative din to. The answer here is why? Kasi meron siyang ototoxic effects. Alright, so 95 is why. 5, 4, 3, 2, and 1. Anong meaning? Ma'am, paulit-ulit ng meaning. Okay, anong meaning? Saang slide to? Okay. Sige, 95 is point. 5, 4, 3, 2, and 1. 96, the patient receives thrombolytic 94 po sana. Okay, sige. So yung right right side yung blind. Okay, homonymous, meaning same side. Homo, di ba, same. Okay? Kapag hetero, opposite. Okay, kapag homo, same. Same side yung, same side ng eyes yung blind. Okay, which is your right. So, same na, right side yung blind. Okay, hemianopia, meaning, partial lang siya na blind. Okay? Ayan, hemi. Ibig sabihin partial. Okay, ayan. So, 5, 4, 3, 2, and 1. Okay, 96, the patient receives thrombolytic therapy after experiencing an embolic stroke 24 hours ago. Okay, which of these interventions will the healthcare provider include in the plan of care? So, something positive yung hahanapin natin dito. Ayan. So, thrombolytic therapy meaning the breakdown of blood clots formed in the blood vessels. So, ano daw i-include natin? Cluster patient care activities within a narrow time frame. So, ang recommended ay hindi clustered. Okay, hindi isang bagsakan na activities for the patient. Okay, tsaka narrow pa yung time frame dito. Okay, as much as possible, di ba? Hindi mo ililimit yung time frame. So, this is negative. Position the patient's head in neutral position. Yes, this is positive. This maintains both blood flow to the brain and venous drainage from the brain. Okay, so positive yan. Monitor blood pressure closely. This is also positive kasi there's risk for intracerebral hemorrhage after the administration of the thrombolytic therapy. Okay, and so positive yan. Keep the head of the bed flat. And ang recommended ay head of bed na 25 to 30 degrees. So head of bed, 25 to 30 degrees to also maintain both blood flow to the brain and venous drainage from the brain. Okay? Ayan. So, negative yan. Kasi nga head of bed elevated to 25 to 30 degrees. Keep the lights in the patient room low. This is also positive. Kasi, ayan, possible na magkaroon ng photophobia sa patient na receiving thrombolytic therapy. Okay, and then position the head of bed at 45 degrees. So, ang recommended nga is 25 to 30 degrees. So, this is negative. Okay. Ayan. So, hinanap natin dito is positive. So, ang sagot ay 2, 3, 2, 3, and 5. Okay, apple. 5, 4, 3, 2, and 1. Okay. 97, a patient is admitted to the emergency department and is diagnosed with an ischemic stroke. Which of the following would exclude the use of thrombolytic therapy for this patient? Okay, so ano daw yung included sa exclusion criteria for thrombolytic therapy? Okay. Yan. So, yung aspirin, we know na may antiplatelet effects to. Pero, hindi siya considered na exclusion criteria for thrombolytic therapy. Okay? Kasi usually, included sa exclusion criteria ay ang mga anticoagulants like heparin. Okay? So, this is negative. Okay? Hindi siya kasama sa exclusion criteria. Onset of symptoms 2 hours ago, hindi naman yan indicated. Okay? So, negative din yan. Prothrombin time of 10 seconds. Normally, ang PTI, 11 to 13 0.5 seconds. Okay, so abnormal siya. Okay, this is included in the exclusion of thrombolytic therapy. Ayan. As well as yung INR, na normally 0.8 to 1.1. Susulat natin, 0.8 to 1.1. May kinalaman dito sa clotting. Okay, so prolonged siya. So this is positive. Platelet count of 150,000, this is normal. Kasi normally it is 150,000 to 450,000. Okay, so this is negative. Hindi siya kasama sa exclusion for thrombolytic therapy. Okay, so ang sagot dito ay 3 and 4. Dog. Okay, 5, 4, 3, 2, and 1. Seizures are abnormal discharge of electric impulses by nerve cells in the brain for idiopathic or secondary causes, resulting in loss of consciousness. Motor, sensory, behavioral changes. Nurse Jenny is caring for a patient with seizure who is prescribed phenytoin Okay? A client with a history of seizures is admitted with a partial occlusion of the left common carotid artery. The client has been taking phenytoin for 10 years. So long-term na siya. When planning care for this patient, what should the nurse do first? Okay, so do first daw. Ano uunahin natin? Place an airway and suction at the bedside. Obtain a history of seizure type and incidence. Ask the client to remove any dentures and eyeglasses. Observe the client for increased restlessness and agitation. Okay, so, di ba sa ADPI, we have to assess first. And that is the obtaining history. Okay, so this is the answer. Boy. Okay, yung the rest naman, ayan, this can be considered as an intervention as well as itong CNT. Okay, 98 is boy. 5, 4, 3, 2, and 1. Ma'am, pwede po pa break after 100. Magtimpla lang po ng kape. Pwede naman, pero recommended 10:30. Okay, so tingnan natin. 5, 4, 3, 2, and 1. 99. Nurse Jenny is reviewing the results of a client's phenytoin level that was drawn that morning. The nurse is preparing to discharge once the level is therapeutic, which result indicates that the goal has been met. So pwede nang, ano daw ang result or level na pwede nang for discharge ang pasyente. Normally, ang therapeutic level ay 10 to 20 microgram per liter, ay per ml. Okay, so sandito ang within this range. Kasi level of therapeutic level ang hinahanap. So this is cat. Okay, ito naman mababa yung A and B and mataas yung dog. Okay, so 99 is cat. 5, 4, 3, 2, and 1. The client who is receiving phenytoin to control a seizure disorder questions the nurse, Jenny, regarding this medication after discharge. Okay. The nurse's best response is the medication. So, anong ginagawa ng phenytoin? Ayan. It will be probably continued for life. Okay, possibly kasi we know na yung mga anti-seizure medications, they are a prolonged therapy and lifelong. Diba? Prevents the occurrence of a seizure. Tama naman. Ayan. So this patient is for discharge already, ano? Okay, sige. Tama naman din tong boy. Pero tingnan pa natin yung other option. Needs to be taken during periods of emotional stress. So during emotional stress lang ba tinitake ang anti-seizure medication? Hindi. Okay, as prescribed siya. So this is X. Can usually be stopped after years absence of seizure. Hindi rin. As prescribed siya, ini-stop. Okay? And possibly, kaya wala nang seizure, ayan, kasi napaprevent na siya ng anti-seizure medication. Kapag in-stop mo yon, possibly bumalik yung seizure. Okay? Ito naman, yes, it prevents the occurrence of seizures, pero not all the time. Okay? So, ang tama dito ay, it will probably be continued for life. Okay? Kasi once na in-stop niyo yan, possibly, magkaroon siya ng seizures or maka-experience siya ng seizures. So, 100 is apple. 5, 4, 3, 2, and 1. Okay. Yan, sige, pagbigyan na natin yung isa niyong classmate. Yan, magtitimpla daw siya ng kape. So, magtimpla na rin kayo ng kape. Okay? Ayan, and bubuksan ko lang yung NP2. Okay, let us resume after 15 minutes. Okay? So, plus 15, that is 38. 100 is apple. Okay, let us resume. 10 plus 15 is 38. Ay, plus 15 is 39. So 39. 10:39 a.m. Okay? Ayan. Thank you then, guys, and see you again at 10:39. Yes, NP4 na next. Hello, 10:39 na. Share screen. Ayan. Nursing practice 4. Before pala we start, guys, kamusta yung NP3 nyo? Hi. Hi, Ma'am Mary Angelica. Bighati. Sama ng loob, over 100. Mahirap. Actually, mahirap nga. Well, gano'n naman talaga ang pre-boards 1. Mahirap talaga. Super hirap. Ayun. Pero, ang tanong, marami naman bang bagong natutunan? Yun yung importante. Sino pag gumawa nun? Secret! Charot. Mapapasabi ka na lang, ma'am, ng at least mabuti akong tao. Ma'am, okay pa ba yung scores na 40s? Ay, ganyan na yung mga scores ko dati, mga 40s, ganyan. Kaya, ano lang, continue nyo lang yung pagiging masipag sa pag-aaral, ganyan. Pagkaalam ng mga, kung bakit ito yung sagot, ganon. Galit po yata sa amin. Nag-doubt po ako kung kayo kung mag-take this May, ma'am. Ganun ba kahirap sa board exam? Mahirap sa board exam, okay? Hindi mo talaga actually ma-compare kasi iba yung content eh. Pero mahirap ang board exam. So, continue working hard lang, okay? And alamin kung bakit yun yung tamang sagot, okay? Ang mag-focus kayo not on the errors but on the new learning, okay? Hindi naman sa pag-invalidate ganyan. Pwede naman kayong malungkot, ganyan. Pero huwag kayo mag-12 doon. Okay? Ayan. To take the board exam na po ang bago kong goal. Oy, kapag mag-goal kayo, mas maganda kung mataas na. Okay? Para kapag nag-take kayo ng board exam, kung hindi nyo man ma-attain yun, pero sana di ba ma-attain, yun yung ideal. Kung hindi nyo ma-attain yun, konting baba lang dun sa goal na yun na mataas. Oo naman. Alam nyo, bagsak din ako ng PB1, kaya, o diba, tingnan nyo, nag-top pa rin naman ako. To stop the board exam na daw ang goal. Oh, recalls kasi from the word, di ba? Recalls lang. Pag recalls lang ng mga knowledge, kanyan. Iba talaga ang pre-boards kasi it's patterned really from the board exam. Okay? To stop the board exam. Ayan. Meron naman, parang wala akong napag-aralan, ma'am, ba't ganun? Meron naman, new information lang to na dapat yung malaman. Okay? Ayan. Ayan, that's the spirit. Magtatap pa rin sa May 2023 QT. Okay, ayan. Alright, kanina pala may nagtatanong about malignant hyperthermia. So, malignant hyperthermia, it's a severe reaction to certain drugs used for anesthesia. So, this includes a dangerously high body temperature from the term hyperthermia and rigid muscles or spasms, a rapid heart rate, and other symptoms. Okay? Ayan. Yan yung malignant hyperthermia. Alright. So, let us proceed now with NP4. Okay? Kasi medyo mahaba-haba ang tatahakin pa natin. Meron pa tayong 200 questions. Okay? Pero, kakayanin natin to at the end of the day. Okay? Ayan. So, 1. A student nurse is assigned to take care of a child with atopic dermatitis. Atopic dermatitis is also known as eczema. Okay, so it is a chronic disease that causes inflammation, redness, and irritation of the skin. Okay, so yan yung atopic dermatitis. Teka. Ayan. Ngayon, which of the following actions, when done by the student nurse, needs further intervention? So, something negative ang hahanapin natin dito. The student nurse instructs the child to avoid exposure to skin irritants, such as soap, detergent, fabric softeners, diaper wipes, and powder. And this is, since this is a skin disease, ayan, syempre, i-avoid natin ang mga irritants. So, this is positive. The nurse instructs the child that the skin should not be lubricated immediately after taking a bath. Ito naman, hindi naman siya indicated na bawal ang mag-lubricate immediately. Yung lubrication, it reduces the inflammation. Okay, so this is negative. The student nurse instructs the child to take antihistamines and topical corticosteroids as prescribed. Ayan, so yung antihistamines and topical corticosteroids, it helps in reducing also the inflammation, okay? And ayan, so it breaks the cycle of itching and scratching that makes the flare worse. So this is also positive. Okay, kailangan niya mag-take niyan. The nurse instructs the child to keep nails short and clean and place gloves or cotton socks over the hands. Yan, lalo na kung mahaba ang nails, 'di ba? Mas yung scratching nakaka-inflame pa siya ng skin. Okay, so this is also positive. All right, so ang hinanap natin dito ay negative. So the answer is boy. 5, 4, 3, 2, and 1. Number 2, which of the following is not true when understanding impetigo? Okay, so impetigo naman, wait lang. Impetigo naman, it is also a skin infection that is caused by a bacteria, Staphylococcus aureus bacteria. Okay? And it generally occurs in children, and while sores can appear anywhere in the body. Alright? So, ito, ano yung not true? So, something negative ang hahanapin natin dito. So, tingnan natin yung options. Okay. The lesions begin as vesicles or pustules surrounded by edema and redness. This is positive. This is true. The most common site of impetigo infection are on the face and around the mouth, and then on the hands and neck and extremities. This is also true. Impetigo can occur because of poor hygiene. Can be primary infection or occur secondarily at the site that has been injured. This is also positive. Ang negative dito ay yung apple kasi it is a contagious bacterial infection, not viral. Okay? Kasi nakasulat dito viral. Bacterial nga siya, caused by Staphylococcus aureus. Okay? Ayan. So, the answer here is apple. 5, 4, 3, 2, and 1. 3. A child with pediculosis capitis presents to the industrial clinic for a checkup. Okay, which of the following health teaching instruction is incorrect? So, something negative ulit. Yung pediculosis capitis, ayan, it is the infestation of the pediculosis humanus capitis. Yan, or yung tinatawag na head louse, yung mga lisa. Ayan. Okay, so ano do yung mali dito? Pediculosis capitis can occasionally involve the eyebrows, eyelashes, with the occipital area being the most common site of infestation. Tama, positive to. Pwede rin yan matransfer sa eyebrows and eyelashes, okay? All contacts of the infested child, especially siblings, are not necessarily examined for lice infestation and referred for treatment as appropriate. Dapat nga, di ba, kasi madali siyang mahawa yung pediculosis capitis. So, kailangan i-examine din yung mga contacts niya or kasama sa bahay. Okay, kasama na dun yung sibling. So, this is negative. Instruct parents that furniture and carpets need to be vacuumed frequently, and the dust bag from the vacuum should be discarded after vacuuming. So, wala namang mali dito. So, this is positive. Ayan. Kasi, yung pediculosis capitis, it can be transmitted directly or indirectly. Okay, lice can survive for 48 hours away from the host. So, they can survive 1 to 2 days, ayan, or a day or 2 away from the host. Okay? Ayan. Kapag naman mga maliliit pa na lice, ayan, or yung tinatawag na mga nymphs, they can only survive for several hours. Alright? So, this is positive kasi a day or 2. Okay? So, ang negative dito ay ang boy. Right? 3 is boy. 5, 4, 3, 2, and 1. 4, Mother Gurang, the parent of a child with iron deficiency anemia, asks you about food choices that are high in iron. Which of the following food should you, as a competent nurse, not suggest? So, something negative ang hahanapin natin dito. And kung mapapansin natin dito, and bread, cereals, nuts, iron-rich infant formula. Ayan. So, normally kasi milk is low in iron, di ba? Pero kasi iron-rich to. Ayan. So, this is positive. Shellfish, molasses, egg yolks. Ayan. Positive din yan. They're high in iron. Ang negative lang dito ay itong yogurt. Kasi they generally contain no iron and inhibit the body's ability to absorb iron. Okay? So, itong dark green leafy vegetables and tofu, positive yan sa iron, pero ito lang ang negative yogurt. Okay, so the answer here is boy. 5, 4, 3, 2, and 1. And dito makikita niyo yung listahan ng mga iron-rich foods. Okay, 5, you are the head nurse of the Onco unit of Top Rank Medical Center. a student nurse asks you what are the expected assessment findings in patient with neuroblastoma. The clinical instructor intervenes when she heard you say. So intervenes, we're looking for something negative dito. And what is neuroblastoma? It is the cancer that develops from immature nerve cells found in several areas of the body. Okay, so cancer yan. Yan. So neuroblastoma is characterized by a non-tender irregular mass in the abdomen that crosses the midline. Okay, so this is positive. Kasi usually, di ba, kapag cancerous, non-tender and irregular siya yung mass. Okay, neuroblastoma is characterized by urinary frequency or retention from compression of the kidney, ureter, or bladder. Yes, this is positive, Paul, and positive yan. Next, neuroblastoma is characterized by signs of gastrointestinal impairment, abdominal lesion, and signs of neuro impairment, intracranial lesion. Okay, so ito naman, this is actually negative kasi it is characterized by signs of not GI but of respiratory impairment kapag merong thoracic lesion. Okay, ayan. So, X yang cat. Yung neuroblastoma can result to paralysis from compression of the spinal cord. So, this is possible. The answer here is, so we're looking for something negative, cat. Okay, 5, 4, 3, 2, and 1. An 8-year-old child named Bukol undergoes surgical removal of his brain tumor. During the post-op period, Nurse Kupa knows that the child is restless, the pulse rate is elevated, and the blood pressure has decreased significantly from the baseline value. The nurse suspects that the child is in shock, which is the most appropriate nursing action. Okay, so after brain tumor removal surgery, ayan, syempre, so since sa brain siya, we're looking, wait lang, we should prevent the increase in ICP. Okay? Ayan. So, syempre, affected ng positioning yung increase in ICP or yung ICP. So, anong position ba dapat? Diba dapat head of bed eye elevated. So, hindi dapat nakasupine position kasi mag-i-increase ang ICP nito. Hindi rin naka-Trendelenburg position. Trendelenburg kapag yung head eye lower than the lower extremities. Okay, ganito yung itsura niya. Yan. So, mag-increase din ang ICP nito. So, X yan. Increase the flow rate of the IV fluid. Ito rin, mag-increase ang ICP nito. So, X yan. So, the best answer here is notify the physician. Okay? Ayan, before doing any intervention. 6 is po eh. 5, 4, 3, 2, and 1. Okay. Hidilyn Mejas, a school-aged athlete with juvenile onset diabetes mellitus, ayan, DM1, has a scheduled weightlifting training. Yan. Nurse Sugar, the school nurse, provides instructions regarding how to prevent hypoglycemia during practice. Which should the school nurse tell Hidilyn to do? Okay, so ito, ayan, possibly kasi 'di ba, merong exercise or weightlifting training. So, pwedeng ma-consume yung glucose sa blood. So, magkakaroon ng hypoglycemia. Okay, so ano yung sasabihin natin kay Hidilyn? Hindi naman indicated na mag-eat twice the amount normally eaten at lunchtime. Okay? Hindi naman yan indicated. Take half the amount of prescribed insulin on practice days. So, hindi rin naman indicated yan. Dapat, kung ano yung prescribe yan, yung i-take na insulin. Okay? So, X yan. Hindi rin naman to indicated. Ano bang indicated dito kapag may exercise? So, ang i-recommend natin ay for the client to take an extra snack of 15 to 30 grams of carbohydrates before activities such as soccer practice to prevent hypoglycemia. So, itong eating a small box of raisins or drinking a cup of orange juice before weightlifting practice, ayan, makakatulong to prevent hypoglycemia. Okay, so the answer here is don't go. 5, 4, 3, 2, and 1. Next, 8. Bronchiolitis or respiratory syncytial virus. It is an inflammation of the bronchioles that causes production of thick mucus that occludes bronchial tubes and small bronchi. Which of the following indicates that this disease is already at its severe stage? Okay, so makikita natin dito, Yung assessment, and ito yung mga initial manifestation yan, and then yung progression during manifestation during progression of the RSV, and then manifestation in severe illness. So saan ba dito ang may severe illness? Magpapakita ng severe stage na siya. Periods of apnea. It is severe. Ayan, periods of apnea. So the answer here is apple. Itong cyanosis, it can be seen here during the progression of the disease. Takip niya in retractions, ganun din, as well as yung wheezing. Okay? And pwede rin tong initial manifestation ang wheezing. Alright, so 8 is apple. Oh, may nagsusulat na naman. Okay, 5, 4, 3, 2, and 1. Next, diagnosis of asthma is made on the basis of the child's symptoms, okay, history and physical exam, chest radiograph, and lab test. Which of the following lab tests is not anticipated by the nurse for the physician to order? Okay, in the diagnosis of the asthma. So, ito yung mga lab tests to assist in diagnosing asthma. We have the pulmonary function test, ayan, peak expiratory flow rate measurement, bronchoprovocation testing, so this is positive. Ang hinanap kasi natin, not anticipated, so something negative. Exercise challenge is, sorry, medyo na ulit yung nako-congest ulit ako. So this is positive. Ayan, nakita natin dito. Ito yung bronchoprovocation. Radioallergo expiratory test is gawa-gawa lang to. Hindi yan kasama. Skin testing is also included. So the answer here is cat. Okay, 5, 4, 3, 2, and 1. 10. Nurse Sander reads the results of the tuberculin skin test on a 3-year-old child. The results indicate, and 3-year-old child, indicate an area of induration measuring 10 millimeter. The nurse should interpret these results as which finding. Okay, so sinasabing positive ang results kapag 10 millimeter or more for children younger than 4 years of age and in children with chronic illness or at high risk for exposure to TB. Okay, kapag naman 5 mm or more, nagiging positive siya kapag sa mga high-risk groups, okay? Such as yung bata na may HIV. 15 mm or more naman, positive siya kung sa child na 4 years or older, okay? Without any risk factor. So ito naman kasi, less than 4 years old siya. So dito siya sa una, 10 mm or more, positive daw. So, since 10 mm ang induration niya, that is positive apple. Okay. 5, 4, 3, 2, and 1. Nurse Wiwi is closely monitoring the intake and output of an infant with heart failure who is receiving diuretic therapy. The nurse should use which appropriate method to use to assess the urine output. So, ang client natin dito ay infant. Okay? Ayan. So, most appropriate. Yung inserting a urinary catheter, this is the most accurate. Okay? Pero, this may pose a risk for infection. Okay? Ito namang comparing intake with output and measuring the amount of water added to the formula, hindi naman ito nakaka-assess ng urine output. Okay? So, best answer here is weighing the diapers of the infant. So, 11 is apple. 5, 4, 3, 2, and 1. 12. Nurse tape reviews the appropriate post-op nursing interventions for a child who has undergone VP shunting. Which of the following, when done by a nurse tape, needs further instruction? So something negative ulit hahanapin natin dito. And VP shunting is indicated for clients na may hydrocephalus. Ayan. So ano ang negative dito among the options? Nurse tape measures and monitors the head circumference of the child. Ayan, this indicates the effectiveness ng VP shunting. Kasi ginagawa niyang VP shunting, di ba? It drains yung CSF fluid, yung CSF from the ventricles. Ayan. Ayan, so it drains. Ayan. So, yung A, it indicates the effectiveness. Dapat, lumiliit yung head circumference niya. Okay? Ayan. So, this is positive. Nurse tape notifies the physician after the toddler complains of headache. So, ito naman, this is also positive. Kasi yung headache, ayan, this indicates that the CSF is not draining well. Alright? Nurse take positions the toddler to the operated side. So kapag nasa operative side siya, ayan, this actually increases pressure, okay, on the shunt valve na nasa VP shunt. Okay, so this is negative. Nurse tape elevates the head of bed to 15 to 30 degrees after observing for increased ICP. So, ayun. So, yung head of bed elevation by gravity, di ba, nakakatulong siya sa pagbaba ng ICP. So, this is positive. So, the answer here is cat. Kasi we're looking for something negative. Ayan. 5, 4, 3, 2, and 1. 13. Which of the following assessment findings would Nurse Fabio expect to see with a child with meningitis in pneumococcal in origin? Okay? And so, yung meningitis, it can be pneumococcal or meningococcal in origin. Okay? Ayan. So, yung pinagkaiba niya lang ay yung cause. So, pneumococcal disease is caused by the bacteria known as Streptococcus pneumoniae or pneumococcus, while meningococcal disease is caused by a bacteria called Neisseria meningitidis or meningococcus. Okay? Ayan. So, ano yung assessment findings natin dito? Usually, yung Brudzinski's sign and Koenig sign, ayan, makikita siya sa meningococcal in origin. Okay? Ayan. Muscle, joint, and pain, ganun rin, such as yung tsaka yung petechial or purpuric rashes. Okay? Meningococcal in origin yan. Ang hindi lang kasali dyan yung ear that drains chronically. Okay? Kasi this is usual in pneumococcal origin. Ayan. So the answer here is dog. Okay? 5, 4, 3, 2, and 1. 14. Nurse convulsion is reviewing the record of a child with increased ICP and notes that the child has exhibited signs of decerebrate posturing. On assessment of the child, the nurse expects to note which characteristic of this type of posturing. Okay, kapag diba decerebrate, nagsaselebrate siya. So, yung posturing niya, I'm not sure if you could see, yun pa, pataas. Okay? So, extend yung arms niya. Flaccid paralysis of walang paralysis. Ayan, wait lang. Kapag may decerebrate posturing, usually it is the rigidity, di ba? Ayan, yung decerebrate. Okay, so X yan. Adduction of the arms at the shoulders. Adduction, ibig sabihin, mas malapit sa katawan. Okay? Eh nga, decerebrate nga tayo, nag-celebrate nga tayo. So extension, hindi adduction. So X yan. Rigid extension and pronation of the arms and the legs. Ito. So this is correct. This is positive. Abnormal flexion. So extension nga tayo, hindi nga tayo flexion. So X yan. The answer is cat. Okay, 5, 4, 3, 2, and 1. Itong B and D, this B and D, ayan. This describes the corticate or flexion posturing. Okay, ayan. 5, 4, 3, 2, and 1. 15. Disorders related to abnormal development of the hip may develop during fetal life, infancy, or childhood. In these disorders, the head of the femur is seated improperly in the acetabulum, hip socket of the pelvis. Ayan. Which degree of developmental dysplasia of the hip is mildest in form and is described as a delay in the acetabular development? Okay, so these are the degrees of developmental dysplasia of the hip. We have acetabular dysplasia or prelaxation, subluxation, and dislocation na. Okay, yung prelaxation, it is the mildest form. Wala siyang subluxation or dislocation. May delay in acetabular development. And the femoral head remains in the acetabulum. Kapag naman subluxation, yan, there is an incomplete dislocation of the hip. The femoral head also remains in the acetabulum. And, ayan, so, the stretched capsule and ligamentum teres causes head of the femur to be partially displaced. So, yan yung cause niya. And then kapag dislocation naman, femoral head loses contact with the acetabulum and is displaced posteriorly and superiorly over the fibrocartilaginous rim. Ligamentum teres is elongated and taut. Okay, so ano dito ang tinatanong? Mildest form and delay in acetabular development, that is relaxation. Apple. 5, 4, 3, 2, and 1. 16. Deformities of the congenital clubfoot are described on the basis of the position of the ankle and the foot. Which of the following refers to the plantar flexion in which the toes, ayun yung toes, are, ay wait lang, mali ang binilugan ko. Ang toes ay lower, mas mababa daw than the heel. Okay, so ang answer dyan ay talipes equinus. Okay, ayan. So, 16 is boy. Kapag naman talipes varius, this is the inversion or bending inward. Ayan. Kapag naman talipes valgus, this is the eversion or bending outward. Talipes calcaneus naman, calcaneus, this is the dorsiflexion in which the toes are higher than the heel. Ayan. So, ito yung calcaneus. Ayan, toes are higher than the heels. Ayan, toes are higher than the heels. And then, valgus naman, bending palabas. And then, ito namang varus paloob. Okay? Ayan. 5, 4, 3, 2, and 1. The parent of a child with juvenile idiopathic arthritis call the clinic nurse because the child is experiencing a painful exacerbation of the disease. The parents ask nurse masakit if the child can perform range of motion exercises at this time. The nurse should make which response? Okay. So yung child with juvenile idiopathic arthritis, ayan, it is an arthritis most common in the child, right? Kaya nga, juvenile. So, they must do range of motion exercises to prevent contractures. Ayan, and to maintain joint range and flexibility. Pero kasi, the child is experiencing a painful exacerbation of the disease. Okay? Kaya at this time, hindi mo na indicated ang range of motion exercises kasi nga masakit. Okay? Hindi mo naman kailangan i-avoid ang lahat ng exercise, okay? Ang i-avoid mo lang yung range of motion exercise. Usually, pwede pa dyan yung mga isometric exercise. Ayan, mga simple isometric exercises. Meaning, isometric M, ayan, mga muscles, yung i-contract to exercise. Okay? Pwede yon. So, pwede itong cat, X itong apple. Range of motion exercise must be performed every day. Tama naman tong statement na to, pero hindi lang siya applicable. Okay, at this time na may pain yung client, this is used to prevent, yun nga, contractures and to maintain joint range and flexibility. Administer additional pain medication before performing the range of motion exercise. So magbibigay ka pa ng pain meds, diba, para lang maka-exercise siya. Pwede naman yung mga isometric exercise para ma-prevent ang contractures. Yun nga lang, hindi niya magagalaw yung joints. Okay? So ang best answer dito ay cat. Okay? 5, 4, 3, 2, and 1. Which of the following diagnostic tests for HIV is age appropriate for infants? Okay? So yung enzyme-linked immunosorbent assay, ayan, it is indicated for children aged 18 months or older. Okay, so greater than or equal to 18 months. Ganun din yung Western blot. Okay, indicated for 18 months and older. Ayan. Yung PCR naman, this is indicated for children less than 18 months. And then yung CD4 lymphocyte count and T lymphocyte count, this is indicated for infants. Ay, nakasulat na to children 13 years old. Yeah. So the answer here is boy. Okay, 5, 4, 3, 2, and 1. Ruby, a 7-year-old child with scarlet fever. Yan, makikita mo yung symptoms ng scarlet fever dito. Presents to the emergency department with abrupt high fever, flushed cheeks, vomiting headache, and large lymph nodes in the neck, malaise, and abdominal pain. The nurse palpated the rash and found out that it blanched blanched with pressure. What hallmark assessment finding is elicited? So yung ginawa, ayan, yung may blanching of the pressure daw. Ay, blanching with pressure of the rash. Okay, that is, ayan, may positive blanching test. That is a Schultz-Charlton reaction. So the answer is apple. Pasteur sign, ayan, may makakita ka lang na transverse lines na prominent sa skin folds, gaya nung nasa anterior part of the elbow. Okay? Yan yung Pastias sign. Red strawberry rash naman, ayan, walang red strawberry rash. It is red strawberry tongue. Okay? Circumoral pallor naman. This is the paleness of the area around the mouth. Okay? Ayan. Circumolar pallor. So again, the answer here is apple. 5, 4, 3, 2, and 1. Frangish, who was diagnosed with Hirschsprung's disease, has a fever and watery explosive diarrhea. Which of the following would nurse ganglion do first? Okay, so kung matatandaan natin kung ano yung Hirschsprung's disease, it is the congenital aganglionic megacolon. So dito, ayan, affected ang large intestines, wala daw siyang ganglion. Okay, yung ganglion, it is in charge of promoting peristalsis. So kapag walang ganglion, walang peristalsis sa large intestines. Okay? So kapag walang peristalsis, di ba dapat may constipation siya? Bakit meron siyang diarrhea? Okay? So this can happen kapag nagkaroon na ng enterocolitis ang client. Enterocolitis. Ayan. So this is the inflammation of both the small and large intestines already. Okay, so ibig sabihin lumala na. Ayan. So ano daw unang gagawin? Administer an antidiarrheal as prescribed. Ayan. So hindi actually ni-recommend ang antidiarrheal kasi it makes the disease worse and hindi siya nakaka-improve ng symptoms. Okay? Yan. So X yan. Monitor your child every 30 minutes. Yan. Hindi naman indicated yan. Kung i-monitor mo lang, di ba? So, X yan. Noting as these findings are common in Hirschsprung disease. Common nga ang constipation and not the diarrhea. So, X din to. Okay, pinakamagandang gawin, priority, ay, syempre, i-notify mo muna yung physician na may nangyayaring ganito. Okay? So, 20 is boy. 5, 4, 3, 2, and 1. Yes. Yes, absence of peristalsis. No peristalsis. Ayan. 5, 4, 3, 2, and 1. Which of the following applies to the defect emerging from residual peritoneal fluid confined to the lower segment of the processus vaginalis? Okay? So, tingnan natin. Ano daw yung may association? Emerging from residual peritoneal fluid confined with the lower segment of the processus vaginalis. Okay, so ito kasi, pinag-usapan natin dito fluid, di ba? Kapag sinabing hernia, ano yung laman ng sac? It is the abdominal contents and not fluid. Kapag ang laman ng sac ay fluid, ayan, hydrocele yun. Okay, yun yung difference nila. So, X na tong hernia kasi may fluid na naka-confine daw. Ayan. So, is it communicating and not or non-communicating? The answer here is, wala naman kasing sinasabi na kapag kasi communicating hydrocele, ayan, open yung sac. Okay? And possibly yung fluid ay it can flow back up to the abdomen. Wala namang sinabi na it flow. Diba? Ano namang past of flow? Okay, it has flown back. Ay, flown back. Hindi naman lumipad. Okay, flow, basta bumalik sa abdomen. Okay? Hindi naman naka-indicate dito. So, it is tong communicating hydrocele. The answer is non-communicating hydrocele. Okay? There's a collection of scrotal fluid that is isolated from the abdomen. So, 21 is dog. 5, 4, 3, 2, and 1. Kapag hernia, ang laman ay abdominal contents. Kapag hydrocele, ang laman ay fluid. Okay? Going back there na lang daw. Ayan. Yeah. So, 21 again is dog. Okay, wait lang. Lagay ko lang yung ibig sabihin ng communicating and non-communicating. Kapag sinabing communicating, ayan, the sac does not close. So open siya, yung sac. This means that the fluid around the testicles can flow back up to the abdomen. Kapag non-communicating, there's a collection of scrotal fluid that is isolated from the abdomen. Okay? Hernia is the bulging of contents of the abdomen, diba? Through a weak area in the lower abdominal wall. So may bulging lang. Ayan. So 21 is TOG. 5, 4, 3, 2, and 1. Ito, inguinal hernia, teka lang. In definition niya, there is bulging of contents of the abdomen through a weak area in the lower abdominal wall. This is inguinal hernia. Okay? Kapag naman incarcerated hernia, a part of the intestine or abdominal tissue that becomes stuck in the sac of a hernia. Okay, wait lang. Parang similar lang sila. Pero yung sa inguinal hernia, and it is in the lower abdominal wall. Okay? Ayan. More on that later. Teka lang. Okay. Incarcerated. Iwalagan ko kayo dyan later. Incarcerated. Pero again, hernia, ang content niya ay abdominal contents. Okay? Ayan. So 21 is dog. 5, 4, 3, 2, and 1. 23. The 6-year-old son of Mr. and Mrs. Angeles is admitted to the healthcare facility with the diagnosis of idiopathic hypopituitarism. His height is measured below the 3rd percentile and the weight at the 40th percentile. Which of the following would be the first action of Nurse Henry? So napakalayo ng 3rd sa 40. Okay, ibig sabihin ng percentile, ayan, the percentile means that your child exceeds that percentage of children, their age for that measurement. Okay, so ibig sabihin, yung height niya, ayan. So this child is taller than 3% of the kids his age. Okay? Pero sa weight naman, he is heavier than more than 40% of the kids his age. Okay, so medyo mataas na yung sa weight niya. Ang laki ng pinagkaiba ng weight and height. Okay? Ayan. So, ang indication dito ay kailangan niyang magbawas ng timbang. Alright? So, hindi naman kailangan itong wala namang affectation doon sa jaw. Okay? As well as sa intellectual ability. And hindi naman kailangan siyang ilagay sa room with a 2-year-old boy. Okay? So, ang best answer dito ay collaborate with a dietitian to access his caloric needs. Kasi kailangan mag-decrease ng weight. Okay? Yeah, kailangan ng weight loss program. Okay? 5, 4, 3, 2, and 1. 23. In children diagnosed with sickle cell disease, tissue damage results from which of the following? Okay, so sa sickle cell disease, di ba, merong anong shape ng RBCs? Sickle cell shape sila. So they're prone then to clumping together because of their shape. Kapag may clumping, pwede magkaroon ng vaso-occlusion. So, na-occlude yung mga blood vessels. Because of that, ayan, syempre, there is decreased blood flow in that area. So, decreased oxygenation. Kaya, nadadamage yung tissues. Ayan. So, saan yun dito? Air hunger and respiratory alkalosis due to deoxygenated red blood cells. Wala namang deoxygenated red blood cells dito. Meron lang sickle cell-shaped red blood cells. Okay, so X yan. Hypersensitivity of the CNS due to elevated serum bilirubin levels. So, wala namang elevated serum bilirubin levels. Ayan. Hindi rin naman dahil sa autoimmune reaction. So, ang best answer dito ay dog, local tissue damage with with ischemia and necrosis due to obstructed circulation. Ayan, dahil nga sa vaso-occlusion. Ayan, so 23 is dog. 5, 4, 3, 2, and 1. Ayan. 24, which of the following genes localized to chromosome 21 possibly affect Alzheimer type neuropathology? So ito, itong table na to, pinapakita niya yung affectation ng genes localized to chromosome 21. Okay, so dito, ang may affectation lang sa Alzheimer type neuropathology ay yung ito. Ayan, so saan yun dito? APP and S1OOP. So the answer here is boy. Yung SIM2, DYRK1A, and GARD ay sa brain development sila. Okay, so 24 is boy. 5, 4, 3, 2, and 1. In growth and development milestones, children with Down syndrome achieves walking at an average of, so average, ayan, yung child with Down syndrome daw, and walking, so it's 20. Okay, 20 months. The answer is dog. 5, 4, 3, 2, and 1. Which of the following is not true regarding the use of phototherapy in patients with hyperbilirubinemia? Okay, so not true, something negative ang hahanapin natin dito. Okay? Ayan. So, in phototherapy, ayan, ina-absorb ang light energy. Okay? Para matransform siya into water-soluble isomers that can be eliminated nang hindi siya kino-conjugate sa liver. Okay? Ayan. So, this is positive kasi ina-absorb ang light energy. Dark skin reduces the efficacy of phototherapy because of broad spectrum white blue and special narrow spectrum blue lights. So yung color ng skin, it actually doesn't affect the efficacy of phototherapy. So this is negative. Alright? The therapeutic effect of phototherapy depends on the light energy emitted in the effective range of wavelengths. Yan, the distance between the lights and the infant and the surface area of exposed skin. So this is true kasi dependent naman talaga siya sa factors. Available commercial phototherapy units vary considerably in spectral output and the intensity of radiance emitted. Therefore, the wattage can be accurately measured only at the patient skin. So this is also positive. Hence, ang hinahanap ay negative. So the answer is boy. 5, 4, 3, 2, and 1. The boot-shaped sign, ayan, is seen in the radiographs of patients with TOF or tetralogy of Fallot. It is from, ayan, so makikita nyo dito sa right, ito yung heart. It is boot-shaped. Ayan, ito yung nasa tetralogy of Fallot. Okay? So dito, nasan ba ang base ng heart? Ang base ng heart ay nasa upper part. Okay? Yan yung base ng heart. Ang apex nandito siya. And sa tetralogy of Fallot, ayan, merong upturning ng cardiac apex. Okay? Pataas. Okay? Ayan. Kaya nagkakaroon siya ng boot shape sign. Right? So this is due to the right ventricular hypertrophy and by concavity of the main pulmonary artery. Okay? So ang sagot dito ay dog. The rest is incorrect. Okay, ayan. 27 dog. 5, 4, 3, 2, and 1. A 15-year-old child named Nick was admitted to your clinic after suffering a burn injury. He asked you whether the physician can still save his injured hand. You explained to him that there are different zones of burn injury that demonstrate the evolution of local tissue damage. What zone of burn injury is characterized by the absence of capillary flow and irreversible tissue destruction? Okay, kapag irreversible na, di ba, ibig sabihin malala na. Okay? So kapag may zone, kapag sa zone of hyperemia, ayan, the area is metabolically active. It displays usual response pa to tissue injury. Kapag naman zone of stasis, ayan, the area beneath and surrounding zone of coagulation. Ay, wait lang. Sorry. Ayan, markedly reduced capillary flow. Reduce lang ang capillary flow. Tissue severely damaged from heart but not coagulated. Tissue is in this zone can be saved with prevention of further injury and with adequate perfusion. Ayan. And so sa zone of coagulation naman, area beneath obviously has destroyed tissue. Capillary flow has ceased, so nag-stop na, and tissue destruction is irreversible. Tissue is dead. So the answer here is zone of coagulation. Okay, walang zone of ischemia. Okay, 28 is apple. 5, 4, 3, 2, and 1. Next. Nick was provided with a temporary skin substitute to allow transient physiologic wound closure. He read in a Facebook post that pig skins can be used as temporary skin grafts. You answer by? Okay, so ano ba yung pig skins? Tingnan natin, ito yung types of skin grafts. Ayan, we have temporary, we have permanent, tapos dito lang yung mga methods of applying split thickness grafts. Okay? Kapag temporary, we have allografts and xenografts. Kapag allografts, it is obtained from genetically different members of the same species. Yun yung allograft. Pag naman xenograph, ayan, obtained from members of different species yan, such as yung pig skin. Siyempre, nanggaling sa pig. Okay? Ayan, yan yung xenograph. The answer is apple. Kapag naman permanent grafts, we have autograft and isograph. Kapag autograft, tissue obtained from undamaged areas of the patient's own body. Kapag isographs, obtained from genetically identical individuals, yung mga may twins. Okay? So, again, the answer is apple. Xenograph siya. Okay? 5, 4, 3, 2, and 1. Nick has acquired scar tissues, a common long-term complication of burn injury. His mother asked you what brand of moisturizer can they apply to the scar tissue to relieve itching. As a component in evidence-based nurse, you do not suggest. So something negative. Ayan. So itching is usually treated with hydroxyzine or diphenhydramine, and frequent applications of a moisturizer such as Eucerin, this is positive, cocoa butter, Vaseline Intensive Care, and Nivea. So, ang hindi kasama dyan yung Aveeno. Okay, 5, 4, 3, 2, and 1. Which of the following is not true in understanding umbilical hernia? So, something negative. Umbilical hernia, ayan, it is an abnormal bulge that can be seen or felt at the umbilicus. So, meron siyang abdominal contents. Okay, it affects LGA and full-term infants, large gestational age or low gestational age. Wait lang. And this is, wait lang. LGA is large gestational age. Okay. Full-term infants. This is negative kasi usually affected ang low birth weight and preterm infants more. Okay. Ayan. So this is negative. Okay. Ayan. It occurs when fusion of the umbilical ring is incomplete. Ayan. And at the point where the umbilical vessels exit the abdominal wall. So this is positive. Associated din siya sa mga ibang congenital anomalies such as Down syndrome and trisomies 13 and 18. So this is positive. Protrusion is more prominent when the infant is dry. Okay, so this is also positive. And so the answer here is apple. Kasi it is more found in low birth weight infants and preterm infants. Okay, 5, 4, 3, 2, and 1. Jake, an infant with biliary atresia, was admitted to the ER because of persistent jaundice for 3 weeks, elevated direct bilirubin, dark urine, and gray stool. Which of the following medical management would you not expect for this patient? Okay, so something negative. Yung biliary atresia, ayan, it is a condition in infants in which the bile ducts outside and inside the liver are scarred. Wait lang. Okay. Ayan. Or scarred, so bile can flow into the intestine. So bile builds up in the liver and damages it. The damage leads to scarring, loss of liver tissue and functions, and cirrhosis. Okay, so that is biliary atresia. Okay, so ano daw hindi in-expect dito? A nutritional support with infant formulas that contain medium-chain triglycerides and essential fatty acids. Ayan, so since hindi makapunta yung bile sa intestines, hindi niya ma-break down yung fat, hindi ma-absorb yung fat. Okay, so kailangan ng supplement ng triglycerides and essential fatty acids. Okay, so this is positive. Supplementation with fat-soluble vitamins. So fat-soluble vitamins are vitamins easily absorbed with fat. Okay, so this is positive. Yan. Kasay procedure naman, ito yung indicated ng procedure for biliary atresia. Okay. This involves the removal of the blocked bile ducts and gallbladder and replacing them with a segment of the child's own intestines. Okay, that is Kasay procedure or hepatic portoenterostole. UDCA, it is ursodeoxycholic acid. It is used primarily for primary biliary cirrhosis and not really sa biliary atresia. Okay? Aspirin naman, yan, it causes liver injury. Injured na nga yung liver, di ba? Okay, so negative yung dog. So the answer here is dog. Okay, kasi hinanap natin ay negative. Alright, 5, 4, 3, 2, and 1. Rep O is diagnosed with pyloric stenosis, and the nurse assigned to him expect to see visible peristaltic waves that move from blank across the epigastrum. Okay, so ito yung clinical manifestation ng hypertrophic pyloric stenosis. May projectile vomiting. Ayan, merong, yung infant daw ay hungry. Okay. Walang pain, except that of chronic hunger, poor weight gain, signs of dehydration, distended upper abdomen, and palpable olive-shaped tumor, and visible gastric peristaltic waves that move from left to right across the epigastrum. So the answer here is cat. Okay, 5, 4, 3, 2, and 1. Biliary atresia. Wait lang balikan natin yan. Teka. Ayan. So dito kasi diba, ang bile daw hindi maka-flow sa intestines. And it is known na yung bile ay ang nag-breakdown ng fat sa intestines. Okay? So since hindi siya makapunta sa intestines, hindi ma-absorb yung fat. Okay? Kaya kailangan ng supplements. Okay? Ayan. So, that is the explanation there. Hindi po ba di na po mabibigay ng ate kasi po, hindi po na-absorb ang fat-soluble vitamins. Teka, may point. Wait lang Sige, I'll get back to you on that. Pero kasi indicated na required ang supplementation of fat-soluble vitamins. Pero alawin ko kung bakit. Okay? Sige. Ate kasi is fat-soluble vitamins. Sige, balikan kita. Okay. Sige, babalikan kita ha. Yes. Okay. Ito, 34. A mother of a child with peptic ulcer disease asked you what could have been the cause of her child's disease. Okay, as an evidence-based nurse, you are aware that PUD is idiopathic but may also be from, okay, so idiopathic siya and also associated with Helicobacter pylori infection. Okay, and tend to be chronic, occurring more frequently in the duodenum. So the answer here is boy. Ayan. So 34 is boy. 5, 4, 3, 2, and 1. Wait lang. Okay. What type of fluid loss is seen in a perforated acute appendicitis that leads to hypovolemic shock? Okay, so what you need to know, kapag may hypovolemic shock, yung fluid loss ay extracellular extracellular. Okay, so hypovolemic shock results from the depletion of intravascular volume, whether by extracellular fluid loss or blood loss. Okay, yung blood loss, ayan, this is intravascular. It can be also be intravascular fluid loss. Okay, pero wala namang intravascular fluid loss dito. Okay. Ayan, so intracellular just means yung fluid loss ay inside the cells. Extracellular, outside the cells. Interstitial naman, ayan, fluid outside the blood vessels. Okay, so ang answer dito ay extracellular. Okay, 35 is point. 5, 4, 3, 2, and 1. A child with acute nasopharyngitis was prescribed with nasal decongestants at home. He said that he is having rebound nasal decongestion after using it for some time. What would you suggest to him to avoid rebound nasal decongestion? Okay, kapag sinabing rebound congestion, ayan, it is a constant nasal stuffiness congestion that develops from the overuse of nasal sprays or drops or gels that contain a decongestant medicine. Okay, so it is from the overuse of nasal sprays. Okay, so ano daw gagawin or isa-suggest to avoid this? So kapag more than 3 days pag ginamit, mas lalong mako-congest. Okay, so X to. Hindi naman indicated yung time, right? Ang indicated ay yung day. So it should not be used more than 3 days. Okay, 36 is apple. 5, 4, 3, 2, and 1. What is the estimated incubation period of Epstein-Barr virus as the main causative agent of infectious mononucleosis? Okay, infectious mononucleosis, ayan, it is characterized by swollen lymph glands, fever, sore throat, and extreme fatigue. Yung transmission niya ay through contact with infected saliva from the mouth. Ang incubation period niya ay 30 to 50 days. So the answer here is B. Okay. Ayan. 5, 4, 3, 2, and 1. Palatandaan ko dito, infectious mononucleosis, ayan, kissing disease. Kasi, nakakahawa siya through kissing. Okay, 37 is dog. Tympanostomy tube may be indicated to patients with otitis media to allow ventilation into the ear and to equalize middle ear pressure. For how long should the tube be pushed out of the eardrum after tube placement? Okay? Yan. So naturally, pwedeng matanggal yung tympanostomy tube. So it is eventually pushed out of the eardrum, usually 8 to 18 months after tube placement. Okay? And so the answer here is cat. 5, 4, 3, 2, and 1. Which of subgroup of respiratory syncytial virus is more evident in developing bronchiolitis and pneumonia in children? Okay, so meron tayong two major subgroups ng RSV strain. So we have A and B. More children develop bronchiolitis and pneumonia from RSV subgroup A infections than subgroup B infection. Okay, so the answer here is apple. So RSV is a common respiratory virus that usually causes mild cold-like symptoms. Okay, wala tong GOX. Okay, 5, 4, 3, 2, and 1. Ayan. Which pneumonia-causing microbial agent is more susceptible in infants who are primarily less than 3 months of age? So dito makikita natin yung organisms causing pneumonia in children and kung sino-sino yung mga susceptible host nila. Okay? So less than 3 months of age, saan yan dito? Ito. Okay? So kasama lang dito ang Mycoplasma hominis. Itong tatlo, ang susceptible host nila ay children less than 5 years. Okay? Ay, ito palang chlamydia ay greater than 5 years. Pyogenes is also less than 5 years. Okay. So the answer is apple. 5, 4, 3, 2, and 1. Which is not included in the management of child with acute respiratory distress syndrome. So yung ARDS, yan, it occurs when fluid builds up in the alveoli. Okay? Ayan, yan yung ARDS. So, ano daw yung hindi included sa management? Of course, included dyan yung diuretics kasi nga may fluid buildup. So this is positive. Possible din na magkaroon sila ng mechanical ventilation and eventually kailangan i-wean. So this is also positive. Generally, wait lang, parenteral nutrition. So vasoconstrictors or parenteral nutrition. Pwede yung negative tong vasoconstrictors kasi usually included ang vasodilators, okay, to decrease pulmonary vascular pressure. Okay, so X yung vasoconstrictor kasi mas nakaka-increase pa yan ng pulmonary vascular pressure. Okay, so we're looking for something negative. Yung parenteral nutrition. And parenteral nutrition is indicated kasi kapag may mechanical ventilation. Okay, hindi sila nakaka-take in ng nutrition orally. Okay, so the answer here is boy. 5, 4, 3, 2, and 1. 42. A child with allergic rhinitis attempts to alleviate nose itching by rubbing the nose. This is also called as, so yung allergic rhinitis, ayan, it's the inflammation of the inside of the nose caused by allergens such as pollen, dust, mold, or flakes of the skin from certain animals. So, nasal itching is troublesome, and the affected child attempts to alleviate the symptoms by rubbing the nose, which is the allergic salute. Okay, so the answer here is apple. Yeah. 5, 4, 3, 2, and 1. Next, Melai, a patient with stage 2 chronic kidney disease, asks you what is her estimated glomerular filtration rate. The nurse understands CKD staging if she understands your GFR is about, so na stage niya, 2. Okay, dito sa stage 2, normally 60 to 89 ang GFR. Okay, 60 to 89, so the answer here is cat. Okay, 5, 4, 3, 2, and 1. As the renal failure progresses and the GFR fails, which of the following systemic changes shall the nurse expect to occur? So something positive, ayan, as the renal failure progresses. Okay. So dito, meron bang hyperkalemia or hypokalemia? Kapag may renal failure, di ba, hindi niya na-excrete yung potassium. So normally, merong hyperkalemia. Negative tong hypokalemia. Metabolic acidosis naman, ayan, it is not expected to occur in renal failure. Okay, so negative din to. Anemia, wait lang. Wait lang. No. Metabolic acidosis. This is also pala positive because of the decreased acid secretion by the kidneys. And inability to regenerate bicarbonate. Teka lang ah. Ayan, so hindi niya ma-excrete ang acid. Okay, so merong accumulation of acid sa katawan. So may metabolic acidosis. Anemia naman, this can also happen due to decreased production of RBCs. This is positive. Mataas ba ang albumin? Usually, mababa because of protein loss through the damaged glomerular membrane. Okay, so this is negative. Hyperphosphatemia naman, this is positive. Mataas ang phosphate due to decreased renal excretion of the phosphorus. Yan. Ano ba expected natin? Hyper or hypocalcemia in renal failure? It is hypocalcemia. Diba usually kapag mataas ang phosphate, mababa ang calcium. Okay, so this is negative yung hyper and then positive to. So the answer here is apple. 1, 3, 4, 6, and 8. Okay, ayan, apple. 5, 4, 3, 2, and 1. Which of the following is not an intrarenal cause of acute renal failure? Okay, so dito, ayan, makikita natin yung causes ng failure. Kapag pre-renal failure, yan, ito yung causes. Yan, so hindi lang kasama dito sa intrarenal cause ang osmotic diuresis kasi nasa pre-renal siya. Okay. Ayan, so the answer here is apple. Yung myoglobinuria, nephrotoxic agents, and acute pyelonephritis, ayan. These are intrarenal causes of acute renal failure. So 45 is apple. 5, 4, 3, 2, and 1. Hyperphosphatemia kasi hindi excrete ang phosphate. Okay, 45 apple. 5, 4, 3, 2, and 1. Which of the following categories of acute renal failure primarily caused by parenchymal damage? Okay, so ito yung categories ng acute renal failure. We have pre-renal, intrarenal, and post-renal. Ayan yung mga causes. So, tinatanong dito, caused by parenchymal damage, that is intrarenal. Okay, ang cause ng pre-renal ay hypoperfusion, post-renal naman is usually obstruction. Okay, 46 is cat. 5, 4, 3, 2, and 1. 47. The physician of Tatay Ernesto, a patient with end-stage renal disease, wrote in his order to limit the patient's fluid intake. Tatay Ernesto asked you the fluid intake allowance per day. The nurse correctly responds by answering. So indicated the fluid allowance per day ay 500 to 600, more than the previous day's 24-hour urine output. Okay, so the answer here is boy. 5, 4, 3, 2, and 1. Sasha Colby was scheduled for nephrostomy. Which of the following surgical positions and incisional approaches is not considered for these types of patient? So ito yung different patient positioning and incisional approaches. Ayan, during surgery. So we have the flank approach. The flank approach, the lumbar approach, ayan, and the thoraco-abdominal approach. Okay, so hindi na kasama dito ang cervical. Okay, ayan, the answer is apple. So, syempre, kailangan natin i-expose yung kidneys. 5, 4, 3, 2, and 1. 49, urine has an ileal conduit wherein the urine is diverted by implanting the ureter into a 12-centimeter loop of ileum that is led out of the abdominal wall. Okay, she asked you, how many days may the stents be left post-op? Okay. So, ito naman. So, naglalagay ng stents para ma-drain yung urine from the kidneys to the stomach. Okay? So, they may be left, ang indication ay they may be left in place 10 to 21 days post-op. Okay? Ayan. Additional information. Okay, it is usually made of thin, pliable tubing placed in the ureters to prevent occlusion secondary to post-surgical edema. Ayan. So, the answer here is cat. 5, 4, 3, and 1. 50. Which of the following is not a type of automated peritoneal dialysis? So, ito yung mga different types ng automated peritoneal dialysis. Okay? So, we have continuous cycling peritoneal dialysis. Oh. And we have intermittent peritoneal dialysis and nightly peritoneal dialysis. Walang three-phase peritoneal dialysis. Okay, so 50 is cat. Ayan. So 5, 4, 3, 2, and 1. A patient who has undergone renal transplantation is showing clinical signs of graft rejection. Which of the following is not significant? So ito yung mga clinical signs ng renal transplant or renal transplant graft rejection. Okay, so may fever. Ayan, so positive to. Merong elevated. May decreased creatinine clearance, so hindi siya elevated. So this is negative. Merong weight gain. Ayan, usually 0.9 to 1.4 kilogram na weight gain. So this is positive. And may elevated blood and white blood cells. So the answer here is boy. Okay, kasi merong decreased creatinine clearance. Okay? 5, 4, 3, 2, and 1. 52. Which location of urethral stones cannot be treated with stenting alone? Okay. So yung proximal ureter, ayan. So yung location of urethral stones sa proximal, ayan, they can be treated by stenting alone. So, hinanap kasi natin dito, cannot. So, negative. Positive yung proximal ureter. Distal, kapag naman sa distal, yung location ng urethral stones, ayan, they can also be treated by a stenting alone. Okay, so positive tong distal. Walang anterior ureter. Ayan, so mid-ureter naman, and hindi naman indicated na pwede siyang patreat by stenting alone. Okay? Ayan, usually by uteroscopy. Okay, so the answer here is apple. 5, 4, 3, 2, and 1. Julio was admitted to the ER due to prostatitis, okay, or the inflammation of the prostate gland. Which of the following assessment finding is indicative that prostatitis is not bacterial in nature? Okay, so not bacterial. Di ba usually kapag may mga fever, ganyan, it is bacterial. So since tinatanong not bacterial, positive tong apple. Okay? Lang. Difficulty urinating, and kapag di ba may pain, usually this is bacterial. Okay? And ang hindi lang kasama dito, yung abacterial is hematuria. Okay? Ito yung mga most common na symptoms ng abacterial prostatitis. So may backache, dysuria. Dysuria can be also seen in bacterial prostatitis. Okay? Kaya naging positive siya. Perineal pain, frequency, hematuria, and irregularly enlarged firm and tender prostate. Yung tenderness can be also found in bacterial prostatitis. Okay, so the answer is cat. 5, 4, 3, 2, and 1. Hester is scheduled for prostatectomy. Which of the following surgical approach is not considered for incision? So ito yung mga surgical approaches for prostatectomy. We have retropubic, perineal, and suprapubic. Okay? So, hindi lang kasama dyan yung pelvic. Ayan. Ayan. So, the answer is no. 5, 4, 3, 2, and 1. So, ito sa retropubic, meron siyang low abdominal incision. Kapag naman perineal approach, this involves an incision between the scrotum and the anus. Ayan. And then kapag naman suprapubic approach, midline yung abdominal incision. Okay? 5, 4, 3, 2, and 1. Bruja arrives at the emergency department with complaints of low abdominal pain and hematuria. The client is afebrile. The nurse next assesses the client to determine a history of which condition. Okay? Okay, which condition? Nephritis. Ayan, pyelonephritis, glomerulonephritis, di ba? Yan yung may mga inflammation. Usually, meron niyang fever. Febrile nga ang client mo. So, X to. Renal cancer. Usually painless yan. Okay, so walang pain. May pain ang client. So, X din to. Ang best answer dito ay trauma to the bladder or abdomen. Kaya may hematuria. Okay, so 55 cat. 5, 4, 3, 2, and 1. 56. Nurse Janelle is collecting data from a client. Which symptom described by the client is characteristic of an early symptom of benign prostatic hyperplasia? So again, BPH is a condition in men in which the prostate gland is enlarged and not cancerous. So, kaya nga siya benign. Okay? So early symptom daw, constipation and edema are not associated with BPH. Okay? So X yan. Pwede naman siya magkaroon ng nocturia. Ayan. Pero ang early symptom ng BPH ay decreased force in the stream of the urine. Okay? Ayan. That later on, the stream becomes weak and dribbling. Okay? Una muna may decreased force lang. So 56 is to. 5, 4, 3, 2, and 1. 57. Which among the following medications for preventing organ rejection is categorized as cytotoxic? Okay? And cytotoxic meaning substance that kills cells, including cancer cells. Okay? Cyclosporine, this is an immunosuppressant. Prednisone naman, this is a glucocorticoid. And basiliximab, this is an antibody. Okay? So the answer here is azathioprine. It is a cytotoxic. It is cytotoxic. 5, 4, 3, 2, and 1. Which hematopoietic growth factor is leukopoietic? Ibig sabihin ng hematopoietic, ayan, it's the formation of the new blood cells. In this case, ang tinatanong ay leukopoietic. Ayan, so this is formation of new WBCs. Okay, so saan yun dito? Epoetin, ayan, this is for RBCs. Actually, yung B, C, and D, ayan, itong tatlo, this is for, this is for the formation of the RBCs. Ang hindi lang dyan kasama ay yung Filgras team, which is for the formation of the WBCs, which yung hinahanap natin. 59 is apple. 5, 4, 3, 2, and 1. 59. Betanicol chloride is prescribed for a client with urinary retention, which disorder would be contraindication to the administration of this medication. Okay? Okay, so something we have to know about betanicol chloride, ayan, this hazardous to clients with urinary tract obstruction or weakness of the bladder wall. Okay? Ayan. So, wait lang. So, meron siyang ability na mag-contract ng bladder, thereby increase pressure within the urinary tract. Elevation of pressure within the urinary tract could damage or rupture the bladder in the clients with this condition. So, may kinalaman sa urinary tract. Siyempre, X itong gastric. Okay? Yung neurogenic atony naman, ayan, this just indicates yung mga pasyente na may na walang bladder control due to a brain or spinal cord or nerve problem. Ayan. So, hindi siya dahil sa betanicol chloride. Okay. Wait lang. Sika siya. So, yan yung neurogenic atony. So, the answer here is urinary strictures. Strictures meaning narrowing. Okay? Ayan. So, contraindicated siya dyan. Kasi narrow na nga. Tapos, i-contract mo pa. So, mag-i-increase yung pressure dyan, magkakaroon ng damage and rupture sa bladder. Okay, so 59 is POY. 5, 4, 3, 2, and 1. Oxybutynin chloride is prescribed for a client with urge continence, which sign would indicate a possible toxic effect related to this medication. Okay? So, dito, ayan, may urge incontinence, meaning may lack of bladder control. So, toxic meaning na-overdose siya dito sa gamot na to. Wait lang. Yung pallor, hindi yan side effect. Okay, so X yan. Drowsiness is a side effect, frequent side effect yan, pero it doesn't indicate overdosage or toxicity. Okay, so X din yan. Wala siyang side effect na bradycardia. Usually it is tachycardia, so X rin yan. The answer here is restlessness. Ayan. Because of its production of central nervous system excitation. Okay, so kaya may restlessness. So 60 is dog. 5, 4, 3, 2, and 1. The rifenacin is prescribed to your patient Totoy for his overactive bladder. Which of the following should you not include in your nursing intervention? Okay, teka lang. And kapag sinabi extended release capsules, dapat hindi yan i-split, chew, or crush. Okay? Kaya nga extended release. Okay? Yan. So, X to. Instruct the client to avoid hazardous activities because of the effects of dizziness and drowsiness. This is positive. Monitor intake at output. This is also positive. And yan, indicated na mag-provide ng gum or hard candy for dry mouth sa clients na nagtitik ng darifenacin. Okay? Ayan. So, ang answer dito ay apple kasi they should not be split, chewed, or crushed. Okay? Ayan. So, 61 is apple. 5, 4, 3, 2, and 1. Lilay Joy, a client with UTI, is receiving ciprofloxacin by IV route. The nurse appropriately administers the medication by performing which action? So, paano ba ina-administer yan? Wait lang. X tong boy kasi hindi naman siya light sensitive. Okay? So, hindi mo kailangan ilagay yan sa light protective bag. Usually, peripheral line siya ina-administer. Okay? So, X yan. Rapidly, hindi. Tsaka, hindi na siya binibigay through IV push. Okay? So, X yan. So, the answer here is infuse slowly over 60 minutes to minimize discomfort and vein irritation. Okay, so 62 is apple. 5, 4, 3, 2, and 1. Level 2 na pala, guys. So, we will resume with 63 after lunchtime. Okay, so may remaining pa tayo na around, ilan ba? 40, 30, 37, 137 items. So, pwede na ang 3 hours doon. 50 items per hour. So, since hanggang 4 naman tayo, we can resume again at 1. Okay? Ayan. Okay, so sabi dito, hi ma'am, pwede po pa-clarify ng answer sa question. Kasi sa pang-pedya lang daw ang Wong Bakers. Hindi daw po ginagamit sa adult. Medyo confusing lang po. Okay, so, ayan, clarify ko lang din na ang Wong Bakers, ayan, ang Wong Bakers, kahit i-research nyo pa yan, it's not only used for pedya. Pero, most commonly, ginagamit siya for pedya. Okay, pero it can also be used for adults. Okay, I hope we're clear on that. Ayan. Okay, so let us resume 1 p.m. Yes, depende pa rin yan sa situation. Okay? Yan. Pero most common talaga siya sa pedya. Kaya baka yun yung sinabi ni sir. Okay? Ayan. Pwede, sinabi daw sa previous recalls, pwede daw po ang Wong speaker kapag immediate assessment and severe pain. Okay. Ayan. So, okay na tayo dun, ha? Alright. So, lunchtime, 1 p.m. Balik tayo, guys. Okay? Balikan nyo. Okay. 1 p.m. All right. Thank you so much and see you again after lunchtime.
Blackpink in your area. Blackpink in your area. 컴백이 아니던 난 적 없으니까 고개들이 돌아 진정에 못 걷길라 분홍빛의 얼음 drip 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 freeze on 사이 shut it down. What 게임이 아니야 뛴 적이 없으니까 지저분이 목에 먹줄은 내 거니까 땅바닥에 단패로 we go 205 shut it down. 초록빛을 내려 머리 위로 don't trip baby 겸손하게 그냥 앉아있어 just sit baby praying for my downfall many have tried baby catch you when you hit my Lamborghini go vroom 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 when we pull up you know it's a shutdown 간판 내리고 문 잠궈 shutdown whip it 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 it's black and it's pink once the sundown when we pull up you know it's a shutdown 간판 내리고 문 잠궈 shutdown whip it 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 keep watching me shut it down nah you don't wanna be on my best side that's right I'm sliding through bunch of wannabes that wanna be me me three if I was you been around the world pros on your girl VVS is be invested need a lesson see the neck and see the stresses we don't buy we recursing a rock star a pop star but rowdy I say bye to the paparazzi get my good side I'll smile for ya no it ain't fair to ya it's staring you like what now Blackpink in your area the area been shut down it's a shutdown 네 다음 답안지야 똑바로 봐도 sleep baby 뒤집어봐 이건 가격표야 ain't cheap baby stay in your own lane cause I'm about to swerve catch me when you hit my Lamborghini go vroom 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 when we pull up you know it's a shutdown 간판 내리고 문 잠궈 shutdown whip it 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 it's black and it's pink once the sundown when we pull up you know it's a shutdown 간판 내리고 문 잠궈 shutdown whip it 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 keep watching me shut it down. Shut you down. 지금 화려했지 makes no sense you couldn't get a dollar out of me 자 오늘 밤이야 눈독을 품고 네 혼을 뺏은 다음 look what you made us do 천천히 널 잠재울 fire 잔인할만큼 아름다워 I bring the pain like this that pink venom this that pink venom this that straight till you come like whoa 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 straight till you come like taste that pink venom taste that pink venom taste that pink venom get 'em straight till you come like whoa 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 straight till you come like black pen and aim who got bodies like Rambo rest in peace please light up a candle this the life of a vandal messed up and I'm still in some lead deciding crime so it wouldn't be me diamond shining driving silence I don't mind it I'm riding flying private side by side with a pilot up in the sky and I'm wild and silent on him and there's no chance so slow dance. 자 오늘 밤이야 난 속을 품은 꽃네 혼을 뺏은 나 Look what you made us do 천천히 널 잠재울 fire 잔인할 만큼 아름다워 I bring the pain like
This that pink venom, this that pink venom, this that pink venom. Get 'em, get 'em, get 'em. Straight to your don't like. Whoa, whoa, whoa. Straight to your don't like. Taste that pink venom, taste that pink venom, taste that pink venom. Get 'em, get 'em, get 'em. Straight to your don't like. Whoa, whoa, whoa. Straight to your don't like.
원한다면 provoke us 감당 못해 and you know this 이미 퍼져버린 shot that potion 네 눈앞은 핑크빛 ocean Come and give me all the smoke 좋아지면 more like I'm so rock and roll Come and give me all the smoke 다 줄 세워봐 just stop drop I bring the pain like Ra-ta-ta-ta 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 Ra-ta-ta-ta
Straight to your, straight to your, straight to your don't like.
Ra-ta-ta-ta 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 I bring the pain like 오늘 하루도 내 머릿속에 놓지 과연 you Can't get you out of my head 밤새 비워낸 병에 새긴 blue Yeah 넌 도대체 몇 번을 내 맘 가져다 버린 건지 몰라 생각에 기차는 쉬지 않고 달려가 밤새 못 자
Yeah, 넌 아쉬울 때만. Yeah, 그저 아쉬울 때문에. Yeah, 그래 아쉬울 때라도 너라면 좋으니까.
이젠 기다릴 것도 없잖아 겁낼 필요도 없잖아 네 심장의 색깔을 보여줘 정말 내 세상에 네가 필요해 두 눈을 떠봐 네 앞에 Here I am I'm ready for love Tell me when you're ready cause I'm already ready Tell me when you're ready cause I'm ready for love
I'm ready for love, I'm ready for love.
I'm ready for love I'm ready for love
Ready or not, here I come and I'm running like a snail. I never know if you wanted what if love wasn't what it was supposed to be. What if there's no Romeo for me? No hope, no roses, no more notes to read. So I keep my eyes closed to see what I need is forever and forever, baby, not sometimes. When you want it, then you best come find me, cause I'm ready.
이젠 기다릴 것도 없잖아 겁낼 필요도 없잖아 네 심장의 색깔을 보여줘 정말 내 세상에 네가 필요해 두 눈을 떠봐 네 앞에 Here I am I'm ready for love Tell me when you're ready cause I'm already ready Tell me when you're ready cause I'm ready for love
I'm ready for love, I'm ready for love.
I'm ready for love I'm
자꾸 망가져도 나뭘 믿고 버티는 거야 어차피 떠나면 상처 조성이 채로 미워하게 될걸 끝장을 보기 전 끝낼 순 없어 이 아픔을 기다린 것처럼 아마 다 잠깐일지도 몰라 우리 무얼 찾아서 헤매는 걸까 But I don't care do it over and over 내 세상 속에 너만 있으면 돼 We are the lovesick girls 네 맘대로 내 사랑을 끝낼 순 없어 We are the lovesick girls 이 아픔 없이 나는 의미가 없어 But we were born to be alone Yeah we were born to be alone Yeah we were born to be alone But while we're still looking for love No love letters, no X and O's No love, never my exes, nope No diamond rings, that's set in stone To the left, better left alone Didn't wanna be a princess, I'm priceless A prince not even on my list Love is a drug that I quit No doctor could help when I'm lost 아마 다 잠깐일지도 몰라 우리 뭘 찾아서 헤매는 걸까 불안한 내 눈빛 속에 널 담아 아프더라도 너만 있으면 돼 We are the lovesick girls 네 맘대로 내 사랑을 끝낼 순 없어 We are the lovesick girls 이 아픔 없이 나는 의미가 없어 But we were born to be alone Yeah we were born to be alone Yeah we were born to be alone But while we're still looking for love 사랑은 쏟히는 falling 사랑은 killing your darling 아프다 아물면 또 탄탄해 네 겁없는 떨림 들리지 않아 what you say 이 아픔이 난 행복해 나를 불쌍해하는 네가 내 눈엔 더 불쌍해 네 맘대로 내 사랑을 끝낼 순 없어 We are the lovesick girls 이 아픔 없이 나는 의미가 없어 Lovesick girls 모두 결국 떠나가고 내 눈물이 묻혀져도 아프고 또 아파도 But we're still looking for love Blackpink in your area 보란 듯이 무너졌어 바닥을 뚫고 저 지하까지 엊그처럼 잡겠다고 저 높이 두 손을 뻗어봐도 다시 캄캄한 이곳에 light up the sky 네 두 눈을 보며 I kiss you bye 실컷 비웃어라 꼴좋으니까 이젠 너희 하나 둘셋 How you like that? You gon' like that? Da-da-da-da-da-da-da. How you like that? How you like that? Da-da-da-da-da-da-da. Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Your girl need it all and that's 100 패킷 중에 100 내 몫을 원해 come on get some 난 같지만 어쩔 순 없잖아 What's up I'm right back 방금 sweater cut back plain Jane get hijacked don't like me then tell me how you like that 더 캄캄한 이곳에 shine like the stars 그 미소를 띠며 I kiss you goodbye 실컷 비웃어라 꼴좋으니까 이제 너희 하나 둘셋 How you like that? You gon' like that? Da-da-da-da-da-da-da. How you like that? How you like that? Da-da-da-da-da-da-da. Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? Now, look at you, now look at me. Look at you, now look at me. Look at you, now look at me. How you like that? 딱딱한 감정에 너게 얼어 죽을 사랑해 이만큼 끼긴 해도 가장 독한 걸로 줘 뻔하디 뻔한 그 love 더 내놔받기는 써머 알아서 매달려 벼랑 끝에 한마디만 더 like 해볼래 해 그 따뜻한 떨림이 새빨간 설렘이 마치 해변가까지만 you might not get in it
Look at me, look at you. 누가 더 아플까? You smile. 누가 you are. 내 눈에 피눈물 흐르게 된다면 so sorry. 누가 you are.
어떡해 나약한 나에 견딜 수 없어 서로를 가린 채 사랑의 숨통을 끊어야겠어 Let's kill this love Yeah 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 람파파파파파파 Let's kill this love 람파파파파파파 Feeling like a sinner, it's so far with him. I go, but who? He said, you look crazy, thank you, baby. I'll eat all to you. Got me all messed up. His love is my favorite, but you plus me sadly can be dangerous. Look at me, look at you. 결국엔 거짓말 we lie. So what, so what? 만약에 내가 널 지우게 된다면 so sorry. I'm not sorry. 나 어떡해 나약한 날 견딜 수 없어 했던 눈물을 감춘 채 사랑의 숨통을 끊어야겠어 Let's kill this love Yeah 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 람파파파파파파 Let's kill this love 람파파파파파파 We all commit to love that makes you cry. Oh, we're all making love that kills you inside. Yeah, we must kill this love. Yeah, it's sad but true. Gotta kill this love before it kills you too. Kill this love. Yeah, it's sad but true. Gotta kill this love. Gotta kill. Let's kill this love. Like me. Oh yeah, oh yeah. Like me. Oh yeah, oh yeah. Yeah. 착한 얼굴에 그렇지 못한 태도 간녀린 몸에 쏙 가려진 볼륨은 두 배로 거침없이 찍힌 굳이 보진 않진 않지 Black 하면 pink 우린 예쁘장한 savage 원하던 대놓고 뺐지 너무래도 칼로 무배기 두 손엔 가득한 fat checks 궁금하면 해봐 fact check 눈 높인 꼭대기 물 만난 물고기 좀 톡해 난 toxic 유혹해 I'm foxy 두 번 생각해 흔한 남들처럼 착한 척이 못하니까 착각하지 마 쉽게 웃어주는 건 날 위한 거야 아직은 잘 모르겠지 그저 원하면 test me 넌 불 보듯이 뻔해 만만한 걸 원했다면 Oh wait till I do what I hit you with that do-do-do-do Oh yeah, oh yeah Hit you with that do-do-do-do Oh yeah, oh yeah Blackpink 지금 내가 걸어가는 거린 Blackpink four-way 사거리 동서남북 사방으로 running 이는 bucketlist 싹 다 버려 널 당기는 것도 멀리 밀치는 것도 제 멋대로 하는 bad girl 조건 싫어하고 누가 뭐라 하던 with a bass drop it's another banger 두 번 생각해 흔한 남들처럼 착한 척은 못하니까 착각하지 마 쉽게 웃어주는 건 날 위한 거야 아직은 잘 모르겠지 굳이 원하면 test me 넌 불 보듯이 뻔해 만나는 걸 원했다면 Oh wait till I do what I hit you with that do-do-do-do 넌 뭔데 자꾸 생각나 자존심 상해 애 같아 얼굴이 뜨겁고 가슴은 계속 뛰어 내 몸이 맘대로 안 돼 어지러 넌 한 줌의 모래 같아
야, 내 삶은 on top notch 관계 섭섭하지 않게 만들어버린 너라는 백 하나부터 열까지 모든 게 특별하지 너의 관심사 걸음걸이 말투와 사소한 작은 습관들 같이 난 말했지 너무 작다 내가 영웅이 된 거라고 난 말했지 운명 따윈 전부터 내게 아니었다고 세계의 평화 어디 앉아서 그저 널 지켜봐 날 이상한 baby 나는 저 하늘을 높이 날고 있어 그저 네가 내게 조금 더 날개로 이제 여기 너무 높아 내 눈을 널 맞추고 싶어 Yeah, you make it on me, you're a boy with love. Oh my mama, oh my mama. You get me high so fast. 내 전부 함께 하고 싶어. Oh my mama, oh my mama. You get me fly so fast. 이제 조금은 나 알겠어. Love is nothing stronger. 너만 부르고 있어, 내 boy with love. Love is nothing stronger.
까놓고 말하길 나도 모르게 힘이 들어가기도 했어 높아버린 sky 커져버린 헛 때론 도망치게 해달라며 기도했어 But 너의 상처는 나의 상처 깨달았을 때 나 다짐했던 걸 네가 준 이 그 후세 나에게로 태양이 아닌 너에게로 Let me fly
Oh my mama, oh my mama. I faded all my life. 내 전부 함께 하고 싶어. Oh my mama, oh my mama. Looking for something right. 이제 조금은 나 알겠어. I want something stronger than a moment, than a moment, love. Love is nothing stronger.
Can't call me artist Can't call me idol 아님 어떤 다른 뭐라 해도 I don't care I'm proud of it 난 잘없네 너무 알았네 나는 항상 나였길 손가락질 해 나는 전혀 신경 쓰지 않네 나는 역할을 내 그 이유가 뭐든 간에 I know what I am I know what I want I never gon' change I never gon' trade Face on my T on some A Top star with that spotlight A 때론 superhero가 돼 돌려대는 게 안방해 Wow 유심 서식 가네 적실 가네 내게 사칭 I do my thing I love myself I love myself I love my fellow my best and my way 내 손안에 몇십 명 백 명의 내가 있어 오늘도 다른 날 맞이해 어차피 전부 다 나에게 고민보다는 내 다니는 Running man running man running man 뭘 어쩌고 저쩌고 떠들어도 돼 Talk I do what I do 그게 너는 잘하셔 You can't stop me loving my 날 위해서라면 난 슬퍼도 기쁜 척할 수가 있었어. 널 위해서라면 난 아파도 강한 척할 수가 있었어. 사랑이 사랑만이 너 완벽하게 내 모든 약점들은 다 숨겨지게 이루어지지 않는 꿈속에서 피할 수 없는 꽃을 키웠어. I'm so sick of this fake love, fake love, fake love. I'm so sorry but it's fake love, fake love, fake love. I wanna be a goner just for you. 세상을 줘는 just for you. 전부 바꿔서 just for you. 나를 너무 who are you? Hey, 우리만의 수 너는 없어. 내가 완전 루 잊어버렸어. 나도 내가 누구였는지도 잘 모르게 됐어. 거울에다 뒤걸려봐 너는 대체 누구니? 위해서라면 난 슬퍼도 기쁜 척할 수가 있었어. 널 위해서라면 난 아파도 강한 척할 수가 있었어. 사랑이 사랑만을 너무 완벽하게 내 모든 약점들을 다 숨겨지게 이루어지지 않는 꿈속에서 피울 수 없는 꽃을 키웠어. Like you're so bad, like you're so bad. 날 위해 예쁜까지 쓸기 전에 Love you so bad, love you so bad. 널 지원해 여기들을 해. Like you're so bad, like you're so bad. 날 위해 예쁜까지 쓸기 전에 Love you so bad, love you so bad. 널 지원해 여기들을 해. I'm so sick of this fake love, fake love, fake love. I'm so sorry but it's fake love, fake love, fake love. Why you sigh? I don't know. 나 몰라. 웃어봐. 사랑해. 말해봐. 나를 봐. 나조차 못 나. 너조차 이해할 수 없느냐. 낯설다 하는 네가 좋아하던 나를 변한 내가 아니라 하는 예전에 네가 잘 알고 있던 내가 하는 게 뭐가 난 멀었어. 사랑은 너가 살아. It's so fake love. Ooh, I don't know, I don't know, I don't know why. Ooh, 나도 날 모르겠어. Ooh, I just know why. 'Cause it's a fake love, fake love, fake love. And now you're so bad, now you're so bad. 날 위해 예쁜까지 쓸기 전에 Now you're so mad, now you're so mad. 날 지워놔 이런 기대려 해. And now you're so bad, now you're so bad. 날 위해 예쁜까지 쓸기 전에 Now you're so mad, now you're so mad. 날 지워놔 이런 기대려 해. I'm so sick of this fake love, fake love, fake love. I'm so sorry but it's fake love, fake love, fake love. 널 위해서라면 난 슬퍼도 기쁜 척할 수가 있었어. 널 위해서라면 난 아파도 강한 척할 수가 있었어. 사랑이 사랑만을 너무 완벽하게 내 모든 약점들은 다 숨겨지게 이루어지지 않는 꿈속에서 피울 수 없는 꽃을 키웠어. 처음엔 널 알아보게 됐어. 서로를 불러왔던 것처럼 매일 연습비에 네가 말해줘. 내가 찾아 헤매던 너라는 걸. 우리 만남을 수학의 공식 종교의 유법 공주의 선미 내게 주어진 운명의 증거. 너는 내 꿈의 출처. 세계 너에게 내민 내 손은 정해진 숙명. 걱정하지 말라. 이 모든 건 우연이 아니니까. 우리 완전 달라 baby. 운명을 찾아내
생긴 그날부터 계속 무한의 세기를 넘어서 계속 우린 저 생에도 아마도 생에도 영원히 함께니까 모든 건 우연이 아니니까 우연을 찾아낸 둘이니까
I want it this love I want it real love 난 너에게만 집중해 좀 더 세게 날 이끄네 태초의 DNA 네가 널 원하는데 이건 필연이야 I love it 우리만이 true love it 그녀를 볼 때마다 서술화책에 놀라 신기하게 자꾸만 숨이 멎는 참 이상해 설마 이런 게 말로만 듣던 사랑이란 감정일까 애초부터 내 심장은 널 향해 두니까
하지 말라 이 모든 건 우연이 아니니까 우리 완전 달라 baby 운명을 찾아낸 둘이니까 우주가 생긴 그날부터 계속 무한의 세계를 넘어서 계속 우리 저 생에도 아마도 생에도 영원히 함께니까 모든 건 우연이 아니니까 운명을 찾아낸 둘이니까
돌아보지 말라 운명을 찾아낸 우리니까
후회하지 마라 baby 영원히 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 함께니까 걱정하지 말라 모든 건 우연이 아니니까 우리 완전 달라 baby 운명을 찾아낸 둘이니까 우연이 아니니까 우연이 아니니까
누가 내 수저 더럽 babe I don't care 마이크 잡은 굽 수저 여러 배 버럭 해 잠옷 입은 것들 새끼 여러 개 거듭 벌써 씹어 죽겠어 에이 저녁에 World best now 핵심 섭외 1순위 매진 많지 않지 이 클래스 같이 많기 동향의 악진 반칙 마이크 번지 마이크 번지 black 전진 난 알 것 같았겠지만 I'm fine sorry 미안해 billboard 미안해 worldwide 아들이 너무 잘 나가서 미안해 엄마 대신해줘 네가 못한 협조 우리 콘서트 절대 없어 포도 I do it 너만 없는 let I do it 어깨가 아프다면 고소해 Just see my back you just see my back 옆이 들고 빨리 가득 How you feel about it how you feel about it Hate it good so how you feel 이미 황급해 나의 성공 I'm so fire 성나 봉조 너는 황급해 도면 형조 How you there how you there how you there 너는 so free 너무 많나 너무 heavy 내 두 손이 못 잡나 발발 너네 말말 이러리저리 너무 바빠 너무 busy 내 몸이 모자라 지금 완전 내게 자 풀리기 좀 Once upon a time 이 소부가 싸 이거는 지는 봐라 샘샘처럼 지금 죽어도나 행복 이번에 너를 따라가 비행기가 시간을 타 Yeah with the mountain yeah with the bird 언젠가 꽃은 지겠지 But no, not today 그때가 오늘은 아니지 No, no, not today 아직은 죽기에는 더 그때 No, no, not today No, 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 not today 그래 우리는 extra But still part of this world Extra plus ordinary 그것도 별거 아니야 오늘은 절대 죽지 마라 빛은 어둠을 뚫고 나가 새 세상 넌 원해 Baby yes I want it wow 날아갈 수 없음 뛰어 Today we will survive 뛰어갈 수 없음 걸어 Today we will survive 걸어갈 수 없음 기어 기가서라도 길러 그나 참 찾아는 발사 Not today Not today 멘트들 하다 hands up 친구들 하다 hands up 나를 믿는다면 hands up 참 찾아는 발사 죽지 마라 묻지 마라 소리 질러 Not today 걷지 마라 오지 않아 손을 들어 Not today Not today Not today Not today 찾아는 발사 Too hard 성공을 double Too hard 샷들이 덤블 Too high 네 own trampoline Too high 누가 좀 멈춰길 우리 할 수가 없어 단나 쇼파 서로가 서로 덤봅니다 yeah What you say yeah Not today yeah 오늘은 안 죽어도 say yeah 너 곁에 나를 믿어 Together we will die 나 곁에 너를 믿어 Together we will die 함께라는 말을 믿어 방탄이란 게 믿어 그나 참 찾아는 발사 Not today Not today 랩새들 하다 hands up 친구들 하다 hands up 나를 믿는다면 hands up 참 찾아는 발사 죽지 마라 묻지 마라 소리 질러 Not today 걷지 마라 오지 않아 손을 들어 Not today Not today Not today Not today 찾아는 발사 누구 속에 두려움 따위는 버려 널 가득는 유리창 장 따윈 부숴 승리의 그날까지 거짓말 지금은 Not today Not today Not today 랩새들 하다 hands up 친구들 하다 hands up 나를 믿는다면 hands up 찾아는 발사 죽지 마라 묻지 마라 소리 질러 Not today 걷지 마라 오지 않아 손을 들어 Not today Not today Not today Not today 찾아는 발사
내 피땀 눈물 내 마지막 춤을 다 가져가 내 피땀 눈물 내 차가운 숨을 다 가져가 내 피땀 눈물
피땀 눈물도 내 몸, 마음, 영혼도 너의 것인 걸 잘 알고 있어 이건 나를 벌받게 할 줄 Peaches and cream, sweeter than sweet Chocolate cheeks and chocolate wings But 너의 날개는 악마의 걸 너의 그 sweet 앞엔 비려비려 Kiss me 아파도 돼 어서 날 조여줘 더 이상 아플 수도 없게 Baby 취해도 돼 이제 널 들이켜 넌 whiskey
내 피땀 눈물 내 마지막 춤을 다 가져가 내 피땀 눈물 내 차가운 숨을 다 가져가
지고 나 흔들어줘 내가 정신 못 차리게 Kiss me on the lip 수만의 빛 너란 감옥에 중독되게 이게 아닌 다른 사람 선비지 너 알면서도 삼켜버린 독이듯
피땀 눈물 내 마지막 춤을 다 가져가
내 피땀 눈물 나 자꾸 숨을 다 가져가
One and money 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 One and money 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 One and money 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 One and money 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 나를 꼭 이렇게 줄게
Everest is only a mountain. A pyramid is just a shape. Doesn't have to hold you back, doesn't have to pin you down. Let your dreams take flight in your heart. Ignite. Did you know that it's true? Everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. And I believe in you. Don't be afraid to be who you are, just scream out and shout and follow the stars. Forget about the past, that it's over. We are the young ones, our way is forward. Who keeps tabs on stupid mistakes? We all mess up, but that's just the way. We learn how to get back up, we learn how to turn the page. So we will let our dreams take flight, and our hearts ignite. Did you know that it's true? Everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. And I believe in you. Let your dreams take flight in your heart. Ignite. Did you know that it's true? That everything is possible. There's nothing we can't do. It's a wild and beautiful fire, and I believe in you. Oh, I believe in you. I believe in you.
Hi everyone! good afternoon. Ayan, 1 p.m. na. Tapos na ba lahat kumain? Hi, good afternoon, Sir John Benedict. Ayan. Hello, hello sa iyo, Ma'am Mary. Okay. So, ayan, para malaman ko kung nandito na kayo lahat, paki-type 1 nga for top 1. Paki-type 1 for top 1. Ayan. Thank you so much, guys. Ayan. What is your goal? Top rankers, what is your goal? TTBE, to top the board exam. Hindi to stop the board exam, ha? Ayan. Okay, so let us resume with NP4. Ayan. So, situation, Nurse Cyrus is a fresh grad assigned to neuroscience unit. He's being oriented about the different neurological assessment tools commonly used in the unit. His preceptor started teaching him the National Institute of Health Stroke Scale, or NIHSS, which uses an 11-item scale to measure neuroimpairment and is used as a predictive value of the clinical outcomes of an acute stroke. So the best score for NIHSS is, ayan, so mas mababa, mas maganda. Kasi 0 is no stroke symptoms. Ayan, since yun yung goal natin, di ba? Wala nang symptoms ng stroke ang pasyente. And mas mataas ay, mas mataas ang severity. So yung best score, syempre, ay mas mababa. So the answer here is dog, 0, which indicates no stroke symptoms. Okay, so 63 is dog. 5, 4, 3, 2, and 1. Ayan. So 64, Nurse Cyrus, accompanied by his preceptor, performed NIHSS assessment on his patient. He asked the patient to raise his eyebrows, then close his eyes. Nurse Cyrus noted an absence of facial movement on the left side of the face and scored it as. Okay, so dito, when assessing for facial palsy, ayan, yung scoring natin na 0, kapag normal, may normal symmetrical movements. 1 naman for minor paralysis. Ayan. So may asymmetry on smiling, may flattened nasolabial fold. 2 naman is partial paralysis. There is total or near total paralysis of lower face. And 3 naman kapag complete paralysis of one or both sides. Okay, so may absence of facial movement in the upper or lower face. Okay, so this time, ayan, may absence of facial movement on the left side, which is isang side lang siya and is considered as complete paralysis. So the answer here is apple 3. Okay, 5, 4, 3, 2, and 1. Okay, wait pala guys, nakalimutan ko. Sinend ko nung kaka-break lang yung difference ng inguinal and ng incarcerated hernia. Okay, so send ko lang ulit sa mga hindi nakakita. Okay, ayan. So yung hernia, ayan. Hernia is considered incarcerated if the hernia cannot be massaged back into the original cavity. So, hindi siya nababalik. Yun yung meaning ng incarcerated hernia. Kapag naman inguinal, ayan, sa location lang siya ng hernia. So, in the groin region, yung hernia. Okay? Ngayon, ang tanong kung bakit binibigyan natin ng fat-soluble vitamins ang may biliary atresia. Kasi nga, di ba, yung fat-soluble vitamins, nadidissolve siya sa fats and sa oils. Kung may biliary atresia, hindi na-absorb yung vitamin A, D, E, and K. Kaya kailangan na i-supplement yon sa pasyente. Okay? Ayan. Kasi nga, hindi na-dissolve yung fats. Okay? So wala tayong masyado binibigyan ng fats sa pasyente kasi nga hindi ito na-metabolize. Okay? So hindi ma-dissolve yung vitamin na yun or hindi siya ma-absorb. Okay? Kaya we supplement A, D, E, and K. Alright? So I hope gets yun. Ay, sorry, hindi ko pala na-send. Thank you, Ma'am Mahela. Ayan. Okay. Ayan. Alright. So 64 is apple. Ayan. 5, 4, 3, 2, and 1. Pala na-resend. Ito na enter. So 65, when assessing the motor movement of the patient, Nurse Cyrus asked the patient to extend his arm at 90 degrees and noted that the left arm is only able to extend for a total of 6 seconds. He writes down the equivalent score as, and so when assessing the motor arm, ito yung scoring. So, sabi dito, 90 degrees. Yan. So, saan yun dito yung 90 degrees? Holds at 90 degrees for full 10 seconds yung 0. Kapag naman 1, holds 90 degrees but before full 10 seconds. So, this is the answer kasi 6 seconds lang to. The answer is dog 1. Okay? 5, 4, 3, 2, and 1. 66. After assessing the limbs of the patient, Nurse Cyrus is now assessing the patient's best language, where he asked the patient to read out some sentences. The patient was only able to respond with a slight nodding of the head and was unable to use speech. Okay, so 0 is normal, 1 is mild to moderate aphasia. Ayan. Lang. Wala tong significant limitation on ideas, express, or form of expression. Dito kasi meron siyang limitation na. Kasi may slight nodding lang, tapos di siya makagamit ng speech. So, saan to? All communication is through fragmentary expression. So, the answer here is, kasi slight nodding lang siya, the answer is C2. Okay? Severe aphasia. Ayan. 5, 4, 3, 2, and 1. 67. At the end of the assessment, the patient scored a total of 11, which Nurse Cyrus knows is considered so yung score niya daw is 11. Dito siya. Okay, moderate stroke. So the answer here is cat. 5, 4, 3, 2, and 1. Situation: aspiration pneumonia is one of the major risks after a stroke due to acute onset of dysphagia. Okay, early identification of dysphagia is essential, but to not only prevent aspiration, but also dehydration, malnutrition, weight loss, and susceptibility to other illnesses. Okay, so the GUSS, or yung goggling swallowing screening, is one of the bedside dysphagia screening tools that is used in the hospital setting. It assesses the severity of aspiration risk, and the first part of the test is called the indirect swallowing test, which includes, ayan, so ito yung indirect swallowing test, and it includes the vigilance, cough and or throat clearing, and saliva swallow. Okay, so positive tong vigilance, cough and throat clearing, and saliva swallow. Hindi kasama yung voice change and involuntary cough. Okay, 1, 4, 5 is apple. 5, 4, 3, 2, and 1. Okay, next, before performing the GUSS screening, the nurse knows that they must position the patient properly, where the patient must be in at least, okay, so ang indicated na position ay 60 degrees upright position. This is to prevent any accidental aspiration. Okay, so the answer here is dog. 5, 4, 3, 2, and 1. 70. The patient passes the indirect swallowing test and proceeds to do the direct swallowing test, which consists of 4 subtests. Okay, a maximum of 5 points can be scored in each subtest. Knowing this, Nurse Joe gives the patient distilled water with thickener. 1/2 teaspoon was given. Upon observation, Nurse Joe noted delayed swallowing and gave the patient a score of. So in delayed swallowing, ayan, kapag walang swallowing 0, kapag delayed swallowing 1, and kapag swallowing is successful 2, yung score. Okay, delayed swallowing is 1, so the answer is boy. 5, 4, 3, 2, and 1. Next, 71. At the end of the screening, the patient scored a total of 14, which is equivalent to, okay, lang, yan. So ito yung GUSS evaluation. Ayan. So, ang sabi dito is 14 daw. Total score of 14. So, saan yun dito? 14 is, nandito siya. Nasa moderate dysphagia with a risk of aspiration. So, the answer here is cat. Okay? 5, 4, 3, 2, and 1. Is dito. 5, 4, 3, 2, and 1. Next. Knowing that the patient scored 14, Nurse Jo now anticipates that the patient will be given what type of diet. So tingnan natin yung type of diet dito. Yung recommendation ay semi-solid textures such as baby food and additional parenteral feeding. And all liquids must be thickened, pills must be crushed and mixed with thick liquid, no liquid medication, and further functional swallowing assessments needed. Refer to speech and language therapist. Okay, so the answer here is A, semi-solid texture supplemented with nasogastric feeding. Okay? Ayan. 5, 4, 3, 2, and 1. Situation: 35-year-old woman with diagnosis of Huntington's disease is admitted to the nursing unit with pneumonia. Her husband is wondering if he should obtain genetic testing of their 2 children. Okay, so ano ulit yung Huntington's disease? Ayan. It is an inherited disorder that causes nerve cells or neurons in parts of the brain to gradually break down and die. The disease attacks areas of the brain that help control voluntary movement as well as other areas. So kung matatandaan natin, di ba, isa sa mga symptom niya yung chorea, which is an involuntary movement. Wait lang. Ayan. So the nurse working in the genetic counseling office is caring for a client who has the gene mutation of Huntington's disease, but their partner does not. Okay? So yung isang partner ay meron, yung isa wala. What percent chance does the client have of passing the gene to their offspring? So since isa meron, isa wala, 50-50. Okay? So the answer here is boy. Okay? 73 is boy. 5, 4, 3, 2, and 1. Atetosis is one of the symptoms of Huntington's disease. So atetosis is the slower form of chorea. Yan, of chorea. Okay. The nurse correctly identifies that atetosis is present when she notes. Okay, wait lang. Itong involuntary muscle contractions that occur repeatedly in twisting motions, this refers to dystonia. Dystonia. Ayan. Ito namang cat affects one side of the body where the arm is affected more often than the leg. Ayan, maybe itong temporarily disabling because when a person tries to move the limb, it may fling out uncontrollably. Yung uncontrollably flinging out of the limb, this refers to tinatawag na hemibalismus. Yan, one side of the body where the arm is affected. Yan, hemibalismus. Ito namang B, repetitive, brief, irregular, somewhat rapid involuntary movements that start in one part of the body and move abruptly, unpredictably, and often continuously to another part. Ito na yung chorea. Okay? Yan, rapid involuntary movement. And then yung slow version niya, ayan, is atetosis. So the patient has reading motions of the extremities, face, neck, tongue, and other muscle groups that are sluggish, spontaneous, and breathing. Ito na yung atetosis. So this is the right answer, apple. 5, 4, 3, 2, and 1. Situation. Triage comes from the old French word tier, which means to sort. Triage is an important process in nursing where patients are being categorized or prioritized based on the severity of their illness or injury. Okay, 75. The only way to reduce the incidence of trauma is through prevention. So it is important as an ER nurse to be able to provide injury prevention information to every patient they come in contact with daily. Okay? There are 3 components of injury prevention. One of them is automatic protection. Which of the following choices does not involve automatic protection? So kapag sinabing automatic protection, these are mechanisms providing safety without requiring personal intervention. So hindi ko kailangan ng tao. Okay? So saan ba dito hindi kailangan ng tao? Airbags, ayan, smoke alarm, and fire sprinkler. Kailangan na may tumawag sa 911. Okay? Kaya yan yung not involved in automatic protection. Okay? So 75 is cat. 5, 4, 3, 2, and 1. Okay, 76, as the head nurse of the emergency department, it's important to discuss trauma management and injury prevention during meetings. Which of the following options is not included on the components of injury prevention? It's not included daw. So included ang, yan. May tatlong components ng injury prevention. Siya. Ayan, una is yung education, and providing information and materials to help prevent violence and to maintain safety at home and in vehicles. So positive yan. Pangalawa yung legislation. And pangatlo yung automatic protection. Hindi kasama yung hazard detection. Okay? Ayan. 5, 4, 3, 2, and 1. Wait lang. Nagtatanong dito kanina. Wait lang man. Ma'am Korea po is yung St. Vitus's Dunstan. As far as I know, yes. Okay, 76. As the head nurse of the emergency department, it is important to discuss trauma management and injury prevention. Ay, nasagutin natin to. So 76 is dog. 77, you are an ER nurse and you are off duty suddenly. A friend of yours frantically called you for help regarding their 4-year-old child. The child has mistakenly ingested an unknown amount of ferrous sulfate pills. Because the child thought it was M&Ms. The child is now vomiting, has body diarrhea, and is complaining of abdominal pain. You will tell your friend to call this EMS number I'll give you and bring your child to the ER immediately. So, tatawagan daw yung emergency medicine service. Ayun sa ER ba ang tatawagan? Don't worry too much. This is a normal reaction. The symptoms will pass after a few hours and your child will be fine. So ito, may reassurance na nagaganap. Okay? And this is not a normal reaction. Okay? So X yan. Do you have an Ipecac with you? Okay, give 1 tablespoon of Ipecac to your child. Okay, yung Ipecac naman, yan, also known as syrup of Ipecac, is a medication used to induce vomiting. Yan, excuse me. Yan, pero hindi na siya recommended ngayon, yung Ipecac. For teen use in toxic ingestion. Okay. Ayan. So, hindi na siya recommended. So, X yan. Ang mas magandang gawin ay tawagan yung EMS ba or yung Poison Control Center. Since may toxicity na nagaganap, may poisoning. So, mas maganda kung tawagan ang Poison Control Center kesa EMS. Okay? So, 77 is dog. 5, 4, 3, 2, and 1. Yes, very good. 78. An EMT rushes to the ER with an unresponsive diabetic patient. The ER doctor diagnosed the patient with hyperglycemic hyperosmolar non-ketotic syndrome. Which of the following would the nurse immediately prepare to initiate as anticipated doctor's order? Okay? So we know na yung may hyperosmolar non-ketotic syndrome, ayan, ay hyperglycemic hyperosmolar non-ketotic syndrome, sila ay may dehydration. Okay? Kalang. So, kailangan ba siya bigyan ng sodium bicarbonate? Yan. Hindi siya bibigyan ng sodium bicarbonate kasi this further brings down yung serum potassium level of a patient with HHNKS. Okay? Mababa na nga ang serum potassium level niya. Right? So, hindi mo siya bibigyan ng sodium bicarbonate. Endotracheal intubation, hindi naman siya required for treatment of HHNKS. Okay? So, X rin yan. IV infusion of 0.9% sodium chloride or 36 units of Humulin and insulin. Yung Humulin and insulin, ayan, this is an intermediate acting insulin. Ang indicated for HHNKS ay regular insulin or short acting. Okay, so X to, X yan. So the best answer here is IV infusion of 0.9% sodium chloride. Okay, this is to rehydrate the client, to restore the fluid volume, and to correct electrolyte deficiency. Okay, dahil nga may dehydration itong client na to. Alright, so 78 is cat. 5, 4, 3, 2, and 1. The EMT rushes to the emergency department with a patient that was in a vehicular accident. The patient has severe internal hemorrhage, is hypotensive and unresponsive. Which of the following should the nurse immediately prepare to initiate as anticipated doctor's order? Okay, so immediately prepare to initiate. Ayan. So is it normal saline? Itong normal saline, this is isotonic. Okay, ano bang indicated kapag merong tawag dito? May fluid volume deficit. Is it isotonic? Diba mas indicated ang hypertonic solution. Okay, itong normal saline, it is isotonic as well as itong plain lactated ringer solution. Okay, itong boy, yung dextrose lactated ringer solution, this is hypertonic. This can increase intravascular volume and immediately replace lost fluid volume. Okay. How about itong O-negative packed red blood cell? Okay, so mas maganda bigyan ng hypertonic solution kaysa sa wait lang. Hindi, actually mas okay ang blood transfusion kaysa sa magpagbibigay ng hypertonic solution. Pero since matagal pa yan, yung blood transfusion kasi kailangan pa yan i-request and kailangan pang i-test yung blood. Okay, so kailangan muna immediately prepare yung hypertonic solution. Okay, kapag available na yung blood transfusion and so blood transfusion yung ibibigay natin. Okay, so ang answer ngayon ay boy. Right? Best answer is boy. 5, 4, 3, 2, and 1. Hindi tayo magbibigay ng sodium bicarbonate kasi wait lang. Kasi wait lang. Yan, it can further lower the serum potassium levels of a patient with HH and KS. Okay, known na mababa na nga ang potassium levels. Okay, yan, kaya hindi muna tayo magbibigay ng, or hindi tayo magbibigay talaga ng sodium bicarbonate. Okay, next. Answer dito sa 79 is boy ulit, and 80 is a police rushed a woman into the emergency department with severe injuries to the face and the head. The patient was a victim of assault. Upon assessment, you notice that the patient has crescendo, so pagtaas, and decrescendo, pagbaba, pattern of respirations. The kind of respiratory rhythm is known as, okay, so yung Kussmaul's respiration, this is known or is characterized by a rapid, rapid deep breathing at a consistent pace. Ayan. Yan yung Kussmaul's respiration. Yung chain or Cheyne-Stokes respiration naman, characterized by deep breathing followed by shallow breathing. Okay, deep and then shallow. Kapag naman sa rapid deep breathing at a consistent pace, yung sa Kussmaul's, di ba? This is in DKA, diabetic ketoacidosis. Ito naman yung Cheyne-Stokes or Cheyne-Stokes, ayan. This is in increased ICP. And then, next is Biot's respiration. Ito naman, characterized by regular deep respirations interspersed with periods of apnea. Okay, and then ataxic respiration naman, it refers to complete irregularity of breathing with irregular pauses and increasing periods of apnea. Okay, so anong sagot dito? Crescendo and decrescendo. This is Cheyne-Stokes respiration. Okay, or Cheyne-Stokes respiration ay ano. Periodic breathing associated with periods of apnea alternating regularly with series of respiratory cycles. The respiratory cycle gradually increases, then decreases in rate and depth. Okay, so 80 is boy. 5, 4, 3, 2, and 1. The patient with severe severe face and head injuries is prone to which of the following symptoms? So kapag may head injury, di ba, prone sila sa increased ICP. So ano ba dito yung symptom or manifestation ng increased ICP? Usually yung Cushing's triad. Okay? Yung Cushing's triad, it includes yung widened pulse pressure na greater than 40 millimeter mercury. Next naman yung irregular breathing pattern, which is yung Cheyne-Stokes respiration, and yung bradycardia, less than 60. Okay, so saan yun dito? Ang pulse pressure of 28, yan, narrow yan. It's not wide. And then, may bradycardia siya, not tachycardia. Pulse pressure, ayan, tama naman to. May wide pulse pressure siya. May irregular breathing pattern. And bradycardia. So the answer here is boy. Okay, 81 boy. 5, 4, 3, 2, and 1. 82. Your hospital uses the Jumpstart Triage tool for pedia patients less than 8 years old. Using this tool, determine the next intervention to be done. And patient is 5 years old, unable to walk with breathing, RR23 and PR101. Okay, so tingnan natin dito yung step-by-step na Jumpstart Triage tool. Ayan, so dito, able to walk. We determined naman, di ba, na the client is unable to walk. Okay, so no. So dito tayo, may spontaneous breathing ba? Yan, meron. Positive. Okay? Yan, yes. Okay, respiratory rate niya, 23. So yung respiratory niya, rate niya ay 23. So within dito sa range na yan. Chinek yung pulse, meron. Ayan, and yung pulse niya ay 101. Okay, so ang next na gagawin natin, tinatanong kasi next intervention is to determine the AVPU, neurological assessment. Okay, kung alert, verbal, pain, and unresponsive. Okay, kung immediate ba or delete. Ayan. So the answer here is apple. 5, 4, 3, 2, and 1. Okay, ito naman 5, 4, 3, 2, and 1. 83. A 7.5 magnitude earthquake hit Marikina City, resulting in a major surge of trauma patients in your public hospital. To sort your patients and resources rapidly and effectively, your ER department used the ESI triage method. 3 days after the earthquake, you received a 16-year-old patient that was rescued from the rubble of a fallen condominium. Patient does not have a lot of complaints and only wants water and food. Upon assessment, you notice that the patient only has minimal bruising and abrasions on the face, arms, legs. Patient is breathing and oriented but has the following vital signs. BP 110/70, 101 yung HR, RR is 24, O2 set is 91%. What level are you going to categorize the patient? Okay, so this is the ESI triage method. Ayan. So, does the client require or need immediate life-saving intervention? No. Okay? Yan, hindi naman siya high risk. So, dito tayo. The client may need many different resources. Okay? Dahil nga 3 days siyang trapped sa under the rubble. Okay? So, tingnan natin yung vital signs niya. Ang client ay, itong unang row ay for less than 3 months yan. Okay? Ayan. And since yung client, ilang taon na ba yung client? The client is 16 years old. So, siya ay greater than 8 years old. Ang HR niya ba ay greater than 100? Yes, it's 101. Ayan. Ang RR niya is, 24. So, it's greater than 20. So, we may consider 2. Okay? ESI level 2 siya. Ayan. 5. Wait lang. Anong ESI level 2? That is dog. Okay, 5, 4, 3, 2, and 1. Again, 5, 4, 3, 2, and 1. Situation, burns are global public health problem accounting for an estimated 180,000 deaths annually. These are preventable injuries to the skin and or tissues which are primarily caused by heat, radiation, electricity, friction, or contact with chemicals. Okay, 84, skin contamination injuries from exposure to chemicals are challenging because of the large number of possible offending agents with diverse action and metabolic effects. What is your initial action in cases of burns from caustic soda? Okay, so ano ba yung caustic soda? It is also known as sodium hydroxide or lye. Ayan. Usually used for unclogging water pipes, creating soap and paper. Ayan. So ano ba yung initial action natin dyan? Hindi natin siya fina-flush. Sinang sabi dyan? Water should not be applied to burns from lye or white phosphorus because of the potential for an explosion or for deepening of the burn. Okay, so hindi natin yan if-flush. Yan. And hindi muna tayo mag-a-apply ng Neosporin. Neosporin is an antibiotic. Okay, so hindi muna yan yung initial action natin. The best initial action is brush the soda off the skin. Tapos, kapag kita natin na wala na masyadong caustic soda, then we can flush na. Okay, 84 is cut. 5, 4, 3, 2, and 1. 85. This type of ocular burn characterized by rapid penetration of the chemical on the ocular tissues and continuous damage to the eye after the initial injury is sustained. This results in a much more severe ocular injury. Okay, kapag photochemical ocular burn, yan, it results to photochemical injury. Ano ba? So it is from ultraviolet radiation or infrared exposure. Injury from, okay. Yung thermal ocular burn naman leads to thermal injury which is caused by exposure to a hot object. Okay, kaya nga thermal from the word itself. Acid ocular burn naman, yan. Ito naman, ito yung mga type of burns na to, it generally cause less damage. Kasi, because the precipitated necrotic tissue proteins yan form a barrier to further penetration and damage. Kaya less damage siya. Kapag naman alkali ocular burn, hindi siya nag-perform ng barrier to further penetration and damage. Okay, so this is the type of chemical burn that results in the most severe injury because they penetrate the ocular tissues rapidly and continue to damage long after the initial injury is sustained. Okay, so mas severe pala ang alkali burns. Okay, ayan, more than the acid burns. Alright, so ang sagot dito ay, kasi tinatanong much more severe ocular injury, it's the alkali ocular burns. Ayan. Kasi sa mata yung type of ocular burn kasi yung hinahanap. Okay, so 85 is 5, 4, 3, 2, and 1. 86, this is type of ocular burn characterized by penetration of the chemical to the ocular tissue but cause less damage. Kapag less damage, that is acid ocular burn. Okay, 5, 4, 3, 2, and 1. 87, patient Anetra, 16, female, burn survivor. A female, 16, burn survivor. The patient's burns are due to a jealous ex-boyfriend splashing her face with muriatic acid. This resulted into the patient becoming blind and having facial full-thickness burns and neck with the partial thickness burns. After 2 months of treatment, the patient is discharged from the hospital. Which of the following is the priority nursing diagnosis for the patient? Okay? Yan, 2 months na after the treatment. Usually kasi, kapag mga kaka-burn pa lang, dun mas mataas yung risk for infection. Okay, so hindi na priority ang risk for infection na to kasi 2 months na yung nakalipas. Okay, so ICS na yan. Ito namang impaired psychological adaptation, wala namang ganyan sa NANDA, so X rin yan. Impaired physical mobility, wala namang sinabing meron siyang problema with her mobility, so X rin yan. Ang best answer dito ay disturbed body image related to disfigurement and scarring. Lalo na si pasyente, ayan, 16 years old, teenager siya, and female. Okay, so 87 is dog. 5, 4, 3, 2, and 1. Okay, compression is introduced early in the burn wound treatment. Ayan. Patient Anetra, her face and neck were covered with elastic pressure garments for 23 hours per day. Yan. After the elastic bandage wrap is removed, which of the following choices is the main reason why elastic pressure garment is used? So it is indicated na yung main reason why this is used is because it It is to control scar formation. Okay? Ay. Ayusin ko lang. Ayan. So it is for controlling scar formation. Ayan. So yun yung primary reason. Yes, it helps with promoting adequate circulation. Ayan. Hindi naman siya nakaka-avoid ng wound from getting infected. And, ayan, hindi naman primary reason ang proper wound healing as well as yung adequate circulation. Okay, ang pinaka-reason talaga ay to control scar formation and contracture. So the answer here is boy. 5, 4, 3, 2, and 1. Wait lang. Teka lang. Okay. Okay, so 88 is boy. Sorry about that. Ayan. 89. An irregularly formed scar that extends beyond the margins of the original wound. They are large, nodular, and rope-like, often causing itching and tenderness. They are more common in dark pigmented skin, uncommon in children and the elderly, and have familial tendencies. Okay, so ano ba yung striae distensae? This is also called stretch marks. So they represent lineal dermal marks. Yan. Contractures naman, it's a permanent tightening of muscles, tendons, skin, and nearby tissues that cause the joints to shorten and become very stiff. Okay, so that is contraction. Down. Ayan, yan yung contractures. Hypertrophic scar naman, this is a thick raised scar. That's an abnormal response to wound healing. Okay. So the answer here is keloid scar. Ayan. So it is an irregularly formed scar that extends beyond the margins of the original wound. So the answer here is apple. Okay, apple. Ayan. 5, 4, 3, 2, and 1. 90. Burn patients are at high risk for infection because of their large open wounds. Which of the following is the best topical antibiotic used for burns? Okay, so yung A, yung sulfamyelon, yeah, this is used alone or with other medication to help prevent and treat wound infections in patients with severe burns. Ayan. Pero ang gold standard talaga for protecting wounds from infection is the sulfadiazine. Silver sulfadiazine. Okay, this is the gold standard. Ayan. Yung gentamicin sulfate naman, this is to treat minor skin infections. Okay. Not really burns. Yung bacitracin naman, to treat minor skin injuries including cuts, scrapes, and small burns. Ayan, minor injuries lang. Ayan. So, ang answer dito ay, syempre, yung gold standard tayo, it is the best topical antibiotic. Okay, so the answer is boy. 5, 4, 3, 2, and 1. Okay. Burn patients are at high risk for infection because of their large open wounds. Which of the following is included in the early signs of sepsis? Okay, so early signs of sepsis pala. Sepsis include increased temperature. Yan, increased temperature, increased pulse rate. Increased temperature, ayan, positive. Increased pulse rate, positive. Widened pulse pressure, yan, greater than 40 mmHg, yan, positive. And flush dry skin in unburned areas. Yan, this is early signs of sepsis. Other signs are chills and shivering. Ayan. And fast breathing. Okay, takip niya. Okay? Ayan. So yung hypotension, yan, these are late signs na to. So this is negative. Positive kasi yung early eh. Late sign na yan, as well as yung difficulty, yung confusion, late sign na rin to. Difficulty of breathing, ayan, and cold clammy skin. These are late signs of sepsis. Okay, so the answer is dog. Okay, 2, 3, 4, 5, 7, and 8. 5, 4, 3, 2, and 1. 92, a patient with deep partial thickness or full thickness burns may be a candidate for skin grafting. A patient with burns on majority of their body was not approved for an autograft due to a minimal unaffected area. So the doctor decided to get a biopsy of the patient's skin in a non-burned area to create epithelial cells from it on the laboratory. What type of wound grafting is this? Kapag allograft, di ba? This is from the same species. Xenograft naman from different species. Okay? Andito na yung clue, epithelial cells. So this is cultured epithelial autograft. Okay? Ayan. So 92 is dog. 5, 4, 3, 2, and 1. Okay, so ito naman next. Various methods are used to estimate the TBSA affected by burns. A more reliable method is used to estimate the extent of burns. This is done by dividing the body into very small areas and providing an estimate of the proportion of TBSA or total body surface area accounted for by each body part. This is known as, so more reliable method. Yung rule of nines, ayan, ito yung example ng rule of nines, yung sa figure A, ito siya. Ayan, so this is the it's the common and a quick way to estimate the extent of burns in adults. Okay? Yan, so yung system na to, it divides the body into multiples of 9. So 9 yung head, yan, 18 yung anterior and posterior trunk, 9 yung arm each, and legs is 18 each. Ayan. Yan yung rule of nines. Okay? Kapag naman yung Lund-Browder diagram, this for estimating the extent of burns as well. Ito yung Lund-Browder diagram, yung pangalawa. Ayan, ito. Yan. So makikita natin mas maraming divisions and mas specific siya. Okay? Ayan. So sa upper arm, it's 2. Ayan. Makikita natin mas specific siya. So it is more reliable than the rule of nines. Yung Palmer method and rule of palm, ayan, same lang naman yan. Sinasabi lang dyan na yung size ng patient's palm ay approximately 1% TBSA. Okay, so the answer here again is boy, kasi more reliable siya. Mas maraming divisions. 5, 4, 3, 2, and 1. Yung rule of nines, ayan, kaya puro 9 siya. Yung head and neck is 9. Okay? Yung trunk is 18, diba? Divisible by 9 siya. Yung arms ay 9 each. Okay, so puro 9, 9. Kaya rule of nines siya. Okay, ayan. Okay, yun yung explanation ng rule of nines. Common yung description niya. Yan. Common and quick way. Kaya siya quick kasi hindi naman siya ganun ka-detail. Yan. As compared kung dito, di ba? Sa Lund and Browder method. Alright. Yan. 5, 4, 3, 2, and 1. Okay, so computation na tayo. Patient Isabel. 6, with second-degree burns on the face, upper ventral trunk, anterior lower half of both arms, and posterior upper half of both legs. Calculate for the total body surface area. Okay, so paano natin i-calculate yan? Yan yung face, it is face lang naman. Okay, buong head is 18. Pero yung anterior, yung face, it's 9 lang. Okay, so face is 9. And then upper ventral trunk, yan, yung ventral trunk, it is the chest. Okay, so kung upper, 18% kasi is the front and 18% is the back. Since chest to, okay, so yung upper chest daw, so hatiin mo yung 18 by 2, it's 9%. Okay, kasi upper. Yan, hatiin natin siya sa gitna. Yan, so 9 lang yung affected. 9% lang yung affected. Kasi sa lower, yung additional, or yung isang 9 pa. Okay, kasi nga 18% yung total. Alright, anterior lower half. Anterior, since sa harap, ayan, buong arm is 9%. Since anterior, so anterior is 4.5. Okay? Anterior ibig sabihin sa harap, 'di ba? Lower half naman, so kalahati pa netong anterior part. So kalahati niyan, it is 2.25. Anterior lower half yun, 225. Both arms. So times 2 mo yan, the answer is 4.5%. Okay? Kapag naman posterior upper half, ayan, posterior, isang leg is 14%. Posterior sa likod ay, hatiin mo yan, 7%. Lower half is kalahati pa neto, so magiging 3.5%. Since both legs to, times 2 mo yan, so magiging 7% siya. Add natin yan lahat, 9 plus 9, 18. 18 plus 4.5 is 22.5 plus 7 is 29.5. So the answer here is dog. Okay? 5, 4, 3, 2, and 1. 95. Patient Isabel, 6, 50 pounds with second-degree burns on the face, upper ventral trunk, anterior lower half of both arms, and posterior upper half of both legs. Calculate for the needed fluid that the patient will receive in the second 8 hour. Okay, so sa 24 hours, di ba, we have 3 8 hours. So yung first 8 hour, yan, ibigay natin yung first half ng solution na na-compute natin dito. Okay? And then, the rest of the hours for the day, and yung second half naman ng solution. Okay? So, nandito yung second 8 hour and yung third 8 hour sa other half of the solution. Okay? So, tingnan natin, compute natin yan. So, una muna natin gagawin. Ito pala yung Parkland formula. So, 4 ml times yung kinompute nating BSA dito, which is 29.5, times yung weight niya in kilogram. Since given ang pounds, so we have to convert this first to kilograms. So to do that, yan, multiply mo lang yung pounds by 1 kilo over 2.2. Or divide mo lang yung pounds by 2.2. And so makukuha mong answer dyan is 22.73. Okay, kilo. Ayan. So ngayon, since meron na tayong kilogram in weight, weight in kilogram, so multiply na natin yung or gamitin na natin yung Parkland formula. So, 4 ml times 29.5, which is yung kinompute natin for the last number, times 22.73 kilo. Ang makukuha natin dyan ay 2,682.14 ml. Okay, ito yung total ng gagamitin for the first 24 hours. Okay? So, first 8 hours, ayan, para makuha natin yan, we just have to divide this by 2. So, dito yung first 8 hours. First 8 hours. Okay? Yan yung volume ng solution na ibibigay natin for the first 8 hours. And then sa second and third 8 hour, ayan, second and third 8 hour, 8 hours. Hatiin ulit natin tong solution na to, okay, or volume. Ang magiging sagot ay 670.535. Bakit? Bakit natin siya dinivide ulit by 2? Kasi, di ba, ang sagot nga dito ay 2,682.14. Hatiin natin siya sa dalawa. Yung first 8 hours is 1341.07. Ito rin, 1341.07 din siya. And nandito nga yung second and third hour. So, hahatiin natin ulit siya sa dalawa. Okay? Kaya ang magiging sagot ay 670.535. Round up, that is 671. Apple. Okay? 5, 4, 3, 2, and 1. Gets ba yun, guys? Okay naman ba? If ever may questions kayo, ha? Okay. Wala namang questions. Ayan, sige. 5, 4, 3, 2, and 1. Next. Sa adults naman tayo. Okay, 96. Patient RuPaul 62 with first to second degree burns on the head. Ayan, on the head. Ayan, 9% is the head. Okay, so 9%. Ayan. Tama. So posterior trunk naman. posterior, and ibig sabihin sa likod. So 18% is the back, so 18%. Brachium naman, brachium is the upper arm. Okay, so upper arm is and upper arm is 4.5. Pero wala naman siyang nakaspecify kasi na isang arm lang to. So we're assuming na both arms siya. So times 2 ulit. Okay, magiging 9%. Okay, brachium is the upper arm. Okay, ayan. And then anterior lower half of the right leg. So right leg niya nandito. Ito yung right leg niya, diba? And anterior is 9%. Lower half, divide mo ba yun by 2 is 4.5%. So kapag i-add mo to, 9 plus 18 plus 9, 36 plus 4.5 is 40.5. So the answer is boy. Okay. 5, 4, 3, 2, and 1. Tandaan natin 40.5. Ayan. Computation ulit tayo ng Parkland formula. Okay. So dito ang hinahanap niya naman ay last 8 hours. So yung third 8 hour. Okay. So ganun ulit yung computation. Convert mo ulit yung pounds to kilo. Okay, so 165.35 divided by 2.2 is 75.16. Okay, and then compute na natin yung Parkland formula. 4 ml times 40.5% times 75.16. That is 12,175.92. Okay, now divide na natin to by 2. Okay, ang bibigyan natin for the first 8 hours is 6,087.96 ml. And yung isa naman, 6,000 din. Same lang sila. Ngayon, para makuha yung third 8R, ayan, divide natin to ulit by 2. So the answer is 3,043.98. Round up is 3,044. The answer is cat. Okay, 5, 4, 3, 2, and 1. Situation. A disaster response strategy cannot succeed without appropriate physical assets and a staff trained and prepared to carry out the plan. This provides information to employees and healthcare providers regarding specific chemical agents, includes chemical name, physical data, chemical ingredients, fire and explosive hazard data, health and reactive data, spill or leak procedures, special protection information, and special precautions. This is none other than yung tinatawag na Material Safety Data Sheet or MSDS. Okay, so the answer here is apple. Okay, 5, 4, 3, 2, and 1. 99. Which of the following choices best defines mass casualty incidents or MCIs? So, yung MCI, it is defined as any incident that results in more patients than daily resources can handle. So that is MCI. So saan yun dito? This is boy. This is boy. Okay, yan. 5, 4, 3, 2, and 1. An act requiring basic education to students to undergo age-appropriate basic life support training. Okay, so yung DOG, RA 9173, alam natin yan. This is the Philippine Nursing Act of 2002. Walang BNC. Okay, gawa-gawa lang yan. The answer here is RA 10871. It is the basic life support for basic education students. Okay, ayan. Okay, and 5, 4, 3, 2, and 1. Okay. Ayan. So, kamusta naman ang NP4? 99 is boy. Uy, ba't wala na nagsasalita? Okay pa ba kayo? Mahirap. Mahirap po, ma'am. Nag-50 na, ma'am, pero bagsak pa rin yun. At least, di pa may natutunan bago. Mahirap talaga siya. Just the word exam. Ay naka, guys. Mas okay po si NP4 kumpara sa iba. Nagsusulat, ma'am. Kapagod, opo, 50 plus. Yes, ma'am. Sana all 50. Dami po learning, lalo na po yung sa burns. Pero nakakahibang pa rin po. Ma'am, 30 lang, 33. Yung iba. Ayan. So, as I said, focus tayo sa new learnings, okay? Pwede pa rin malungkot, pero don't dwell. Normal lang bang nasusuka habang nagbabasa? Ay naku, kapag ganyan, anong level of anxiety na yan? Hindi na yan mild anxiety. Uy, galing humula. Nako, ano yan? Skill yan. Pero wag laging manghula sa board exam, ha? Diyos ko po. Huwag kang manghula. Ano, educated guess dapat. Mas maganda kung ma-master yung sa Burns, okay? And kabisuduhin niyo yung Parkland formula. Pwede daw ba mag-CR? Sure, sige. May time pa naman. 5 minutes, sige, 5 minutes. Yung mga gusto mag-CR. Ano daw? Yung sa number 97. Sige, tingnan natin. Ma'am, question lang po. Hindi po ba i-divide po ba pa po by 2 yung 3,000 since it's intended for the 16 hours? Ang intended for the 16 hours ay itong 6,000. Okay, kasi ang total ay, ang nakuha natin for the Parkland is 12,000. So kapag dinivide mo yan by 2, tig 6,000 tong sila. And then divide mo ulit 2 by 2, yung second and third 8 hour to, yung 3,000. Okay? Ayan. Sana all magaling manghula, no? Sure lang, sureness. Ayun. CR break 5 minutes. Ang natatandaan ko sa board exam, situational siya. Hula lang ako na tama pa, tapos yung iba hula tamang kutob ng puso, kaso mali pala yung kutob. Ayun lang. Anong may pa-countdown? Oy, sorry naman. Kailangan natin mag-manage ng time. Countdown ba yung 5, 4, 3, 2, 1? Sorry naman. Labar. Sureness, Vanessa. Ano daw ang medication pampawala ng anxiety and pressure? Yung iba, di ba, parang bumibili sila ng mga pampa-enhance ng memory, ganyan, mga memory plus ba yun, mga ganun. Hindi kasi pwedeng, ewan ko, anxiolytic, di ba, parang hindi naman appropriate kasi mag-board exam. Baka naman maging drowsy. Ang haba ng scenario at options tapos kulang sa oras. O, kailangan talaga mag-adjust. Ayan. Kaya mabilis ako mag-lecture eh. Charot lang. And kapag ganun, time management talaga. Dapat may orasan kayo sa board exam. Okay? Ako talaga, mabilis ako magbasa ng board exam kasi takot rin akong maubusan ng time. Kaya kapag may time pa, ayan, doon ko babalikan. Kunyari, may hindi ako sure na na sagot. Hindi ko muna yun ilalagay. Hindi ko ba nilagay? Actually, nilagay ko na ba? Parang diretso na. Pero, hindi ako, yun nga, kapag hindi sure, hindi ko ilalagay kasi nga bawal ng burahin. Kapag binura mo, talagang mamarka siya. Okay? Kaya, wag magbubura. Tapos, kapag hindi ko sure, minamarkahan ko siya, nilalagay ko siya ng asterisk. Tapos, doon ko babalikan. Okay? Ano lang, careful kayo kahit na parang, ayoko naman sabihin madalian, 'di ba? Hindi naman paunahan 'to. Pero mag-ingat din kayo, guys. Ayan. And be conscious of the time din. Anong timer? mas nare-realize ko po yung mga mali ko, parang kakayanan naman po sa test-taking techniques. Ayan. So kapag hindi alam, kumapit sa test-taking techniques. Yung sa akin, November 2021 board exam, wala masyado sa batas kasi nagkabisado ako eh. Sa gamot, parang oo, pero hindi ko na rin matandaan, sa totoo lang. Pero walang masyadong batas. Timer sa test. Oy, oo, sanayan yung sarili nyo na naka-timer. Ako nga, bumili pa ako ng Dretec timer. Just to time myself lagi kapag may pa-exam. Kaya naman yan sa board exam. Okay. So may count ng timer kayo. Okay, gets. Oo. Sanayin nyo na rin yung sarili nyo. Every exam you take, dapat may countdown timer talaga. Okay? Kapag di talaga mag-gets yung isang question, skip muna, asterisk. Ganun yung ginagawa ko. Kasi wala eh, sayang yung oras eh, paulit-ulit. Na nakakainis din. Ay, 201 na! Ayan, 201 na. Ang daldal. Okay. Oo, yung sa pre-boards, may mga line of... Yung pre-boards one, mababa rin yung score ka. Kaya, don't worry. Bawi sa next pre-boards. Ayun lang. Wait lang ha. Ano pong magandang breakfast, ma'am, the day of the board exam? Ako kung ano lang yung available. Kasi usually, sobrang aga, wala pang open. McDo pa lang yung nakita kong open. Pero wag mo mag-iitlog ha. Wag mag-iitlog. Diyos ko po. Ang sakit ng tiyan ko noon. Pigil na pigil ako noon sa alam niyo na. Alam ko 2 hours. 2 hours per NP. Ay, hindi ko na maalala yung high score namin. Ma'am, kapag naka-shade ka na, then mali pala na answer mo, anong tips mo para dyan? Huwag na burahin. Legit, huwag na burahin. Kasi baka hindi pa mabasa yung ibang kalapit na na items. Para safe, magdala kayo ng sarili niyong orasan ha, yung analog lang. Totoo po ba sa exam strategies, malaki chance po ng all of the above? Teka lang, tuo na, pero teka lang. Oo. Pero isipin niyo pa rin ha. Alam ko 2 hours per NP. Pero paki-confirm din. Hindi ko na maalala yung lowest at highest nun eh. Saan link pa po kayo nagtitake ng sample questions? Alam niyo, sa sobrang daming pa-exam ng top rank, parang wala ka ng time na magsagot ng ibang exam. Konti lang SATA or minsan wala pa sa board exam. Nilalabanan ng antok, wag labanan ng antok. Sayang oras. Wala ka pang ma-absorb. So tulog na lang. Ganun yung ginagawa ko. Kapag di na talaga kaya tulog, kahit mga 10 minutes lang. Okay na tayo. NP5 na. During the board exam, minsan talaga napapapikit ako nun. Yung board exam. Pero syempre, nakasalalay ang, di ba, one take lang dapat. So, ayos-ayos during the board exam. Mindset. Bawal makatulog. Ayan. Pero napapapikit na ako nun, to be honest. Okay. Kasi sa sobrang pagod, lalo na yung day 1, NPE 1 to 3, sobrang dami. Light lang nung NP 4 to 5, yung second day. Anyway, ayun na. Sige na, go na tayo. Okay, situation Nurse Bello is working in Ward 7, the psych ward of Hospital de Magiba. She is in charge of preparing the med for all their clients in the morning shift. To do her task well, she is equipped with the correct knowledge of the principles of pharmacologic treatment of psych disorders. Okay, one Christina 28 and Agatha 65 are currently admitted to the ward. Both are being treated for their depression. Which among the options would indicate that Nurse Bello needs to further review her notes on the guiding principles of pharmacologic treatment. Okay, so kung paano ko magbasa, ayan, super bilis, di ba? Kasi sobrang hahaba ng mga tanong. Ayan, so further review daw. So something negative ang hahanapin natin dito. It takes longer to fully achieve the therapeutic effect of drugs in older adults. Ayan, this is actually true according to Wiedebeck. Okay? Ayan, mas matagal ang ma-achieve ang therapeutic effect sa older adults. Alright? Older clients need to take lower dosages of psychiatric medications than younger clients who experience the therapeutic effects. This is also positive according to Wiedebeck. Chronic disease is the most powerful predictor of depressive symptoms among senior citizens. Ito naman, this is negative kasi most powerful predictor ay loneliness. Okay, according to a study. A higher level of subjective psychological well-being is a primary protective factor against depression in the elderly. This is positive according to the same study. Okay, so ang sagot ay cat. Okay, further review. All right, 5, 4, 3, 2, and 1. Almost the same age as Agatha, Bridget is also being treated for depression while diagnosed with Alzheimer's disease. What medication are you most likely going to prepare for her during your shift? Okay, so may depression. So most probably anti-depressant ang ibibigay natin dito. Yung Pamelor, nortriptyline, this is an anxiolytic. Okay, so it is for anxieties. Yan. Chlordiazepam Librium naman. Ay, wait lang, mali. TCA pala to, Pamelor, TCA, tricyclic antidepressant. Itong chlordiazepoxide Librium, this is an anxiolytic for anxieties. Ayan. Duloxetine Cymbalta naman, this is an SNRI. Okay. Ayan. Also an antidepressant. And then Paxil naman, it is an SSRI. Okay. Ayan. So, X na tong anxiolytic kasi hindi naman siya for depression. Itong TCA, SNRI, SSRI, they are antidepressants. Pero anong bibigay natin dito? Diagnosed with Alzheimer's disease. Ayan, and the elderly. Okay, so ito, syempre ang bibigay natin yung safest na antidepressant. It is the SSRI. Okay? So, SSRIs are often used for people with Alzheimer's and depression because they have a lower risk than some other depressants of causing interactions with other medication. Okay, so 2 is dog. 5, 4, 3, 2, and 1. Ma'am, nagbasa pa kayo ng Cosgear and Piliteri. To be honest, hindi na ako nakabasa. Okay, sobrang kulang na sa time. And feeling ko ang dami ko pang hindi naaaral na tinuro ng top rank. Doon ako mas nag-focus sa mga notes ko. Okay, ayan. 3, Agatha just came back to her bed after a checkup with an eye specialist and appears to be concerned. Weeks leading to her checkup, she shared that she is experiencing tunnel vision and seeing rainbows around lights. Okay, what medication are you most likely going to prepare for her during your shift? So si Agatha, di ba may depression siya? Tapos, ano minamanifest dito? Tunnel vision and seeing rainbows. The client is manifesting symptoms of glaucoma. Ayan, glaucoma. Ay, pasensya na sa sulat. Ayan. Okay, glaucoma. So, nang ibigay natin? Walang. So, itong Elavil, tsaka Tofranil, these are tricyclic antidepressants, TCAs, which are known to increase intraocular pressure. Okay? So this increases intraocular pressure. Ayan. Di ba kapag sa glaucoma, it is characterized by increased intraocular pressure because of the decreased aqueous outflow. So, hindi na tayo magbibigay ng TCA. So, X na yang apple and cat. Okay. Yung Benadryl naman, diphenhydramine, ayan, this is a midriatic. Okay, hindi tayo nagbibigay ng mydriatic sa glaucoma kasi this further blocks the outflow of the aqueous humor. Okay, so again, this is a mydriatic. Mydriatic. Okay, so the answer here is, boy, bupropion, Wellbutrin. Ayan, because this reduces risk for glaucoma. Ayan. So, ito yung best answer po eh. Okay. 5, 4, 3, 2, and 1. Yes. And very good. 4. Hazel, diagnosed with bipolar, is about to receive her medication that morning when she experienced nausea and vomiting and diarrhea. What is the priority action of Nurse Bello? Okay, so ito, ayan, ano ba yung usual na binibigay? Medication for bipolar and mania. It is lithium. Okay? And yung nausea, vomiting, and diarrhea, these are symptoms of lithium toxicity. Okay? So, anong priority action ni Nurse Bello doon? Bibigay niya pa ba yung medication or hindi? Pwede sana yung reassess, pero kasi hintay mo pa ba yung physician, syempre tatawagin mo na. Okay? Huwag mo bibigay yung medication kasi baka lalong mas lumala yung symptoms niya ng lithium toxicity. Hindi ka mag-a-ask ng advice sa mga seniors. Okay? So, ang answer dito ay A, withhold, and call the physician. Alright? 5, 4, 3, 2, and 1. Student X, preparing for the NLE, regularly takes multiple unprescribed stimulants to enhance focus while reviewing. He was admitted to Ward 7 for addiction. What medication are you most likely going to prepare for him during your shift? Ayan, may mga ganyang nagre-review ha. Nagtitake ng mga stimulants like Adderall and Ritalin. Ayan, so since nagtitake na nga siya ng stimulants, di mo na siya bibigyan pa ng more stimulants. Okay, so X tong Adderall and Ritalin because there are known stimulants. Ayan. Yung chlorpromazine naman, okay, this is actually the answer because this is known to relieve symptoms of stimulants or symptoms of intoxication of stimulants. Yan. Yung methadone naman, this is a downer, okay? Not a stimulant. Not a stimulant, pero hindi mo pa rin yan ibibigay kasi hindi naman yan nagre-relieve ng symptoms. Okay, so 5 is boy. 5, 4, 3, 2, and 1. Methadone pala is an opioid, and opioid is a known downer. Okay, 5, 4, 3, 2, and 1. Yan. Situation somatic symptom disorders were historically known as hysterical neurosis. It is thought to happen as a result of repressed, severe anxiety. It is more common in women than men and in rural areas. Okay, so somatic symptom disorders. In a client diagnosed with somatic symptom disorder, which of the following profiles would you expect to assess from her? Okay, so ano ba yung symptoms dito ng somatic symptom disorder? A serious fear of having serious illness. This is found in illness anxiety disorder. Loss of or alteration in body functioning. Ito naman, this is in conversion disorder. Na usually walang medical or pathophysiological explanation, yung alteration in bodily functioning. Vague, dramatized, and exaggerated symptoms, and ito na yung somatic symptom disorder. And feeling of detachment from the environment, this is the derealization. Okay. Ayan. So, ang sagot again is cat. Ayan. 5, 4, 3, 2, and 1. The client is experiencing pain and persistent itchiness on her side and says this is her first time feeling this way. What is the most appropriate statement of the nurse? Please don't say another physical complaint. Yan, dyan pa lang, di ba? Non-therapeutic na, so X na yan. Okay. Let's first sit down together and you can tell me about this new pain and itchiness you are experiencing. Okay, tapos you will just have to miss your group therapy today. So, hindi okay na makamiss ng group therapy, okay? Kasi indicated nga to sa pasyente. So, X din to kasi makakamiss siya ng group therapy. Pero okay naman tong pag-uusapan nila. Yun nga lang makakamiss siya. I will have to call your doctor and recommend he orders another medication for your pain and itchiness now. The one you currently have seems to have no effect yan on you. You may rest and skip the group therapy for now. So, ito mag-skip na siya. Sinasabi pang may current. First time nga lang niya na-feel yun. So, bakit? May another medication. So, X din to. The best answer is dog. I will report your pain and itchiness to your doctor. For now, group therapy begins in about 3 minutes. Leave now so you won't miss anything. Okay, so, hindi naman life-threatening tong pain and persistent itchiness niya. Okay, so, the client may still go to the group therapy. Okay, so 7 is dog. 5, 4, 3, 2, and 1. Yung akitisya is hindi lang mapakali, okay, but not necessarily ito. 8, the client with multiple unrelated physical symptoms seeks consultation from a doctor to be diagnosed. She already feels in distress as she had about 3 clinic visits already, but they cannot exactly pinpoint what her problem is. What do you think is the next best step for them as her nurse? So usually sa mga clients na may somatic symptom disorder, nagmamanifest nun, hindi talaga nila makita or ma-diagnose ng maayos kasi meron siyang iba-ibang simptomas na unrelated. Okay? Kaya usually maraming diagnostic test yan na parang nasasayang lang kasi nga hindi naman ma-pinpoint kung anong sakit niya. Okay? Kasi nga iba-iba yung simptomas na unrelated. Okay? So hindi mo na siya papabalikin ulit. Kasi naka 3 clinic visits na. Imagine mo, frustrated na yung client mo na to kasi wala kang ma-diagnose. Okay? So X tong apple. Hindi ka rin magko-continue with the plan further lab and diagnostic test. Okay? Kasi nga, hindi mo rin makukuha yan. Iba-iba yung symptoms niya. So, X rin to. Now, between B and C, ano yung best answer? S8, ayan. Ito naman, this is the somatic symptom scale. And it is indicated, ayan. May 8-item questionnaire siya. It is a somatic symptom scale. Indicated to measure somatic symptom burden. Okay? Sa burden siya, not really about yung risk. Okay? Yung PHQ-15, WI-7, and SABE, ayan. Ano bang ibig sabihin yan? So, 15-item patient health questionnaire, 7-item Whitley index and scale for assessing illness behavior are useful screening to detect persons at risk for somatic symptom disorder. Siya. Dito ko na lang ilagay. Ayan. And a combination of these 3 instruments slightly improves diagnostic accuracy. Okay, so the best answer here is boy. Yeah. Pang screening siya. 5, 4, 3, 2, and 1. 9. The nurse hears the mother of Patricia diagnosed with somatic symptom disorder. Tell a friend, the doctor told me that there's really nothing wrong. There's nothing really physically wrong with Patricia. She's been lying to me about being sick all along. I can't believe she would go to this extent just so she could relieve herself from her duties. How would the nurse approach Patricia's mother? So, wag mo lang hahayaan. Okay? Di ba as nurses dapat may gawin tayo? Plan a parent-child meeting conference. Hindi naman kailangan ng child meeting conference. Okay? So, we can just inform the mother through a health teaching. Okay? Hindi na kailangan ng doctor na mag-explain pa nun. So, the answer is cat. Yan. Usually, yung doctor explanation, di ba, usually for procedures, ganyan na, sila yung gagawa. Ito naman, nature and management, ayan, pwede namang i-include na yan sa health teaching. And 5, 4, 3, 2, and 1. So the mother can be fully informed. A client with somatic symptom disorder has been scheduled for a series of group therapy sessions. Ayan. Which statement from the client shows that the therapy is having a positive outcome for her. So makikita mo, ayan, yung goal ng group therapy ay i-decrease or mawala yung physical symptom. Ayan, yun yung ideal outcome ng somatic symptom disorder. Okay, ayan. Regarding the physical symptoms, so saan yun dito? The other people in the group have more emotional problems than physical problems. So ito ang focus niya yung ibang tao. So hindi ito yung sagot. I don't want to complain too much as my problems aren't as bad as others. Ito naman invalidate yung sarili niyang feelings. Yan, so X din to. It's nice to be able to listen to others and get a lot just from listening to them. Ito naman, focus din ay yung others. So ang answer dito ay apple kasi this is pain is a physical symptom. Okay, I just feel a little bit of pain now. So 10 is apple. 5, 4, 3, 2, and 1. Situation. Sexual problems are highly prevalent among patients with psychiatric disorders. The following questions apply. Trina, age 23, married Iko, age 33, 2.5 weeks ago, and had never had sex together. They consulted with the sex therapy clinic concerning vaginal pain and tightness preventing penile entry. Okay, a sexual history was conducted and Trina revealed she was raped at 12 years old. What is the most appropriate nursing diagnosis for Trina? Okay, so ito, ayan, yung pain niya is actually related, not related with the vaginal tightness, but is most likely precipitated by the trauma response. Okay, so X to. Complicated breathing related to loss of arousal due to rape. Wala naman siyang loss of arousal. Okay, wala naman sinabing loss of arousal. Okay, so X din yan. Ineffective sexual pattern related to the inability to have intercourse or sexual dysfunction related to sexual trauma history. Okay, so mas appropriate dito yung, syempre may kinalaman sa sinasabing sexual history niya. Okay? Yeah, so the answer here is don't. Okay, yung inability to have intercourse, nanggagaling rin naman siya sa, it may probably stem from the sexual trauma history then. So, 11 is dog. 5, 4, 3, 2, and 1. Sildenafil, Viagra, is often prescribed to men for the treatment of erectile disorder. Which of the medications below can be ordered by the doctor for premature ejaculation? So premature ejaculation meaning this is early ejaculation. Okay? So usually, ayan, hindi alam talaga yung exact cause ng premature ejaculation. Pero it is known that serotonin may play a role. Ayan, so sinasabi na kapag may high amounts of serotonin, and high amounts of serotonin increases the time for ejaculation. So may late ejaculation. Kapag naman low amounts of serotonin, ayan, it can shorten the time for ejaculation, leading to premature ejaculation. Alright, so saan dito ang nakaka-cause ng mataas na serotonin? Okay? So yung diazepam, this is just for seizures, not really about for premature ejaculation. Seizures, ayan. Yung cabergoline naman, this causes early ejaculation or premature ejaculation, causes premature ejaculation. Tramadol and paroxetine, ayan, they're known to increase serotonin. Okay, so the answer here is 1 and 3, boy. Okay, ayan. 5, 4, 3, 2, and 1. Selective serotonin reuptake inhibitors or SSRIs are known to affect the normal sexual functioning of clients with depression. Which of the following statements indicates an understanding of SSRI and their effects on the client? So, indicates understanding, we're looking for positives. Okay, so this type of medicine can cause decreased sexual desire. So, is this positive or negative? This is functioning kasi they can cause decreased libido. Okay, positive yan. Prozac, which is an SSRI, will probably cause weight gain. This is negative kasi they can cause weight loss. Okay? Phenylcypromine can cause an increased ability to achieve orgasm in women. So ito naman, this is negative. Okay? Kasi sinasabi na yung Parnate or phenylcypromine, they reduce sexual desire or difficulty reaching orgasm. So this is negative. Dry mouth is a temporary side effect of Prozac. This is True. Okay, so this is positive. They have an increased risk for dry mouths. Okay, so ang answer dito ay 1 and 4. Talk. 5, 4, 3, 2, and 1. 14. A client with mania is being euphoric and flirtatious at the same time. She suddenly attempts to be sexual inappropriate to other clients by discussing with them a plan to have a sexual exploit. What should the next best action of her nurse be? Tell the patient that the others may not want to talk about this with her and invite her to a game of table tennis with other patients. So possibly, diba, pwede to. Kasi, yan, i-inform lang naman natin na her behavior is unacceptable. Pero, ito, tinutulungan din natin siya dito sa statement na to. Kasi, by bringing her to a game, ayan, this will help her regain self-control. Okay? Continue walking down. So, parang in-ignore mo lang to. Ask the client to talk with her in private later. So, mamaya pa to. Mas maganda kung ngayon na. Instruct the client to go back to her room as she made others uncomfortable now. Ito, nakakababa to ng self-esteem. Okay? Kasi parang pinagalitan mo lang, go back to your room. Diba? Parang bata. 14 is apple. 5, 4, 3, 2, and 1. Best pa rin yung answer ng apple kahit na may game. Okay? Ayan. Kasi, mas nade-direct yung energy niya doon. Ayun. Okay, 5, 4, 3, 2, and 1. 15. A client who was recently admitted to the ward was diagnosed with transvestic disorder. The mother of the client is asking for more information about this disorder. Which statement by the nurse correctly identifies transvestic disorder? Itong A, usually accompanied by masturbation, sexual excitement while observing an unsuspecting woman. This is, wait lang. Teka lang. Uy. Wait lang ah. Ayan. So the answer here is, ano answer here? Hindi. Ito ay tinatawag na voyeurism. Kasi unsuspecting. Observing an unsuspecting person, voyeurism. Ayan. Sexual arousal derived from actual touching of the opposite gender, not from the coercive or erosive nature of the act. Ito naman is frotteuristic disorder. Okay, frotteuristic. Okay. A woman keeps a collection of men's clothing and becomes sexually aroused by dressing up. Ito na yung transvestic. Okay, this is transvestic. And so na-arouse sila kapag nag-dress up sila as an opposite sex. Okay? Sexual humiliation from the act of being humiliated by the opposite gender. Ito naman is masochism. Okay, so ang answer dito ay cat. Okay, 5, 4, 3, 2, and 1. Situation, prioritization and delegation are important nursing concepts to be mastered in psych and mental health nursing. The following situations apply. The Philippine National Police brings a woman possibly with mental health disorder to the Emergency Services Department in determining hospitalization versus discharge back into the community. Which consideration is given highest priority? So, syempre, priority ang safety. Usually, ina-admit involuntarily kapag the client is a danger to herself and other people. Ayan. So, saan dito yung may risk for safety? The answer here is potential for grazing. Grazing is, ayan, injury where the skin is scraped. Okay, so 16 is boy. 5, 4, 3, 2, and 1. A patient witnessed a violent attack on her infant. She reported a loss of vision during the assessment, which among the nursing actions would most likely help her. Assure the client that her inability to see temporary is to see is temporary and will be resolved in due time. Ito, reassuring to. Hindi mo naman kasi sure kung temporary ba talaga yan eh. Diba? So, X to. Gently explain that she is really able to see and she should just try a little harder. Ayan. For her eyes to finally work. Ayan. So, ito naman, non-therapeutic to kasi, malay mo ba kung the patient is trying hard already, diba? So, X yan. Link emotional trauma to blindness and encourage verbalization. Ito, at this time kasi, ayan, during assessment pa lang kasi to. So, nasa unang part pa lang ng nursing process. Kaya medyo premature pa lang kung ililink mo yung emotional trauma to the blindness. Okay? So, ang best answer dito is conduct health teaching to increase coping with blindness. Para, ayan, para habang hinihintay yung diagnosis ng doktor, makaka-cope na yung pasyente with the blindness. Okay, so 17 is dog. 5, 4, 3, 2, and 1. 18. Panic disorder is diagnosed in patient experiencing difficulty in managing her anxiety. The nurse is greatly concerned for, syempre, yung may risk for safety. A risk for injury. Ayan, risk for injury, saan dito? Yan yung pounding fist and pacing back and forth. Kasi this indicates na the client may be physically aggressive already. Okay? Ayan. So, 18 is apple. 5, 4, 3, 2, and 1. A patient with a history of major depression and suicidal intentions is being interviewed by the nurse. Which statement from the patient causes the most concern? So, ito yung most concern. I've had a depression ever since I started to become an adult. This just indicates that the client has chronic depression. Okay. Ayan. My wife has cancer now and she needs me. Ayan. And then, I'm honestly afraid to do the act. These are protective factors against suicide. Okay, so pinaprotect nito, yan, kasi may kailangan siya ng asawa niya. So most probably hindi niya gagawin yung suicide. Tapos ito, takot siya gawin yun. So hindi niya gagawin yung suicide. These are protective factors. Okay, so hindi yan yung most concern. My grandfather and father both died of suicide. So dito naman sa dog, the patient may think, ayan. The patient may think na nasolusyonan ng grandfather and father niya yung problema nila by doing suicide. Kaya mas may chance na gawin niya yun kasi may family member niya na gumawa na nun. Okay? So parang environmental effect siya. Ito naman, sinabi niya lang na may chronic depression siya. So most concern dito is dog. Okay? Ayan. Kasi most likely the client will do suicide or ayan. So do suicide. And have a successful suicide because of a very strong familial history. Okay, so 19 is dog. 5, 4, 3, 2, and 1. Ayan. Thinking na normal lang mag-suicide, pwede. A patient with type 1 DM tried to commit suicide by crashing her car and sustain injuries. A blood glucose level of 700, ay mataas na, is assessed, but client strongly refuses insulin. However, she indicates the need for pain medication. What is the best action of the nurse? So ganito, pwede niya, gusto niya lang daw ng pain meds, pero ayaw niya ng insulin. So possible na baka nakalimutan ni client, di ba, na kailangan niya ng insulin kasi sobrang taas na ng blood glucose level niya. Okay, baka nakalimutan niya na kung bakit niya kailangan ng insulin. Okay? So notify the charge nurse and make preparations to transfer to the intensive care. So is this the best action na gagawin natin? Mag-notify. Siyempre dapat may kinalaman sa pasyente. Okay, explain the importance of insulin for blood sugar control. Pwede kasi nga baka nakalimutan niya. And call the healthcare provider just in case na i-refuse niya pa rin kahit na in-explain mo na. Okay? Explain that you will only give the pain medication only if she agrees to accept the insulin. Ito na therapeutic to. Parang kinu-coerce mo siya. Give the pain medication and document the refusal of the insulin. Wala kang ginawa sa insulin niya. Dinocument mo lang. Okay? Remember, sobrang taas na neto and it may be life-threatening for the patient. Okay? And possible na sinasadya yun ng pasyente. Okay? Kasi alam niya nga na life-threatening na. Okay? Eh gusto niya nga mag-commit ng suicide. Okay? So, ang answer dito ay 5, 4, 3, 2, and 1. Situation nurses must have basic knowledge of human personality development to understand maladaptive behavioral responses commonly seen in psych clients. Michelle, diagnosed with mental health disorder, had just been hospitalized for suicide. Based on the Maller's theory, Michelle did not receive her refueling of emotions, which is required and critical during the rapprochement phase of development. What are the consequences of this deficiency? Okay, so yung refueling of emotions, this is usually by the mother. Okay, it gives a sense of the child develops a sense of security and in the knowledge that he or she is loved and will not be abandoned. Okay? Yan yung mangyayari kapag may refueling of emotions. They will not be abandoned. Okay, so walang anxiety. Pero since nagkaroon ng deficiency, so they will have an internalized anger kasi nga iniwan sila and anxiety from desertion. Okay, so 21 is apple. Wala namang kinalaban yan sa delayed gratification and feeling guilty or trusting others. Okay, so answer is apple. 5, 4, 3, 2, and 1. Next, Chit is in the psych unit where a group of clients is watching TV. He enters the day room, picks up the remote, and changes the channel, saying, "What a stupid program. I want to watch something else." According to Sullivan's interpersonal theory, what stage of development is John fixed in? Okay, so ito, hindi siya makahintay. Diba? Kasi nga gusto niya manood ng ibang channel. So this is applicable to delayed gratification. Okay, so hindi na develop yon. Fixed siya sa childhood stage. Okay, so the answer is boy. And delayed, wait lang. Ayan. Ay, ano ba yan? So meron siya lang, hindi niya na-learn yung delay in personal gratification. Okay, 5, 4, 3, 2, and 1. 23. Sam suffers from antisocial personality disorder. I'm not crazy. I'm just a goofball. I believe in taking care of myself. Who cares what others think? Do it if it feels wonderful. Which of the following is the best? Which of the following best defines Adam's psychoanalytical structure? So, we have id, ego, and superego. Ang id, ayan, this refers to the principle of if it feels good, do it. So, sa client na to, ayan, wala silang pakialam. Diba? Who cares what others think? Strong ang id niya. Okay, strong ang id niya. Ayan, so X na tong apple and cat. Weak ba or punitive yung ego? Ay, yung superego. Superego naman, ayan, so this is based on morality and society's values. This is not based on morality or society values. So, weak ang superego niya. Weak din ang ego niya, ayan, kasi irrational siya. Okay, so the answer is boy. Okay, 5, 4, 3, 2, and 1. 24. Camille, who is diagnosed with antisocial personality disorder, feels no remorse for infringing on the rights of others. She does whatever she wants without regard for the repercussions. Which of Peplau's developmental stages would you put Camille? Okay, so since wala siyang pakialam sa ibang tao, okay, yan. So wala siyang gratification. Okay, so the answer here is yung wala siyang pakialam kasi, learning the satisfaction of pleasing others, yung the stage of learning to delay satisfaction. Okay, so the answer here is learning to postpone gratification. Okay, or learning to delay satisfaction. Ayan, 24 dog. 5, 4, 3, 2, and 1. 25. Corona, who you just admitted to the psych unit, has been diagnosed with major depression by her psychiatrist. Some changes in your behavior will be required. I'm concerned about what happens to you. Tell me if you need anything. Which of Peplau's nursing roles are you fulfilling in this case? So kapag sinabing resource person, ayan, you provide specific needed information that may help the client understand his or her problem. Okay, yan yung resource person. Counselor naman, yan. This one listens as the client reviews feelings. Okay, yun yung counselor. So nakikinig lang sa feelings ng client. Surrogate naman, ayan, one who serves as a substitute figure for another. As a surrogate, the nurse helps the patient clarify the domains of dependence, interdependence, and dependence, and act as an advocate of the client. Yan yung surrogate. Ito na lang. So, yung technical expert naman and understands various professional devices and possesses the skills necessary to perform interventions. Okay, that is technical expert. Okay, so anong nire-refer dito sa question na to? This refers to hindi naman siya nakikinig sa feelings ng client. Ayan. Yung needs, yung gusto niyang malaman. So this is in the clarifying the domains of dependence, interdependence, and independence of the client. So this is surrogate. Okay, 5, 4, 3, 2, and 1. Situation. Complex situations frequently arise in care for individuals with mental illness, and nurses are held to the highest level of legal and ethical accountability in their professional practice. Nurse rarely decides to go against the family's wishes and informs the client about his terminal condition, since she would prefer it if she were the client. Which of the following ethical theories is taken into account in this situation? Kapag Christian ethics, ayan, this is, and all decisions about right or wrong should be centered on the love for God and on treating others with the same respect and dignity with which we would expect to be treated. Okay? So dito, ayan, she would prefer it if she were the client. So the answer here is Christian ethics. Kapag naman, Kantianism, ayan, this is bound by a sense of duty. Actions are bound by sense of duty. Okay? Yan yung Kantianism. And the natural law theories naman, ayan, this is based on doing good and avoiding evil. Ethical egoism naman, sinasabi lang dito, what is right and good is what is best for the individual making the decision. Okay, yan yun. Okay, so again, the answer is Apple kasi sinabi dito, she would prefer it if she were the client. Ito, which we would expect to be treated. Yan. And so, 26 is Apple. 5, 4, 3, 2, and 1. 27. Nurse Jones decides to inform the client about his fatal illness since she believes it is her responsibility. Which of the following ethical theories is taken into account in this decision? Again, yung bound by, ano yung bound by ano dyan? By sense of duty. It is Kantianism. Okay? Utilitarianism naman, what is right and what is good is that which produces the most happiness for the most people. Okay, yun yung utilitarianism. Okay, 5, 4, 3, 2, and 1. 28. Which of the following is the best reason for a person to be regarded gravely disabled? Okay, so sinasabing gravely disabled, ayan, ito yung definition niya. Ayan. A condition in which an individual, as a result of mental illness, is in danger of serious physical harm resulting from inability to provide for basic needs. Ayan. Inability to care for oneself cannot be established by showing that an individual lacks the resources to provide the necessities of life. Rather, it is the inability to make use of available resources. So that is gravely disabled. Okay, yung hindi niya magamit yung available resources. So the answer here is Dogo. A mentally ill person is unable to make use of available resources to meet daily living requirements. Okay, 28 is Dogo. 5, 4, 3, 2, and 1. This is according to Wiedebeck. Okay. 29. Which of the following claims about the usage of restraints is correct? So something positive hahanapin natin dito. Restraints should never be used without a doctor's order. This is wrong. Kasi, although ideally, may doctor's order, pero diba, in emergency restraints, walang doctor's order. Okay? Pwedeng emergency restraints. Ayan, kahit na walang doctor's order. Ayan. So negative yan. For children and teenagers, restraint orders must be repeated by a physician every 2 hours. This is positive. Ayan. Pero kapag adults, 18 and older, every 4 hours. Okay? Every 4 hours kapag adults. 18 years old and above. Every hour naman kapag children less than 9 years old. Okay? Ayan. Okay, so ito, 18 up. Pasensya sa sulat. Ayan. Okay? Ayan. So clients and restraints must be examined and evaluated every hour for circulation, nutrition, respiration, hydration, and elimination problems. So every hour ba? Okay, so indicated na every 15 minutes, ayan, for the first hour. And then every 30 minutes for the second hour to ensure proper circulation. Restraints are removed every 2 hours for range of motion toileting and offering of fluids. Okay, so this is negative. Ayan. Within 1 hour of instituting constraints, an in-person examination must be undertaken. This is positive. Okay, so ang answer dito ay 2 and 4, dog. Okay, 5, 4, 3, 2, and 1. A nurse performs care on a client's urinary catheter according to a hospital policy. Okay? The client contracts an infection is considering legal action. The nurse's practice is as follows. So ito, according daw to the hospital policy, and the hospital is the nurse's superior. So ang applicable dito ay respondeat superior. Okay? Yan. Sinunod niya lang naman yung hospital policy, pero nagkaroon ng infection. So, applicable dito yung respondeat superior. And 5, 4, 3, 2, and 1. Situation. Loss is anything that is perceived as such by the individual, the separation from loved ones, or the giving up of treasured possessions. For whatever reason, the experience of failure, either real or perceived, or life events that create change in a familiar pattern of existence, all can be experienced as loss and all can trigger behaviors associated with the grieving process. Marie states, I accept that there are other people to be loved, and it doesn't mean that I love that any less. This is an example of which of the tasks described by Warden. Okay, so ito, so may different tasks tayo. Yung task 1, accepting reality of loss. Wala na siya sa stage na to kasi na-accept niya na kaya niyang magmahal ng iba. Okay, and alam niya na patay yung or wala na yung daddy niya. Okay? Hindi naman to nagpo-process ng pain. Ayan. The answer here is task 4, finding an enduring connection. Kasi in this stage, ayan, the lost person or relationship is not forgotten or diminished in importance, but rather is relocated in a mourner's life as a person goes on to form new relationships. Okay? So meron nang na-form na new relationships dito other than yung daddy na nawala. Okay? Ayan. So parang may pag-move on na dito, di ba? Kasi nakafocus na siya sa ibang tao, not really on the dad na. Tapos may acceptance na rin. Okay? Pero dito task 1 na, kasi yun yung pinakauna talaga. 31 is dog. 5, 4, 3, 2, and 1. Which of the following is the key distinction between healthy and maladaptive grieving? So yung key distinction actually is self-esteem. Okay? So normal grieving, walang loss of self-esteem. Kung mapapansin nyo, yung iba, kung may disease na sabihin natin asawa, yung mapapansin nyo sa kanya, meron silang low self-esteem, and that is already maladaptive grieving. So the answer here is boy. Okay? Ayan, yun yung key distinction, self-esteem. 5, 4, 3, 2, and 1. Which type of mourning response may a nurse expect from a 10-year-old child? Okay, statements that the deceased person will soon return. Ayan. Alam naman nila na permanent na yung death. Kaya hindi na babalik yan. Yung 10-year-old child. So, X yan. Regressive behavior such as loss of bladder control. And wala naman silang regressive behavior. Hindi yan common in 10-year-old child. Preoccupation with the loss. This is possible. Okay, lalo na yan, pwede silang magkaroon ng withdrawal into self. Okay? Yung mga 10-year-old. Thinking that they may have done something to cause death. And wala naman silang, alam naman nila na wala silang ginawa. Yeah. So, ang answer dito ay apple. Cat, sorry, cat. A preoccupation with loss. and withdrawal into the self. Okay, so 33 is cat. 5, 4, 3, 2, and 1. 34. Which of the following statements best describes the difference between normal grieving and clinical depression? In clinical depression, anhedonia is prevalent. So, saan dito yung anhedonia? This is positive. Okay? So, tama ka agad yun. In normal grieving, the person has generalized feelings of guilt. So, dito, in normal grieving, ayan, kasi clinical depression yung may general feelings of guilt eh. Yan. So, negative to kasi dapat clinical depression to. The person who is clinically depressed relates feelings of depression to a specific loss. And so, kabaliktaran siya, this is a normal grief. In normal grieving, there's persistent state of dysphoria. Yan. So, wala naman ditong persistent state of dysphoria in normal grieving. Usually, this is in clinical depression. So, the answer here is apple. And kasi, anhedonia, ayan, refers to the reduced ability to experience pleasure, prevalent in clinical depression. Okay, 5, 4, 3, 2, and 1. Next, 35. Which of the following statements regarding an adolescent's grief is untrue? Okay, so ano daw yung hindi totoo? Adolescents may not show their true feelings about death. Yes, this is positive kasi they may withdraw into themselves or attempt to go about usual activities in order to avoid dealing with the pain of the loss. Okay? Yan, so that is positive. May tendency sila to withdraw or to do usual activities. Adolescents tend to have immoral attitude. This is also positive. Ayan. Bakit? Kasi they may have difficulty tolerating yung intense feelings associated with the death. Okay? Kaya nagkakaroon sila ng acting out. Okay, so this is also positive. Ang negative dito ay cat kasi they can already perceive that as inevitable or ibig sabihin hindi maiwasan. Okay, so 35 is cat. And 5, 4, 3, 2, and 1. Situation PTSD has been related to the high rates of alcoholism among veterans, particularly those who have experienced active duty combat. It has only been recent history that the invisible wounds of combat veterans have received the treatment they desperately require. Which of the following statements regarding a preschooler's behavior regarding deployment of parents is true? So something positive. Okay, preschooler yung hinahanap natin dito. Yung dog, ayan, exhibits more irritability than regression. This is applicable in school age. Ayan, pero they exhibit more regression than irritability. Okay, that is in school age. More aware of potential dangers to parent. This is already in school age. Okay, so this is the right answer. Sorry, hindi the right answer. Preschooler pala. May respond to disruptions in their schedule. This is in infants. Okay, kasi usually ba may schedule. Okay. May assume blame for parents' departure. This is in preschoolers. So the answer here is apple. 5, 4, 3, 2, and 1. Schedule as in pattern. Okay, sa infants. Tigre, military veteran, has diagnosed with PTSD. He tells the nurse that he experienced panic attacks. Which of the following medications may be prescribed for Tigre to treat his panic attacks? So yung alprazolam, ayan, this is actually the answer. And this is to treat anxiety and panic disorders or panic attacks. Lithium naman, this is used for mania and wait lang. Mania, hypomania, and bipolar disorders. Ayan. Carbamazepine naman, this is used to treat epilepsy, trigeminal neuralgia, acute manic and mixed episodes in bipolar 1 disorder. Yan. Haldol naman, this is a typical antipsychotic. Okay, so the answer here is alprazolam apple kasi it's used to treat panic attacks. 5, 4, 3, 2, and 1. The client is heavily drinking alcohol on a day-to-day basis ever since he came back from active duty. What is the most appropriate nursing diagnosis for this patient? Okay, so yung risk factor for this ang iisa lang ang merong risk factor dyan ng substance abuse. Or yung primary risk factor. It is ineffective denial. Okay? Kaya nagkakaroon ng dependency sa substances. Okay? Ayan. So the answer here is boy. Ineffective denial. Okay, 5, 4, 3, 2, and 1. So, 39. Which of the following statements regarding a school-aged behavior regarding the deployment of a parent is untrue? So again, ayan, this is for preschoolers, this is for infants, ito naman school-age, this is true. Untrue is dog kasi they exhibit more regression than irritability. Okay, 39 is dog. 5, 4, 3, 2, and 1. 40. Tigre who was diagnosed with PTSD most unlikely exhibit symptoms of, so meron silang re-experiencing of trauma, and so we're looking for something negative. Intensive aversion to activities that would arouse recollection of trauma. So iniiwasan nila yung mga sobrang iniiwasan nila yung mga activities na yan na remember sa kanila ng trauma. So this is positive. Acute negative emotional state. Actually, this is chronic. It's not acute. So this is negative. Exaggerated startle response. This is also positive. Magugulat din. Ayan. So the answer is cat. 5, 4, 3, 2, and 1. Unlikely to ha. Unlikely yung hinahanap. Situation. Growing old in a society that has been obsessed with youth may have critical impact on the mental health of many people. The situation has serious implications for psychiatric nursing. The client who is diagnosed with depression has been found to be passive and dependent individual that is content and does not engage in life. According to the classic study of Richard, Livson, and Peterson, the older male client has been classified into which category? So ito yung mga different categories, classifications of older males, according to Richard, Livson, and Peterson. Okay, self-haters, ayan, ano bang ibig sabihin yan? Self-haters similar to angry men. Ayan. Galit sila, and their anger is toward themselves. Toward self, yung anger. Okay? They may see themselves as failure, see self as failure, which only depresses them more. Diba? Ang sad. Okay, so yun yung self-haters. Armored naman, they have well-integrated defense mechanisms which serve as adequate protection. So, meron silang rigid, stable, and they usually present a strong silent front. And often rely on activity as an expression of their continuing independence. Okay, yan yung armored. Ayan. Angry naman, these are bitter about life, themselves, and other people. So meron silang aggressiveness. Mga bitter na tao, ayan. They are aggressive, suspicious, little tolerance. Ayan. Unstable. And extremely threatened by old age. So parang outward yung anger neto nung sa angry. Self-haters kasi diba, from the word self, sa sarili sila galit. Okay? Ayan, rocking chair naman. What is rocking chair? Isang classification din to. Found to be passive dependent or content on needing others for support to disengage and to let most of life's activities pass by them. So this is the answer. Okay? Rocking chair. Ayan, DOPA. Okay. 5, 4, 3, 2, and 1. 42. While assessing the Geria client, she states that my own abilities and personalities will determine how I will be able to adjust in the future. Which among the following developmental tasks theories explains the statement of the aging client? Okay. In disengagement theory, this just describes the process of withdrawal by older adults from the societal roles and responsibilities. Okay? Yan. Yan yung theory na yon. Activity naman, activity theory, holds that the way to age successfully is to stay active. Okay? Ayan. So, opposite siya ng disengagement theory. Walang theory ng future aging. Yung development theory naman, and this is also known as, aka, continuity theory. Okay, so this states na, or emphasizes that the individual's previously established coping abilities and personal character, ayan, traits, previously established coping abilities and personal character traits as basis for predicting how the person will adjust to the changes of aging. So, tinatanong dito yung own abilities and personalities, determining how it will be able to adjust in the future. So, ang sagot dito ay CAT, development. Okay, 5, 4, 3, 2, and 1. Maria, 72, examined in a hospital for depression. Her doctor claims that she occasionally becomes disoriented and forgetful. Maria's arm has an open sore, which the nurse observes during her admission assessment. She responds, I scraped it on the fence 2 weeks ago. When she is questioned about it, it is smaller than it was. How might the nurse interpret these numbers? So 2 weeks ago na, and mas maliit na daw yung sugat. This indicates that the sore already healed. Okay? 2 weeks ago. I mean, already healed this time. Okay? Kasi nga 2 weeks ago na siya. Kasi nga mas maliit na. So, ano yung sagot dito? A diminished inflammatory response in the elderly increases healing time. So, this is positive. Ayan. Kasi nga, may increased healing time kasi nga mas maliit na siya. Okay? Hindi naman nag-i-indicate na nagsi-self-harm si client. Wala namang sinabi dyan. So, this is negative. Hindi nga siya nakakadelay ng healing kasi nga lumiit na yung sugat, 'di ba? Kung delayed healing yan, di dapat sinabi na walang nangyari sa sugat, okay? Or hanggang ngayon hindi pa rin nag-show ng healing. So this is negative. Wala lang ang delay in healing. So negative yan. So the answer here is apple. 5, 4, 3, 2, and 1. 44, Mr. Z, 79, with major depressive disorder suddenly becomes exhausted and out of breath during a group activity. This is mostly because of, okay, so, hindi naman natin pwedeng sabihin na may sedentary lifestyle siya agad-agad, no? Yan, hindi naman yan pathological effect ng depression. Hindi rin dahil sa medication. Okay, wala namang sinabing medication. Ayan. So, ang best answer dito ay, it is an age-related changes in the cardiovascular system. Okay, so sinasabi na, major determinant of decreased tolerance on exercise and loss of conditioning and the overall decline in energy reserve, ayan, yung age-related decline in cardiovascular system. Okay? Ayan. So, 44 is dog. 5, 4, 3, 2, and 1. 45, an elderly client says to the nurse, I don't want to go to that business class anymore. And may klase daw siya. My test scores are too low. Based on the knowledge of the aging process, which of the following is a true statement? So something positive. Cognitive function is rarely affected in aging individuals. This is negative. Kasi nga, di ba, usually meron silang memory problem. Okay? See, learning ability remains intact, but the time required for learning increases with age. This is positive. Okay? Intact pa naman yung ability nila to learn. Pero, mas matagal nga lang yung time na kailangan nila mag-aral. Ayun. So, mas matagal ang time na kailangan nila mag-aral. Okay? To be able to learn. So, this is positive. Hindi mo rin naman masabi na intellectual functioning declines. Okay, depende pa rin yan sa pasyente. Memory functioning most likely reflects loss of long-term memories of remote events. So, not all naman yan. Okay? Ayan. So, the answer here is cat. Right? 5, 4, 3, 2, and 1. Situation. Chad works in a psych facility and has been ordered to begin making regular visits to Mrs. Wall, an 80-year-old widow who lives alone. Her depression is diagnosed. Which of the following criteria would Mrs. Wall meet for home health visits? Okay? So ano daw yung criteria na nag-indicate na kailangan ng home health visits ni Mrs. Wall? She has never learned to drive and must rely on others for transportation. Ayan, so nakafocus siya dito sa inability to drive and relying on others for transpo. Hindi naman to yung criteria. Okay? So negative yan. Kasi pwede namang, di ba, ihatid siya doon eh. Hindi niya makailangan mag-drive. Mrs. Wall is physically unable to travel without risk of injury. Ayan, so mahalaga yung risk for injury, lalo na 80-year-old na to. Diba? So, possibly, na kapag nag-transportation pa si client, magkaroon siya ng injury. Okay, so pwede yung criteria. How about the other option? Mrs. Wall refuses to seek help as recommended by her doctor because I don't have psychiatric problem. Okay? So, ito naman, pwede rin, pero mas priority kasi yung risk for injury. She would rather have home visits than go to the doctor's office. So, mas importante pa rin yung risk for injury. So, the answer here is boy. Okay, 5, 4, 3, 2, and 1. Which of the following issues would Chad address on his first visit based on the needs assessment? So, again, importante nga yung safety ng client. Okay, so, complicated grieving ba, social isolation, risk for injury, or sleep pattern disturbance? Of course, yung risk for injury. Okay? Yan. 5, 4, 3, 2, and 1. Kasi psychosocial yung A, B, and D. Although, except yung sleep pattern disturbance. Pero, mas importante pa rin yung safety ng client. Okay? 5, 4, 3, 2, and 1. 48. Mrs. Wall tells her home health nurse, what's the point? I don't have anything to live for anymore. Which of the following is the best reply from the nurse? Ito naman parang, of course you do. Mrs. Wall, why would you say something like that? Okay, ito parang challenge pa yung client and then in-invalidate niya yung nararamdaman ng client. So, X to. It's not a best reply. You appear depressed. I'll do my best to cheer you up. So, ito, I'll do my best. Ayan, nurse-centered to. So, X yan. Let's talk about what's making you feel this way. Pwede. Have you considered harming yourself in any way? So, pwede yung C kasi may verbalization. Pero, mas okay na reply ang dog. Bakit? Kasi, possible na from this statement, I don't have anything to live for anymore. May suicidal intent na siya. Okay? Kaya tatanungin mo na direkta kung meron ba siyang consideration for harming herself already. Okay? So, 48 is dog. 5, 4, 3, 2, and 1. One homeless man recently moved into the facility. His care is being provided by Chad. Which of the following is a nursing intervention that should be prioritized? Okay, so prioritize number 1, di ba? Assessment in nursing process. And so hindi ito yung number 1 na gagawin. Planning, part of planning to. Ito naman sa pwedeng sa discharge na kasi ito eh. Diba? So the answer here is cut. Yan. 49 is cut. Conducting a behavioral and needs assessment. Okay, yan. 5, 4, 3, 2, and 1. John, a homeless person, has a history of schizophrenia and non-compliance with medications. Which of the following medications might be the best choice for John? So kapag non-compliance, and gumagamit tayo ng D-pot injections, okay? So yung example ng D-pot injection dito ay yung made decanoate. Okay, so the answer here is apple. Okay, 50 is apple. 5, 4, 3, 2, and 1. Situation. Tinola is one of the staff nurses in the medical board of Medical City. She handles various cases, including clients with GI problems. The following question apply. Tinola is preparing to teach a client with PUD about a diet that should be followed after discharge. Okay, diet daw ng may PUD. The nurse should explain that the diet will most likely consist of yung bland foods, ayan, So this is indicated for clients na may exacerbation ng PUD. For discharge na nga siya. So wala na exacerbation dito. Ang recommended na lang ay any balanced food tolerated. Okay? Yan. So hindi naman kailangan ng high protein food. And yung large amounts of milk may increase stomach acidity. Okay, so 51 is cut. 5, 4, 3, 2, and 1. 52. The nurse is caring for a patient with PUD, which assessment finding is the most serious. Okay, so most serious dito, ito kasi projectile vomiting, this indicates obstruction eh. Common siya sa pyloric stenosis, not really in PUD. Coffee ground emesis. Ayan, signs of internal bleeding. Pero kasi coffee ground na to, ibig sabihin nag-clot na sa tiyan yung bleeding. So, hindi na siya active. Kasi kapag active, this is fresh blood, di ba? Yan. So, medyo low in priority pa to. Burning sensation 2 hours after eating. Ito naman, this is common in PUD, pero it can be controlled by medication. Okay, so ang pinaka-priority dito or most serious in yung board-like abdomen with shoulder pain, which indicates perforation. Okay? Yan. It is the most lethal complication of PUD. There is already a hole in the stomach. Okay, so 52 is boy. 5, 4, 3, 2, and 1. Pakitama na lang tong 51 na dapat any balanced food tolerated siya. Okay, ayan, 52 is boy. 5, 4, 3, 2, and 1. Which nursing intervention would be most effective in managing a client with PUD experiencing severe pain? So most effective daw in severe pain. Yan. Providing psychological support. Ayan. May severe pain na, psychological support pa ba ang ibibigay natin? Hindi na siya ganun ka-effective. Okay? Yan. This may be encouraged, yung low-fat, high-fiber diet. Pero, it does not alleviate pain, yung diet. Okay? So, X yan. Administering antacids or administering PPIs. Ano ang mas okay? Mas okay dito kasi yung PPIs. Kasi this inhibits or blocks gastric acid secretion. Ano naman ang ginagawa ng antacids? Ito naman ang ginagawa niya, it neutralizes acid present in the stomach. So meron ng acid. Okay, ito kasi binablock niya yung secretion, okay, to the stomach. Okay, so syempre mas maganda yung i-block mo kaysa yung nandun na siya sa stomach tapos dun mo palang in-neutralize. Okay, so answer here is apple. 5, 4, 3, 2, and 1. A client with PUD is prescribed ranitidine. The nurse should monitor the client for which potential adverse effects. Okay, so yung ranitidine, ayan, similar to PPIs, it also blocks stomach acid secretion. Ayan. So ano yung i-monitor natin na potential adverse effect? Wala siyang hypertension na effect, okay? Mas effect niya ang hypotension. Etong stomach ache and cough, ayan, it is relieved by ranitidine, hindi siya adverse effect. So, ang adverse effect dito ang headache. Okay, headache is a potential adverse effect of ranitidine. Okay, so 54 is dog. 5, 4, 3, 2, and 1. After subtotal gastrectomy, care of the client with NGT and drainage system should include which of the following nursing intervention? Ayan, so deturn the machine to a high suction if the drain is sluggish on low suction. And kapag hinay suction mo yan, this can create too much tension in the suture line. Okay, so hindi natin gagawin yan. Yung repositioning naman, yan, this can also create tension on the suture line. Okay, so hindi natin ginagawa yan. But it is done by surgeon. Okay? Kailangan by surgeon, yung surgeon yung gumawa niyan kasi it can disrupt the suture line daw. And irrigate a tube with 30 ml of sterile water every hour as needed. So, hindi sterile water ang ginagamit, kundi saline solution pwede na. Okay, so X rin to. Okay, so the answer here is A, monitor the client for nausea, vomiting, and abdominal distension. Kasi ito dapat yung nire-relieve ng NGT and drainage system. Ay yung nausea, vomiting, and abdominal distension. Kapag nangyari yan, ibig sabihin hindi effective yung management natin, NGT and drainage system. So 55 is apple. 5, 4, 3, 2, and 1. 56. The client is scheduled to have an upper GI series. Which of the following treatments should the nurse anticipate after the examination? So sa upper GI series, ayan. So ito yung nangyayari dyan. It is an examination of the esophagus and stomach using barium to coat the walls of the upper digestive tract so that it may be examined under X-ray. Okay? So ito namang clear liquid diet. Wala namang effect yan sa pag-stimulate ang removal ng barium. Okay? Itong tap water enema, ayan, this is not recommended kasi it elevates sodium in the client. So, X din to. Hindi naman nakakatulong ang IV infusion kasi pinapadaan yan nga sa veins, hindi naman sa GI. So, best answer dito is laxative kasi kailangan agad na i-eliminate ang barium kasi it can cause constipation and possible impaction. Okay, so 56 is dog. 5, 4, 3, 2, and 1. 57. The client with hiatal hernia is being instructed by the nurse on health maintenance activities. Which of the following statements would indicate that she understood your teachings? Okay, so something positive to. It's okay to lie down after meals. So ito hindi siya advisable kasi this promotes reflux and movement of the hernia. Okay, as well as itong eating at bedtime, di ba? Kasi magla-lie down din siya dyan. Ito namang D, if I were a girl del, ayan, ito ay constrictive. So, this can increase intra-abdominal pressure. Pwede magkaroon ng more protrusion of the hernia dito. Okay, so negative yan. Best answer is cat. I'm glad that I don't have to give up swimming. Kasi yung mga light, low-impact activities like walking, jogging, and yoga and swimming, these are the best exercises for those with hiatal hernia kasi they don't strain the stomach. Okay, so 57 is cat. 5, 4, 3, 2, and 1. Situation. Clients with renal failure have just been admitted to the ward where Sarah as a staff nurse is currently on duty. The following questions apply. A client with acute renal failure is for peritoneal dialysis. The nurse should do which of the following in preparation for the procedure? Ito namang examination of the Bruy and Trill. Okay, it is for those na may fistula. Okay? Yung Bruy, palatandaan ko dyan, A, B. So you auscultate the B, Bruy. Okay, yung Trill naman, you PT, palpate the Trill. Okay, ayan. Sa fistula yan, hindi siya sa peritoneal dialysis. Okay, so X yan. Warm the solution. Ayan, indicated to kasi negative. And positive naman itong warming the solution kasi this vasodilates the blood vessel. So this increases the mobilization of blood filtering. Okay, so this is positive. Insertion of indwelling urinary catheter. Ayan, hindi naman yan required for peritoneal dialysis. So this is negative. Yung positioning naman ng client for peritoneal dialysis is supine or low Fowler's position. Okay, hindi left side lie. Alright, so the answer here is boy. 5, 4, 3, 2, and 1. 59. The client with acute renal failure has increased blood urea nitrogen. What is the most likely cause of this discovery? Okay, so ang kidneys kasi ang in charge of excretion of BUN. Okay, and as we know, BUN or urea is a byproduct of protein metabolism. So anong sagot dito? Retention of fluid ba? Red blood cell hemolysis? Okay, usually this happens in the spleen, di ba? Not really in renal, in the kidneys. Metabolic rate that is lower than normal. Wala namang epekto sa bun, as well as ito, wala siyang effect sa bun. Ang may effect lang dito, yung renal blood flow has been reduced kasi hindi makaka-appropriately function yung kidneys. Hindi niya ma-excrete ng maayos yung BUN. Okay, so 59 is dog. 5, 4, 3, 2, and 1. 60, the client with acute renal failure is given a high carbohydrate. Pagkatapos pala ng situation na to, short CR break lang tayo sa ha. Ayan, so 60, the client with acute renal failure is given a high carbohydrate, low protein diet. Okay, this diet is intended to achieve the following results. Okay, so hindi naman siya, yung diet, hindi naman siya makaka-achieve ng diuretic. Okay, so X yan. Ang pinag-usapan kasi natin dito ay kidney, hindi naman liver. Okay, so X yan. Aid in the preservation of urine acidity. So, merong mga specific carbohydrates na makaka-influence ng urine pH, pero hindi naman ito yung primary reason for giving this kind of diet. Okay? So, the best answer here is to prevent onset of ketosis. Kasi kapag may high carbohydrate ka, hindi niya na kailangan na mag-metabolize pa ng fat. And ang byproduct niya ay ketones. Okay? Ayan. So, kailangan ng low protein diet kasi nga, byproduct niya yung urea, which is excreted by the kidneys. Okay? So, kailangan ng low protein para low urea lang din yung ma-produce. Konti lang din yung kailangan i-excrete ng kidneys. Hindi siya ma-overwhelm, okay, sa urea. Okay? Hindi siya mag-lead sa increased BUN. So, 60 is dog. 5, 4, 3, 2, and 1. 61. The dialysis solution is warm before use in the peritoneal dialysis for several reasons. Foremost, so yung pinakauna dito ay, ayan, so we mentioned kanina, diba, warm siya dahil this increases or promotes body's comfort. This is the secondary reason. Okay? So, dito yung second kasi foremost yung hinahanap natin dito. Wait lang. So, yung main reason kung bakit wino-warm ang dialysis solution, because it helps in the dilating of the peritoneal vessels, which increases urea clearance. So, the removal of the urea. Okay, so the answer here is apple. Kasi nga, it leads to vasodilation. Okay, walang effect yung reintroduction of potassium and relaxation of the abdominal muscles. Okay, so 61 is apple. 5, 4, 3, 2, and 1. Aluminum hydrogel amphogel is indicated for chronic renal failure patients to ingest at home. What is the expected effect of administering this medication? So yung kidneys natin, ayan, they normally excrete phosphate in the body. And yung ginagawa ng amphogel or aluminum hydroxide, ayan, so ito siya. Ay, putang haba. Kailang. Ayan. So, it is a phosphate binder and oral antacid, most commonly used to treat high phosphate levels secondary to kidney dysfunction. It can also be used to reduce stomach acid. So, yung expected effect niya ay, ayan, may phosphate binding in the gut. Okay, yung secondary niya is, wait lang. And to decrease or to relieve the discomfort of stomach hyperacidity kasi nga it reduces the stomach acid. Pero ito lang, secondary effect lang siya. Okay, primary effect niya pa rin is phosphate binding. Okay. It doesn't prevent or avoid curling stress ulcer and wala naman siyang effect sa metabolic acidosis. So 62 is ka. 5, 4, 3, 2, and 1. Ito last na. CR break na nga. Kasi nasa-CR na rin ako. Okay, the client with chronic renal failure is being instructed by the nurse to maintain proper nutritional intake. Which of the following diets would be best fit? So kanina, di ba kailangan natin ng high carbs and low protein. Okay, since high protein to, X na yan. So pipili na lang tayo dito. Hindi natin kailangan ng high potassium kasi ini-excrete din yan ng kidneys. Okay, so kapag high potassium pa, hindi yan na-excrete ng kidneys, magkakaroon lang siya ng high potassium. So low protein, low sodium, and low potassium ang kailangan natin. Okay, 63 is can. 5, 4, 3, 2, and 1. Okay, sige, CR break tayo. We still have a remaining about less than 40 questions. Okay, so balik tayo ng siguro mga 5 minutes, okay lang ba? Para hindi tayo mag-extend. CR break lang talaga. 3:28 p.m. 3:29 na lang. Ayan. Thank you, guys. Hello, guys. Okay. Ay, 3:29. Ayan, 3:29 na. Game na, ma'am. Nakaligo na po ako. Nagbuhos na po ng tatlong labo. Nakaloka ka naman, sir. Ayan. Sana all, no? Nakabuhos ng 3 tabo na. Ayan. Okay, masyado ba ako mabilis, guys? May nagsabi masyado daw ako mabilis. Paki-confirm nga. Okay lang daw, sakto lang. Okay, sige. Okay, good. Sige. Let's just continue. Ayan, 3:29 na. So, 30 minutes na lang. Kaya pa ba? Okay. So, paki-type 1 nga. Oo nga, tama. Para on time matapos. Diba? Makarest pa kayo after. Type 1 for top 1 naman dyan. Hindi type Y for ano ha? Buhay pa ba? Ano yun? Type 1. Okay? Ayan. So, thank you. Type 1 kung patay. Grabe naman. Type Y kung buhay. Okay, sige. Go na tayo. Go na. Sige. Situation, patient Jake. Ano ba to? Patient Jake is a 48-year-old male brought to the neuroscience unit. He is diagnosed with multiple sclerosis. Ano ba yan? Excuse me, sorry. Multiple sclerosis and has been admitted to the exacerbation of clinical manifestations. Ayan. 64. Patient Jake is placed on high-dose IV injections of corticosteroids medication, which nursing intervention should be implemented. Okay, so ano bang indication dito ng corticosteroid? It is used to reduce inflammation in the central nervous system where the myelin sheaths are attacked. Kasi 'di ba? Dito sa MS, there's demyelination of the CNS. Okay, so type natin demyelination of the CNS, central nervous system. Okay, so inaatake yung myelin sheath sa central nervous system, kaya kailangan ng corticosteroids to reduce the inflammation. So anong nursing intervention ang i-implement natin dito? Okay, so provide supplementary dietary sodium with the client's meals. Ayan. So this is X kasi this may cause increased sodium. Okay. Sodium retention. Monitor the client's serum blood glucose levels frequently. Teka lang. This is positive. Using ko lang ha. Ito negative to, ito positive to. Positive siya, bakit? Kasi yung corticosteroid, it is known to block the action of insulin. So, kailangan i-monitor yung serum blood glucose levels. Okay? Again, it blocks the action of the insulin. Hold the medication until after all cultures have been obtained. Ito naman, indicated to for antibiotics, okay? Not corticosteroids. Discuss discontinuing the PPIs with the healthcare provider. Ayan. So, ito, yung corticosteroid, it is known to increase gastric acid. So, bakit mo i-discontinue? Okay, so this is negative. Okay, so the answer here is CAT, kasi kailangan daw i-implement. Okay, 64 is CAT. 5, 4, 3, 2, and 1. 65. Which clinical findings does the nurse anticipate a client with an exacerbation anticipate in a client with an exacerbation of MS to experience? Select all that apply. So, expected tong double vision. Ayan, along with nystagmus, yung involuntary rapid rhythmic eye movements. Ayan, kasama yung double vision. Resting tremors ba meron sa MS? This is negative kasi ang meron sa MS ay intentional tremors. Okay? Itong resting tremors, this is for Parkinson's disease. Flaccid paralysis. Flaccid paralysis, ayan, yung relaxation, nagkukause daw ng paralysis. Hindi. Kasi in MS, di ba, meron tayong spasm. So, may spastic paralysis, hindi flaccid paralysis. Okay, so this is negative. Scanning speech, di ba? Meron tayong Charcot's triad sa MS. Ano yung triad na yun? Yung SIN. Di ba? Yung merong scanning speech, SIN, S, I intention tremor, and N nystagmus, which again is the involuntary rapid eye movements. Kaya yung Charcot's triad. Charcot's triad. Okay. Wait lang. Yan. So this is positive. Mental retardation. Wala namang, hindi naman indicated yan sa MS. Okay? Kasi intelligence remains intact in MS. So negative yan. Ang positive lang ay 1 and 4 apple. Okay? 5, 4, 3, 2, and 1. 66. The nurse is reassessing patient Jake. Which clinical manifestation warrants immediate intervention? Okay? Itong scanner speech and diplopia, ayan, common yan in MS, di ba? Pero hindi naman yan life-threatening. So, X yan. Dysarthria and scotomas. Ayan, dysarthria meaning difficulty speaking due to weak muscles. Yung scotoma naman, may blind spot in the center of the vision. Hindi rin naman to life-threatening, pero it happens. They both happen. They may happen in MS. The client has muscle weakness and spasticity. Okay? This may also happen in MS. Ayan. How about congestive cough and dysphagia? This may also happen. Tas ito, as compared to other options, this is the most important. It warrants immediate intervention. Kasi, yan, this poses a risk for pneumonia and aspiration. So, airway is priority. Ayan, 66 is dog. 5, 4, 3, 2, and 1. 67. Patient Jake is prescribed baclofen. Ayan, so alam natin yung baclofen, it is a skeletal muscle relaxant. So, it decreases the muscle spasms. Okay, which finding assessment would indicate the nurse that the client is experiencing a therapeutic response from the medication. And so it decreases muscle spasms. So 67 is boy. 5, 4, 3, 2, and 1. 68. The patient completely recovered and was eventually discharged. However, he was later readmitted due to acute onset of visual changes, fatigue, and leg weakness. The client says that the last time this happened, recovery occurred in few weeks. So, naka-recover na siya, tapos nagkaroon na naman siya ng acute onset. Okay, what classification of multiple sclerosis is the client experiencing? Okay, kapag sinabing relapsing remitting, ayan, may acute episodes with almost a complete recovery between attacks. Okay, so that is relapsing remitting. Primary progressive naman, steady. There's the steady degenerative progression, yan, without exacerbation. Kapag naman secondary progressive, an initial relapsing remitting, then followed by steady deterioration later in the disease process. Okay. RR is relapsing remitting. Progressive relapsing naman, progressive yung disease pero with periodic acute exacerbations. Okay, so yung tinatanong dito is relapsing remitting. Acute episodes with almost a complete recovery between attacks. Kasi sabi niya, recovery occurred in a few weeks. Okay, ayan. So the answer is apple. 5, 4, 3, 2, and 1. Situation. Spinal cord injury is very common among young people aged 16 to 30. You know that SCI is a major health problem that you could encounter at the hospital. Nurse Jamila knows that the anterior cord syndrome is characterized by, so ito yung anterior cord syndrome, there is loss of motor pain and temperature sensation, but with preservation of position, vibration, and touch sense. So saan yun dito? It is in boy, ayan, loss of pain, temperature, motor function, below the level of the lesion, ayan, but light touch position and vibration sensation remains intact, okay? Yung A, yan, motor deficit, the upper extremities compared to the lower extremities, sensory loss varies but is more pronounced in the upper extremities. There's bowel bladder dysfunction, which is variable, or function may be completely preserved. Ito naman, this is in central cord syndrome. Ayan. And then yung C, ipsilateral paralysis of or paresis is noted together with ipsilateral loss of touch, pressure, vibration, and contralateral loss of pain and temperature. This is in Brown-Sequard syndrome, lateral cord syndrome. Yan. And yung D, loss of voluntary motor control on the same side as the cord damage. This is also Brown-Sequard syndrome or lateral cord syndrome. Okay, so the answer is boy. 5, 4, 3, 2, and 1. Yes, very good. 70. The American Spinal Injury Association provides another standard classification of spinal cord injury according to the degree of sensory and motor function present after the injury. It is also used to predict recovery. A patient with completely no motor or sensory function in the sacral segment is given a grade of. So there is completely no motor or sensory function. It is A, complete. Okay, ayan. 70 apple. 5, 4, 3, 2, and 1. You know that the goal of management is to prevent further injury. Thus, you anticipate the attending physician to order an administration of. So, i-anticipate natin. Yung NSAIDs, this is used to relieve pain. Relieve pain. Okay? The opioids naman, dito recommended. Although this relieves pain, this is not recommended due to increased risk for adverse outcomes. Yan. Corticosteroids naman. This reduces inflammation, it improves motor and sensory function, and prevent neurologic damage in clients na may STIs. Okay? So, the answer is corticosteroids. Yung Valium naman, this is to treat muscular spasticity. Okay? Ayan. So again, the answer is cat, corticosteroids. 5, 4, 3, 2, and 1. 72. The nurse is planning care for a client who has experienced a T3 spinal cord injury. The nurse should include which intervention in the plan to prevent autonomic dysreflexia or hyperreflexia. So, and so what we know with autonomic dysreflexia, it is an abnormal overreaction of the involuntary nervous system to stimulation. This reaction may include change in heart rate, excessive sweating, and high blood pressure. So, most often, ang alam natin with autonomic dysreflexia, di ba, sobrang taas ng BP. And ano ba yung mga trigger niyan? Pwede yung bladder distension, bowel distension, and visceral distension, and stimulation of pain receptors in the skin. Okay? Assist the client to develop a daily bowel routine. This is positive. Yan, kasi nga, isa sa mga trigger ay bowel distension. Okay, so this should be included. How about boy? Teach the client to manage emotional stressors by using mental imaging. So, hindi mo naman matuturuan yan through mental imaging, di ba? Hindi yan ideal. So, negative yan. Assess vital signs and observe for hypotension, tachycardia, and tachypnea. So, hindi hypotension ang i-observe natin, kundi hypertension. So, this is negative. Administer dexamethasone orally per the primary healthcare's prescription. Hindi naman to drug of choice. Ang drug of choice natin is nitroglycerin paste. Yan. This recommended. Recommended for the initial emergency treatment of severe hypertension in patients with autonomic dysreflexia. 1 to 2 inches of nitroglycerin, 2% paste should be placed on the skin above the level of the spinal cord injury. So again, the answer here is yung something positive, apple. Okay, kasi isa sa mga trigger ay bowel distension. Alright, 5, 4, 3, 2, and 1. 73. The nurse is caring for a client who has experienced a thoracic spinal cord injury. In the event that spinal shock occurs, which IV fluid should the nurse anticipate being prescribed? So, kapag sa spinal shock, yan, this occurs following an acute spinal cord injury and involves a reversible loss of all neurofunction. Okay, so ito namang dextran, ayan, this is an anticoagulant. That has adverse effects. Kaya hindi yan recommended. Ito namang normal saline, this is an isotonic solution. 5% dextrose in water, this is a hypotonic solution. And yung 5% dextrose in 0.9% normal saline naman is an hypertonic solution. Okay. So, anong kailangan natin dito? Isotonic, hypotonic, or hypertonic? Usually, yung hypertonic, ginagamit to help in or to aid in shock resulting from hemorrhage or burns. Not really sa clients na may spinal shock. Okay? Yung hypotonic naman, yan, this is not indicated for shock. Yung isotonic, ito yung mas indicated for spinal shock kasi may low BP in spinal shock. So there is peripheral vasodilation after spinal cord injury. So kailangan ng administration of IV fluid, okay, para makatulong dun sa pag-maintain ng BP or pag-increase ng BP kasi may low BP. Okay, so ang indicated ay yung buoy isotonic solution. Okay? 5, 4, 3, 2, and 1. 74 or situation muna. Nurse Abby has been working an eye nurse for 3 years at an eye clinic. As a senior nurse, she is assigned to teach the new hires. Pertinent questions and assessment is necessary to diagnose ophthalmic conditions. Nurse Abby, during the orientation, explains that the test used to visualize the angle of anterior chamber is known as, so yung tonometry, it measures the pressure of the eye. Ayan, so also, tinitingnan niya kung may increased intraocular pressure. Fluorescein angiography naman. This looks at the blood vessels, and lining at the retina. Okay, so helps in diagnosing of the retinopathy. Perimetry testing. Okay, this detects loss of peripheral vision. Okay, so kapag may loss of peripheral vision, there is tunnel vision. Yan, which is also a symptom of glaucoma. Okay. And then gonioscopy naman, ito na yung sagot. This visualizes the angle of anterior chamber to identify abnormalities in appearance and measurements. So the answer here is DOGA. Yan. 5, 4, 3, 2, and 1. 75. The depth of the eyeball is used to determine refractive errors where vision is impaired because of shortened or elongated eyeballs. For patients who do not need glasses are said to have, ayan, so gawa-gawa lang tong CND, walang ganyan. Eutropia naman, wala tong kinalaman sa mata. Okay, ang na-research ko dyan, it is a woman of Syrian origin, was a wife of Emperor Maximian. Okay, eutropia. Emetropia naman, this is a person with perfect vision, also known as 20/20 eyesight. Ayan. So the answer here is boy. 5, 4, 3, 2, and 1. 76, IV dose of lorazepam is prescribed for a client which data from the client's history would indicate the need to consult with the primary healthcare provider before administering the medication. Okay? So, ano muna i-consult niya before administering yung lorazepam na included sa client's history? Glaucoma, hypothyroidism, DM, or cataracts. Yung lorazepam kasi, it is a mydriatic. Okay? So, it further obstructs the outflow of aqueous humor, which is in glaucoma. Okay, so the answer here is apple. Okay, yeah, 5, 4, 3, 2, and 1. Yeah, very good. 77. Which drug does a nurse anticipate may be prescribed to produce diuresis and inhibit formation of aqueous humor for a client with glaucoma? Okay, yung chlorothiazide, ayan, and bendroflumethiazide, itong dalawa, these are diuretics, but they don't have an effect on the eye. Okay, so X yan. So na siyang effect sa eye. Yung acetazolamide naman, this is a myotic, but it doesn't affect. So myotic to. Myotic meaning it constricts the eye. Okay, but it doesn't affect the production of the aqueous humor. So ang answer dito ay dimecarium bromide. Ayan. It is a carbonic anhydrase inhibitor that decreases the inflow of aqueous humor and controls the intraocular pressure in acute angle closure glaucoma attack. So the answer here is dog. Okay, 5, 4, 3, 2, and 1. 78. Bacterial keratitis, or commonly known as infection of the cornea, is treated with a high concentration of antibiotic eye drops administered round the clock during the first few days. This infection can be caused by yung herpes simplex. Ayan, this causes herpes simplex keratitis. Okay, so X yan. Ito naman chlamydia, it causes chlamydia conjunctivitis, which includes trachoma. Okay, so ito namang trachoma, it is the bilateral chronic follicular conjunctivitis of childhood that leads to blindness during adulthood if left untreated. Okay, so lagay natin yan dyan. Ayan. So, included siya sa chlamydia conjunctivitis. Okay, yung streptococcus pneumoniae naman, this is the answer. Kasi ito this is one of the causative agent of bacterial keratitis. Okay, so the answer is dog. 5, 4, 3, 2, and 1. Situation nurse Lisa and nurse Hope was assigned at the ENT Wellness Clinic. The nurse is providing instruction to the parent of a child who had meningotomy with insertion of tympanostomy tube. Which instruction should the nurse provide the parent in case the tube falls out? So normal kung mag-fall out ang tympanostomy. Yung meningotomy, again, this is the formation of a hole. Yung tympanostomy, yan yung tube na insert mo doon sa hole para mag-drain out. Okay, yung fluid. Okay? So normally, the tubes fall out of the ear in 6 months to 2 years. If they remain in longer than 2 to 3 years, they are sometimes removed. Okay, so bringing the child to the emergency department immediately. Hindi naman to emergency. So X yan. Kasi expected nga na magpa-fall out siya. Hindi siya emergency, pero it's best to call the healthcare clinic. Okay, this is the best answer. Hindi naman siya kailangan i-replace kasi nga expected nga na mahulog siya. Hindi siya kailangan linisin. Okay? Kapag nahulog siya, yun na yun. Hindi mo na siya kailangan ibalik. Okay? So, the answer again is boy. 5, 4, 3, 2, and 1. So, tatawagan lang yung healthcare clinic para in-inform na nahulog na. Okay? Ayan. 80. The nurse is about to administer a prescribed IV dose of tobramycin when the client reports vertigo and ringing in the ears. Which action should the nurse take? So tobramycin is an aminoglycoside that has ototoxic effects and could result in permanent hearing loss. Okay? Ayan. So, anong next na action ng nurse dapat dito? Wala naman siya kinalaman sa mata. Okay, sa ears nga siya. Kasi nga ototoxic. Ano itong hang? Diba? Hindi yan. Yung droperidol, it prevents nausea and vomiting. Tapos bibigyan mo pa ng tobramycin, di mas lalong naging ototoxic yung client. So, extreme to. So, you hold the dose and call the healthcare provider. So, di yung second. 5, 4, 3, 2, and 1. 81. Which question should the nurse ask when assessing a client for possible manifestations of Meniere's disease? Okay, so yung Meniere's disease is characterized by dilation of the endolymphatic system and by overproduction or decreased reabsorption of the endolymphatic fluid. Okay, so do you expect ringing in your ears? Ayan. Isa sa mga symptoms yan ang tinnitus, so positive to. Vertigo as well, ayan, positive. And sensory neural hearing loss, one-sided sensory neural hearing loss. Wala naman kanalaman dyan ang genetics as well as ang head trauma. Okay, so the answer is 1, 2, and 3 cat. 5, 4, 3, 2, and 1. Okay, baka most probably mag-extend tayo, guys. Sorry in advance. And the preschooler with history of cleft palate repair comes to the clinic for a routine well child checkup to determine whether this child is experiencing a long-term effect of cleft palate. Which question should the nurse ask the parent? Okay, so yung cleft palate, long-term, ayan. So ano bang function ng muscles of the palate? So, it is important in allowing air into the middle ear as well as allowing drainage of secretions from the middle ear. Okay, yun yung function ng muscle, ng palate muscles. Okay? Kapag na-interrupt daw yun at hindi pa na-repair yung cleft palate, ayan, the fluid can build up, resulting in otitis media. Okay, so the answer here is C. Kasi may kinalaman na sa hearing. Okay, ayan. So, 82 is cut. 5, 4, 3, 2, and 1. 83. The nurse is performing otoscopic exam on a client with a suspected diagnosis of mastoiditis. So, ito yung mastoiditis, inflammation of the mastoid. Which findings should the nurse expect to note if the disorder was present? Okay, so sa otoscopic examination, ayan, it reveals that the mastoiditis is a red, dull, thick, immobile tympanic membrane with or without perforation. So the answer here is apple. Okay, ayan, apple. Ayan, ito namang B, C, and D, this is the appearance of a normal findings, okay, of a mastoid. Okay, 83 is apple. 5, 4, 3, 2, and 1. Situation Block B is preparing to conduct a ward class in the ortho ward. As part of their preparation, they quiz each other about the basic anatomy of musculoskeletal system. The junction of 2 or more bones is called a joint. The student nurse Anna knows that the joint is characterized by articulation between the radius and the ulna is called. So, itong saddle joint, ayan, dalawa silang saddle joint, ulit-ulit. Ayan, ito yung description niya. It allows movement in 2 planes at right angles to each other. The joint at the base of the thumb is a saddle biaxial joint. Okay? Gliding joint naman, this allows for limited movement in all directions and are represented by the joints of the carpal bones in the wrist. Okay, ayan. Pivotal joints naman, characterized by the articulation, ito na yung sagot, between the radius and the ulna. They permit rotation for such activities as turning a doorknob. Okay, so the answer is cat. And 5, 4, 3, 2, and 1. 85. When bone is fractured, the bone regenerates itself, which follows 6 stages. So, ito yung 6 stages ng regeneration, bone regeneration. Ayan. So, may hematoma inflammation, angiogenesis. So, yung pagkakasunod-sunod niyan. Una to. Second yung angiogenesis. Ayan. Third is yung cartilage calcification, cartilage removal, and bone formation, and then remodeling. So the answer here is apple. Okay, 5, 4, 3, 2, and 1. 86. Nurse Apple asks the student nurses to recommend a daily intake of calcium for postmenopausal women. Student nurses answer correctly when they say, so ito masyado na itong mataas. Yung 1,200, this is recommended for adults, 51 years old and older. Ayan. 1,300 naman for puberty through young adulthood. Ayan. Age 9 to 19 years. 1,500 naman for postmenopausal women. So the answer here is dog. Ayan. 5, 4, 3, 2, and 1. 87. Student Nurse Joy is assessing the client's peripheral nerve function. Nurse Apple knows that Joy is correctly assessing the peroneal nerve when he asked the patient to. So yung A, this assesses for the ulnar nerve. Spreading all fingers. Ayan. Yung B naman asks the patient to plantar flex the toes and ankle. This assesses for the tibial nerve. C, touch the thumb to the little finger. Assesses for median nerve. Yan. And yung D, ito na yung assessment for the peroneal nerve. So the answer is dog. Yan. Ask the patient to dorsiflex the ankle and extend the toes. 5, 4, 3, 2, and 1. Situation, Nurse Bell is assisting in a client that underwent arthroscopy. She knows that arthroscopy is the direct visualization of the joint. 88. The nurse creates a post-op plan of care for a client undergoing arthroscopy. The nurse should include which priority action in the plan. So, anong pinaka-priority natin dito? Yan. Siyempre yung neurovascular function kung ang affected. Okay? Ayan. And the answer here is cat. Okay, monitor the area for numbness and tingling. Yan. Okay, so 88 is cat. So, siya yung pinaka-priority. Kasi, kung wala na yan, ibig sabihin may problema sa sensation and possibly circulation. Okay, so 88 scan. 5, 4, 3, 2, and 1. 89. A client was admitted to the surgical unit after right total knee arthroscopy performed 2 hours earlier, which surgeon's prescription requires clarification. So something negative ang hahanapin natin dito. Maintain the right knee in a slightly flexed position. This is negative kasi dapat naka-extend siya. Okay, yun yung indicated and recommended. Implement patient-controlled anesthesia per protocol. This is positive. Pwede naman yan. Place sequential compression device on both legs while on bed rest. This is positive. This is to reduce risk for thromboembolism. Notify PT to begin isometric quadriceps exercise on the day following surgery. So, again, yung isometric exercises, this exercises yung muscles. So, kinocontract lang yung muscles. This is to prevent contracture. So, the answer here is apple. Kasi requires clarification. 5, 4, 3, 2, and 1. 90. The nurse has given instruction to a client who is returning home after an arthroscopy of the knee. The nurse determines that the client understands the home care instructions if the client states the need to follow which instructions. So something positive. May resume weight-bearing exercises the following day. So this is negative kasi the client should avoid weight-bearing exercises for at least a few days. Okay, stay off the leg entirely for the rest of the day. So ito naman, pwede niya naman galawin as long as non-weight-bearing and non-strenuous yung activity. So this is negative as well. Refrain from eating food for the remainder of the day. So this is not indicated. Food may be eaten as tolerated. Report fever or site of inflammation to the primary healthcare provider. So this is positive. This is the answer. Kasi may risk for infection due to incision. So 90 is dog. 5, 4, 3, 2, and 1. Situation: osteoporosis is a disease that threatens more than 28 million Americans. Nurse Jen, an ortho nurse, explains to her client that osteoporosis happens when there is reduction of bone density. Okay, so nurse is working at an osteoporosis screening clinic and is interviewing and performing health assessment on women which clients are at greatest risk for developing osteoporosis. So sinasabi na, ayan, yung Asian, white, small-boned, fair-skinned women are at greatest risk for osteoporosis. This is due to relatively low bone mass. Okay? So, X na to kasi nga female ang high risk. Dark-skinned, X kasi dapat fair-skinned. Ayan. Wala namang indication kung nagpupunta siya sa gym frequently. So, answer ito ay Asian women because they have low bone mass. Okay? 5, 4, 3, 2, and 1. Okay, 92. Which food selected by the client with osteoporosis indicates that the nurse's dietary instruction was effective? So something positive. Okay. Yung red meat, this is actually limited because this decreases calcium from the bones. Okay, so this is negative. Soft drinks naman, this is high in phosphorus. So this may interfere with calcium absorption from the GI tract. Okay, so this is negative. Enriched grains, ayan, similar to soft drinks, they are high in phosphorus. So they may interfere with the calcium in the GI tract. So ang sagot dito ay turnip greens, ayan, they are high in calcium and vitamin. So they are indicated for osteoporosis, for clients with osteoporosis na may mababang calcium. So 92 cut. 5, 4, 3, 2, and 1. 93. A teen older client diagnosed with osteoporosis. What should the nurse include in the discharge plan for this client? Encouragement of gradual weight gain. So, ayan, since weak na nga yung bones ng client, this may be, may lead to risk for injury. Okay, kapag nag-weight gain pa siya, kapag bumigat siya. Okay, so this is negative. Monitoring for decrease urine calcium. Okay, so, pa-discharge na nga siya. So, paano niya ma-measure, di ba? Yung urine calcium. So, negative din to. Instructions relative to diet and exercise. Yes, this can be the answer. This is positive. Pwede naman talaga i-include yung diet and exercise sa instructions. Safety factors when using opioids and non-steroidal or NSAIDs. Ayan. So, pwede rin to actually kasi they are associated yung opioid and NSAID sa bone loss. So, syempre, safety is priority. So, ito yung pipiliin natin sagot. 93 daw ka. 5, 4, 3, 2, and 1. Okay. A healthcare provider prescribes Forteo or teriparatide, a parathyroid hormone agonist for client with osteoporosis. What should the nurse consider before administering this medication? So yung teriparatide, ayan, PTH hormone agonist nga siya. It enhances bone microarchitecture and increases bone mass and strength. So, ano consideration natin? Hindi naman required to have an increase intake of vitamin A. Kasi too much is associated with bone loss. So this is negative. So this is correct. It prevents existing bones from being destroyed kasi nga it increases the strength and bone mass. Sunscreen should be avoided kasi ayan, kailangan nga i-promote natin yung exposure to the sun so that vitamin D can be converted in the skin. Vitamin D helps in the absorption of the calcium. Okay, so this is negative kasi nga it should be avoided. Osteoblastic activity is stimulated more than osteoclastic activity. Ito naman, this is indicated in Fosamax. Okay? Ayan. So, hindi siya sa teriparatide or Forteo. So, the answer here again is boy. 5, 4, 3, 2, and 1. 95. A nurse is counseling a postmenopausal obese client how to prevent bone loss. Which statement indicate understanding of the strategies to prevent bone loss? So this is positive yung hinanap natin. I must go on a strict diet. So, hindi maganda yung strict, di ba? Tsaka, it is known to to restrict calories. So, mas nagpaproduce yun ng hormone na leptin, which stimulates bone loss. Okay? Pag nag-restrict ka ng calories, mag-produce siya ng hormone na leptin, which stimulates bone loss. So this is negative. Ang recommended na daily intake ng vitamin D ay 800, okay, not 400. So this is negative. Ang recommended ay 1,200 of calcium daily, and so this is positive. Pwede naman tong swimming or bike, but it doesn't increase the strength or the mass of the bone. Okay, so this is negative. Aerobics, ayan, yung mga weight-bearing exercise, it is recommended kasi they increase bone mass. Okay, so this is positive. So, hinanap natin may positive, that is 3 and 5. Okay, cut. 5, 4, 3, 2, and 1. And konti na lang. Situation, ortho nurse, encounter several ortho disorders. Expected to know the different nursing interventions and treatment modalities of the various problems that you encounter. After being admitted directly to the surgery, a 75-year-old client who had elective surgery to replace an arthritic hip was discharged from the PACU. The client has been on ortho for several hours. Which type of planning will be the least useful during the first shift on the ortho unit? Okay, so useful ang initial, ayan, na planning kasi nga first shift pa lang to. As well as yung ongoing, ayan, kasi depende yan sa shift di ba? And yung discharge. Yung discharge, it is started at the on admission. So, positive yan kasi nga first shift pa lang. Strategic, ayan, mas appropriate to sa organizational planning. So the answer is DOC. 5, 4, 3, 2, and 1. Wait lang, balikan natin yung calcium. Wait lang. Okay. Alam ko may mga different indications in a client has fractured mandible that is immobilized with wires. For which life-threatening post-op problem should the nurse monitor this client? So ito yung mandible. Ayan. So i-monitor daw natin life-threatening post-op problem. Ano yung life-threatening dito? So these are both infections, yung A and C. So generally, they are not life-threatening. Yung bronchospasm, they're not common in fractured mandible. Okay, so ang life-threatening dito ang vomiting because of the risk for aspiration. Okay? Ayan. So, risk for aspiration of vomit that can be expelled due to damaged jaw leads to asphyxia or pneumonia. Okay, 5, 4, 3, 2, and 1. 98. The nurse is discharging a female client from the hospital who has diagnosis of thoracic 11 fracture with cord transection. The nurse has provided home care instruction to the client, which action indicates the need for further teaching before discharge. So something negative. Ito naman, hindi naman affected yung reproductive niya, reproductive function niya. Okay, so the female client remains fertile during reproductive years. So this is negative. The client states that she will be careful to not eat as many dairy products. Yes, this is positive because this promotes the formation of urinary calculi. Client verbalizes the need to eat her meals at the same time every day. So recommended naman, wala namang masama dyan. The client states she will wash her hands, her perineum, and the catheter with soap and water before performing self-catheterization. Yes, this is positive to prevent infection. So ang answer dito ay apple. Okay, 5, 4, 3, 2, and 1. Ibuprofen 400 orally 4 times daily prescribed for an older client with diagnosis of RA. The client asked the nurse about the amount of medication prescribed. The nurse responds based on understanding. What about this prescribed dosage? Okay, so ang normal adult dose for an older client of ibuprofen is 200 to 800, 3 to 4 times a day. Okay, so yung 400, it is normal. Okay, the answer is apple. 5, 4, 3, 2, and 1. 150-year-old patient discharged after a week of IV antibiotic therapy for acute osteomyelitis in the right leg. Which information will be included in the discharge planning? So something positive kasi included in the discharge planning. How to apply warm packs to the leg to reduce pain? Ayan. So ito naman. Teka lang. Ayan, kasi kapag warm, and this actually increase swelling. So negative to. How to monitor and care for the long-term IV catheter? Ito naman, this is actually positive kasi yung treatment ng osteomyelitis, it is usually through IV. Okay, hindi siya oral. So, X na tong dog. Tsaka long-term siya. Okay? Usually, it is for several months. And the patient needs to recognize signs of infection at the IV site and how to care for catheter during daily activities such as bathing. So, positive yung boy. Yung daily aerobic exercise naman, this is not indicated kasi this may increase swelling and exacerbate the infection. Okay, so ang answer dito ay boy. Okay, 5, 4, 3, 2, and 1. Okay, so pre-boards 1, survive. Yan. Arat na sign na to, matulog na. Wow, ang daming aso. Cute. Thank you din. 85C kanina sa G-form. Ano nga ulit, ano to? Ito ba yan? NP5 ba to? #85, una yung hematoma. Ito ba yun? Ay, wait lang ha. Ay, oo. Tama. C nga, C. Remodeling is 5. Eh, wait lang. Hindi. Wait lang ha. Clarify natin. So, ito ulit yun. Hematoma, yun yung una. So, una yung 4. So, X na tong boy and dog. And yung last yung remodeling, which is 5. So, tama to. Hindi last ang 6. Bone formation is pang 5 lang siya. So, ang answer dito is apple. Okay? Yan. Takitama na lang po. Yeah, survive. Congratulations, guys. 39. Wait lang. 5, 4, 3, 2, and 1. So, 85 again is apple. Okay. Clarification. 39. Kala nga. Yung iba na wala ng questions, you may go na. Okay, para makarest naman kayo. Ayan. So, ito, may assume blame for parents' departure. This is true for infants. Okay? Ito ba yun? And then, ito namang may respond to disruption. Ay, wait lang. Hindi infants. Wait lang. Hindi infants to. This is in preschoolers pala. Yung apple, preschoolers to. This is true for preschoolers. They may assume blame for parents' departure kapag nadedeploy yung parents. And then, true din sa infants kapag nagre-respond sila sa disruptions in their schedule. And then, ito naman, normal tong cat, more aware of potential dangers to parent sa school age. So, this is true. for them. Ang hinahanap kasi natin is untrue. Ang untrue dyan, itong dog for school age, di ba? For school age to, untrue to, kasi they exhibit more regression than irritability. Okay, so the answer here is dog. Okay, 5, 4, 3, 2, and 1. Ano to? Ano nangyari? Ayan. Kulang daw sa ligo kaya nagkamali. Maligo kasi guys. Yung calcium, ano ulit number yon? Thank you din guys. Thank you Ma'am Belle. Anong number ulit yun guys? 85, 86 and 95. Sige, sige. Tingnan natin yan. Wait lang po ma'am. Sorry po. Wait lang. '86 no? And 95. So, okay. Yung boy, it is indicated for adults 51 years and older. Okay? Yung 1,200. Ito. Okay, so pakitandaan to ha. Pakitake note. Tapos puntahan natin yung isa. Yan. 5, 4, 3, 2, and 1. 1,200 for adults, 51 years and older. Postmenopausal women, 1,500. Puberty naman, 1,300. Okay? 1,200 ulit for adults, 51 years and older. Okay, 5, 4, 3, 2, and 1. And then yung 96 ay 95. Okay? So, yung calcium to, no? 1,200. Oo nga, no? Postmenopausal 1,500. So, dapat negative siya. Okay, wait lang. Six. May denial pa eh, no? Teka naman. Wait lang, sorry. And so, rational dito, as much as 1,500 milligram for postmenopausal women may be prescribed. The recommended adequate intake level of calcium. Wait lang ha. May correction dito. Okay? Wait lang. Sige, magulo nga. Since po correct din sa kabila yung ang 3. Anong 3 ang correct? Oo nga, may 3 din lahat ng choices. Okay. Oo nga. Sige. Lahat daw ng choices dun sa kabila, yung 95, lahat ay may 3. Okay, so, baka ang tamang sagot dito ay 1,200. Sige, clarify ko na lang yan guys ha, for 17 na. Sige, wait lang ha. Ito kasi yung sabi. Okay, gets ko na. So as much as 1,500, pwede ibigay yung calcium for postmenopausal women. Pero, ang indicated, yan, for 51 years and older, 51 years and older, di ba? 1,200. So, pwede pa rin ang 1,200. Pero ang sagot pa rin dito sa 86 ay dog, 1,500 kasi Ito na yung maximum na pwedeng ibigay, 1,500. Okay? Yan. So, ayun. Ayan. So, thank you so much, guys. Thank you so much, Ma'am Belle. Pasensya na po. And Sir Ron. Ayun. So, thank you. Thank you po. Ayan. Good luck, guys. And to top the board exam, yun yung goal natin. Good luck and pagpipray ko kayong lahat. I see you again in our next ratio. Bye-bye.